Well, first of all, I just want to say welcome to everybody and thanks for joining us for the 2021 Virtual Medical Student Symposium. We didn't get a chance to have this meeting last year, so I think everyone's really excited to dig into these topics. My co-lead for this is Gannon. Gannon is Associate Program Director at Denver. I oversee the fourth year of medical school at Ohio State. We have a great agenda, I think, for you guys today. So, I think this will be pretty informal. This is what the agenda looks like. He and I put some breaks in here that I think we can vary the length of. If we need to go long or go short, we can kind of adapt as we need to. I think we want this to be informal from the standpoint of if you guys have questions, he and I will moderate the chat and we can get those questions answered for you real time. We have an interactive lunch scheduled with a lot of different program directors, clerkship directors, associate deans, and other people that can answer your questions. And then at the end of the day, we realize that really advising needs to be individual to the student. And at the end of the day, we have breakout sessions with military representatives, international medical grad advisors, osteopathic advisors, and others. So at some point in the afternoon, Gannon's gonna poll the group probably through the chat to see if you guys want to participate in the optional breakouts at the end of the day. Gannon, anything else about ground rules that you want to mention before we introduce Dr. Jazandi?
No, I think like Nick said, please use the chat. If we're sitting here for the next 8 hours just speaking into the void, this is going to get old. So we want this to be a community and a discussion. We are going to launch a quick poll right now just to get some idea of who's here in terms of kind of tailoring some of this stuff. So I will launch that. We'll give about a minute or two for people to just give us some quick demographic information, and then we'll get started with our first session.
And I stopped sharing. Mike, if you want to throw your slides up, you can.
Well, I was also muted, so that wasn't helpful. Can you see my slides, or do I have to go through Juno to? Yes, got to get a thumbs up.
Those look great.
Thank you so much to Nick and Gannon for having me back. It was a pleasure to speak at this forum 2 years ago. I love working with medical students. One of the greatest joys of my career is helping students get matched. Because of that, I run a podcast with Allium called Emergency Medicine Match Advice. So I really do enjoy this part of my job somewhat singularly, and I'm really excited to be here. So thanks for having me back. And we're going to just do a little whirlwind tour. Oh, I opened a PDF, darn. We're going to do a little whirlwind tour of the match and some of the things I think that you will be most interested in. How competitive is emergency medicine? How do you compete in a competitive game? And then when should you click those milestones throughout the season? So let's get going. And I start a lot of my talks with either a definition if a word is confusing, or the 3 things I want you to take away from my lecture right up front. So here are my 3 rules. I want you to match the very best place you can. There are different residency programs. They're not all the same. You'll hear this nonsense all the time because of the big bad RC. They're all the same. They're not. You'll see that in student boards. So there is a gradation. I want you to get in the best place you can get. I'll acknowledge, though, that there's no best program. There's no #1 program out there. There's no real rankings. Doximity also not a very good ranking system. So it's about what you want and where you're going to be the most effective learner, and that's going to be the very best place for you. So just think about how you approach the season, and don't worry about big name programs versus not. And the ones that have been here for 30 years, the ones that are brand new. Just find the very best place for you, and that should be your number one. All right, so let's get moving here. So the application, I'm going to just give these questions for a bit of reflection. There are some students earlier in medical school on this call, and you have to question whether this is the right specialty for you. Can you deal with uncertainty? Can you do shift work? Can you do shift work when you're older? Do you think that that's going to be a difficulty with whatever family plan that you have? Thinking about the undifferentiated patient and going through the diagnostics, is that something that makes you happy? Or do you need to have more treatment as the focus of what you do? Do you need to see your patients longitudinally or not? So, these are some of the common questions. Make sure that you're reflecting on them at each point of the application process. When you're writing your letters, when you're seeking letters and having conversations with your letter writers, and most importantly, in your interviews. You want to come across as authentic because you've taken the time to really reflect that emergency medicine is correct for you. And we program directors can tell when a student really belongs in neurology. Like, we can tell during the interview. It's a program director superpower. All right, so just how competitive is emergency medicine? Now, there's an old adage that emergency medicine was really competitive. And I've got 2019 numbers here. I apologize, I don't have all the 2021, so I just left the 2019 numbers. There's been another 40 programs added to this list and another 500 positions. And the ratio of filled to unfilled and filled by what I'm going to call LCME seniors. An LCME senior is a senior at an LCME or allopathic medical school in Canada, Puerto Rico, and the United States. Anyone who's not a senior in those medical schools are called independent applicants. So the percentages of LCME students that fill programs is one marker for how competitive a program might be. So that's why those numbers are there. And these ratios have stayed rock solid in 2020 and 2021, such that there's a logarithmic uptick in the number of residency applications filed, because of, in some cases, this perception that we're really competitive. So if the numbers stay kind of going up and they sort of look the same every year, then we carry on the perception that perhaps we are actually in a competitive specialty, and that's actually not true anymore. And this fill rate by the LCME is what tells us. We used to be in the world of surgery and OBGYN, and our fill rate was usually in the 70s. In comparison, let's say diagnostic radiology, cardiothoracic surgery, they fill almost every single position with an LCME senior. Their fill rates are in the 90s. Internal medicine and pediatrics, much lower, probably, family medicine under 50%. And, medicine peds just, a little bit above 50. We lived with surgery and OB. We were like a moderately competitive specialty, but because we've added so many new programs in such a short period of time, we've diffused opportunity a bit, and there isn't the same increase in demand. So our fill rate has dropped into the 60s, and it's even lower this year. It's just north of 60. So it's not that competitive a specialty really anymore. So that's helpful when we consider the two most important topics to frame this day, and that's strategy and competitiveness. I'm going to define both of these terms in some fun ways, and I'm going to show you how they can help you match in a higher part on your rank list, if not your very best program. So let's define strategy. I love defining words at the beginning of my talks. So strategy is a plan of action. I really like the art of war. It's the art of planning and directing military operations. It's a game plan, an action plan. So that sounds really fun, right? You're going to enter the interview season armed. You're ready to go to battle with the process. And, and I think I felt that same way when I went into fourth year. So, let's put a word to it, and that's being strategic. And I'm going to tell you a little story about being strategic. And this is my daughter, Abby, who's now 13, but she was 5 in this photo. And we took her to the Lincoln Park Zoo in Chicago for the Easter egg extravaganza. It is by far the best Easter egg hunt around. They fill a big section of Lincoln Park with eggs. And my daughter really wanted all of the eggs. I mean, really, she would have taken them all home if she could have. And there were thousands and thousands of eggs. But at least she wanted to fill her basket, and she wanted this gold egg. This was like very important. And I was there on single parent duty, so I thought, oh my God, if she doesn't get all the eggs, this is going to be terrible. And if she doesn't get the gold egg, it's going to be extra terrible. So I went into strategy mode with Abby, and you see, this is the little yellow ribbon that holds the children back as they cross the swan pond to get to the eggs. And I said, Abby, look around. All of these kids will stop at the first egg they see. Do not do that. Run past the eggs. Run as far as you can, as fast as you can, and work your way back. Everyone dies at the cornucopia, right? Hunger Games. So Abby got a ton of eggs, so many that she had them stuffed in her pockets. And when all the rest of the kids came to the back of the park, their baskets were like half filled, and she took pity and like put an egg in some kids' baskets, but not others. She was very interesting that day. But why did she get so many eggs? She had strategic success because she had an advisor. She had me, and I knew how the game would be played. I knew what her strengths were. She's very fast. I discussed her goals ahead of time. I knew she wanted the gold egg. I set realistic expectations. I told her that you should only fill your basket. You shouldn't get an overfilled basket. She trusted me, and we co-designed a strategy. So you can see the analogy here. You cannot go into war without an advisor and a battle plan. And you should not be doing this by yourself. You don't go into war alone, you go into war with your friends. So trying to do this by yourself in the ways that are listed on this slide that I'm not going to read to you are important strategic errors that may risk your ability to match in emergency medicine. I'll say that over and over again. It will risk your ability to match in emergency medicine if you try to do this alone. Certainly there's a couple students from, here and there every year that can kind of get through the process without talking to their NIC or their Gannon, but it's very rare. And when they don't talk to their NIC or their Gannon, the letters look odd. The application looks odd. Something's different about the student. The program director can kind of put those pieces together. Well, then why did the student not seek mentorship? Why were they acting differently than the rest of the cohort? It will risk the match of even the best of students. I've seen AOA students who thought that they were, untouchable in the Battle of War analogy, and they didn't match because they didn't seek good advice. So who can give you good advice? People who are intimately aware of the process can give you good advice. So those people are residency leadership and the residents, and they know two different things. Residency leadership knows all the numbers I just told you, and they can take those numbers and contextualize your application and decide if you're competitive. Residents have no knowledge of that, and this is important, they have no knowledge of your competitiveness. So when you work your first sub-I shift with one of the interns, and you inevitably are going to start talking about the application process. It's in the DNA of every fourth year medical student is to ask the interns about this process, and that's good because they want to talk about it. But they'll always be polite, and at the end they're going to be like, "Man, bro, man, you're going to do great. You're like super competitive," or however they talk, and they have no idea if you are or you aren't. They're not the ones reading the applications. They have no idea what the numbers are. But they can tell you what the brand experience was when they went to these various residency programs. Their initial impressions really matter, but their assessment of you does not. So these are really important sources of information, and they dispel some of the big warnings or rumors that are out of the interview trail. What you hear from other students, I find it so fascinating. So all of the students, when you interview, you'll be held in some room where they give you like breakfast and lunch. And, the interviews will be in other offices with faculty, and they'll come and get you. And, when there's faculty around, the behavior and the topics are totally different than when the faculty aren't around. And I know this because I would send my secretary in to listen when I was the program director at Northwestern. And there would be students who would badmouth U of C and badmouth Cook County while they're sitting here in my lobby. And I thought, well, that's terrible. I don't want those students. So the rumor mill can really backfire. It can leave bad impressions at the program that you're at. And then it's rumors. So, just because one student believes a fact to be true does not necessarily mean that fact is true. So you should check that fact with your mentor and advisor. So you can see where I'm going with this. Lastly, I want you all, since you're in front of your computers right now, I want you all to go to studentdoctor.net. I'll wait just a second. So pull up an open window. And as you sort of listen to the rest of my talk, navigate around and delete that account and stop looking at it. It's written by medical students for medical students, which sounds really great, except medical students do not know how the residency application process works and are not intimately aware of the numbers nor the impressions of residency programs until they put foot to ground or Zoom to face. So some of the advice is fine, but not all of it. And I've read terrible, terrible advice on there and thought, my gosh, how many hundreds of students just read that and are going to believe it and are not going to seek some guidance from their advisor to make sure that what they heard is truly factual. So if you haven't already, delete studentdoctor.net. You'll be a happier person. You'll have more time in your day. It'll be wonderful. What site should you go to? I said that I host a podcast on SoundCloud. We used to do it on YouTube Live, which is why you see faces here, but now it's on SoundCloud. It's called Emergency Medicine Match Advice. It's sponsored by Academic Life and Emergency Medicine. We have an episode for just about everything in the process: how to get a letter, how to get honors, how to send post-interview notes to the program directors. We've got it all covered. And I highly recommend this series. It's designed to get good advice. So it's myself and Michelle Lynn talking to 3 program directors, 3 different ones in each episode. And they are the experts in the process. So we learn a lot from them. And I think the students take a lot away from these episodes. So I'm going to shamelessly self-plug my own. I can do that, right, Gannon? Like they do that on like the evening comedy shows and stuff, right? You do a plug for your own stuff. I did my plug. All right.
No disclosure.
So, no disclosure. So that's right. I don't make any money off it. There's nothing to disclose. All right. So that's strategy. So strategy is knowing the right people to go to war with. Competitiveness is knowing your strength relative to everyone else on the battlefield. Can you swing an axe as good as everyone else? Now you know the rules. Your mentor taught you the rules. Are you as good as everybody else? So let's take this topic of competitiveness and go back to that LCME fill rate. This is the 2019 numbers. You can see, we've never made the list of the 90 percentiles. These are all the surgical subspecialties and oftentimes the radiology options. But we live down closer now to internal medicine and pediatrics, certainly. And you're going to get that confused, perhaps, if you look up this data with fill rates that will change over time and can be deceiving. So one year, preventive medicine might be on the list. The next year, they're gone. 1 year, general surgery is on the list. The next year, they're gone. And you can assume that they have a little bit of fluctuation, but sort of understanding where emergency medicine sits relative to other specialties, I think, is important. Now, you also have to compare programs to programs and compare yourself to other students. And the old reality was that there were many students who work in a match in emergency medicine. There weren't that many programs, and supply demand was such that the best students went into EM. The new reality is I think students underestimate their ability to match. I think every student on this call will find a home in some emergency medicine program, as long as you play by the rules and work with your advisors. So again, students who don't match lack advice. Students who don't match lack diversity in their list of programs. They are often geographically limited, or they're limited in scope to just one type of program. They just want to interview county programs, and there's so many others out there. They are only looking at research powerhouses, and they're not looking at a community hospital that may be even better for them. So these limitations, couples match, these are all the kisses of death. So how to avoid these things is, each of them is a little bit of a strategic decision. You can't just say, well, send in more applications. That'll solve the problem. That's not necessarily the solution for each of these problems. It's usually diversification of your list and taking some things off your list instead of increasing your list. But you'll only know that if you work with your advisor and your mentor. So again, the trusted people are the ones to trust by definition. Don't trust other people in the medical school. They're going to fool you. They're going to look like they're trustworthy. They're older and they have gray hair and they have lab coats on all the time in a dean's office. I'm not sure why. And they look very trustworthy, but they are not, because they do not know how the process for the residency application process goes every year for our specialty. So just think about who you're getting your knowledge from. It's not your uncle at Thanksgiving who's an orthopedic surgeon. That's bad advice. So how do you assess your competitiveness relative to your peers? It depends what you're competing for, right? So when Abby was running for the eggs, she's really fast at that age. So I knew she could outrun a lot of those kids. So, you know, that she was competitive in that manner. If you are an LCME senior, you are at least an average to above average student if you have average grades at your medical school. At least above average to above average, because there's so many osteopathic and international schools, and not to belittle them, but there's just a lot of them, and they're often not ranked in the same way. So you're already starting with an advantage as long as you don't have a red mark on your file. Class rank can help you decide whether you are competitive, and I think, you know, we all know that if you're in the top quintile that you're above average, and congratulations, don't be cocky. If you're in the middle quintile, that's okay. Average is good in emergency medicine. I just told you it's not that competitive, and that everyone will find a home. The average student is going to make a great emergency medicine doc. And if you're in the bottom deciles or centiles, again, emergency medicine match may be at risk, and you do need to work extra hard with your advisors because class rank will, you know, it will determine. It will determine whether you get interviews. All right, now this one's even worse. And, you know, I'm going to take this slide out in a couple of years when it goes past fail. But step one is a criterion referenced exam, not a norm referenced exam. Therefore, the statistics are different. If you get a 249 and a 208 within one standard deviation of the mean, these are statistically speaking the exact same score. Now, we don't use them that way. We think about them linearly, but statistically speaking, they're the same. So if you beat the mean by a standard deviation or more, wow, like that's a big deal. And those students should be noted by program directors in the process. If you fail or you're below by a standard deviation or more, that's concerning. So this just takes us to the final question of how many programs should I apply to? And those magic numbers, how many, are going to depend upon the factors of where you want to live, the types of programs that are interesting to you, and your competitiveness, but which you won't know until you sit down with your advisor or your mentor. So this is my last slide. It, you know, it acknowledges the difference between strategy and competitiveness. And I think there's some pearls to both of these approaches when you're entering the season and trying to find your way. I always liked being actually in the ballroom so I could talk with the students afterwards. So if any of you want to continue talking about any of these topics, I'll join the chat box for a while, and I'll be at lunch as well. So thank you for having me again. And yeah, it's pretty early on the West Coast. I'm just gonna remind everyone of that. All right, thank you.
Thanks a lot.
Thank you, Dr. Gisandi. That was an excellent talk, and I think tons of really, really practical, great advice. And thanks for getting up early to be here with us.
Thank you.
No, really, thank you, Fred.
Well, next we have Kathy Hiller. Kathy, are you in the room? So Kathy is recently moved to Midwest over here to Indiana near me in Columbus. So Kathy is at Indiana University Emergency Medicine and is going to talk to us about residency and practice options in EM. So we'll allow her to get going, but also thank Mike Gisandi for agreeing to stay on for a little bit to answer some questions in the chat. So thanks for that, and it was a great talk. Kathy, are you able to share your screen? Awesome.
Thanks, Dr. Kman, and also Dr. Sungar for inviting me again to the Medical Student Symposium here at SAEM. I only caught the last few slides of Dr. Gisandi's talk, but as always, he's a dynamic and wonderful speaker. Thanks for joining us so early from the West Coast. I'm going to share my screen. Please give me a thumbs up if you're able to see it. Awesome. And As Nick mentioned, I recently moved to the Midwest from the University of Arizona, and all of my slides were University of Arizona, beautiful southwestern sunsets. And so I decided to go for a crimson and cream Indiana University theme. And looking at it now on a big screen, I realize it's definitely more scarlet in honor of OSU.
Go Bucks.
All right, we're going to talk a little bit about options in emergency medicine. All right, so all residencies in emergency medicine are not created equal. You actually have a lot of different variables to consider when you're generating your ERAS list, your interview list, and ultimately your rank list. So we're going to talk about some of these variables today and which ones you really actually need to pay attention to and which ones maybe not so important to you. So by far and away, the number one most important factor for most students applying to EM residency is location. And when you think about location, think about a couple different variables or aspects of location. Will it fit with the rest of your life? So if your whole family's in the Midwest and you're planning on starting a family right away and you definitely want the support of your people, then you may not want to go to California or to Arizona or to New York. Vice versa, if surfing is your passion and you would not be a healthy person if you were not able to surf at least once in a while, then the Midwest may not be right for you. Is the catchment area of the ED that supports the residency going to give you the EM experience that you want? So if you are a knife and gun person and you absolutely see yourself doing trauma for the rest of your career, you're going to want probably a large inner city based residency with very trauma heavy experience. Whereas if you see yourself more as a more bread and butter medicine type emergency physician in the future, you might prefer a community-based program or something with a catchment area in a more rural setting. You want to think about cost of living. That came into sharp focus, I think, in the pandemic when so many people were able to work remotely. That's not going to be an option for you. You're definitely going to need to live where you are attending residency. So think about how expensive it is to live there. And then think about the market after residency in that area. Do you have lots of options to stay in the area? There are several sort of big categories of residency. So the first is academic residencies. Frequently, these are large tertiary care centers with all of the fellowships and residencies available in the world. Frequently other residencies, sometimes you have to think about whether that means you might be competing for procedures with others. So if, you know, an emergency medicine resident, a surgery resident, a trauma fellow, a CT surgery bound student are all in a room, who gets the chest tube? Think about whether other learners in the environment would enhance your learning or may detract from it because they're oversaturated. And then keep in mind, these residencies really focus on academia. They're going to talk about research. They're going to talk about teaching. They're going to talk about academic service. So if those are things that interest you, consider an academic residency. County residencies, usually, but not always, are very high volume and very high acuity. Sometimes they have less resources, may not have the newest and greatest glide scope or ultrasound. There's usually a very intense trauma experience, and usually these are highly underserved populations that very much benefit from the care that you provide. Community residencies, this is my shout out to Monopoly, are very variable. They can certainly be high volume, high acuity, or they could be much lower volume and lower acuity. You might consider community residencies, and some of them have extensive training in business as it relates to emergency medicine. So think about billing, EMRs, the workforce going forward, et cetera. Some of them are extensively well funded. So community residencies are much more variable. You're going to want to do a little bit more due diligence in examining what kind of community residency you might be applying to. But if these variables are of interest to you, then this might be the type of residency that would suit you. So size might be important to you. It's not important to everybody, but it could be important to you. So the minimum required for an ACGME certified residency is 6 residents per year for 3 years. That means the minimum residency size is 18 total residents, but many of them are much larger than that. So some 4-year programs have up to 20 or more residents per year. So think about having 80 peers in the same residency as you. And along with those variables, you'll have a corresponding change in size of faculty, size of facility, size of emergency department. If you're the kind of person who really enjoys small groups and getting to know each and every one of your classmates, you might prefer a smaller residency. But if you're the kind of person who prefers hearing and seeing lots of diverse approaches to teaching and learning medicine, then a larger residency might be of interest to you. I put this EKG up here, and I am certain it's obvious to everyone on this Zoom that this EKG makes absolutely no sense, as does the term reputation. So if you ask 5 of us on this call, which are the top 10 programs in emergency medicine in the country, you're going to get 5 different answers. So RRC, which is the Residency Review Council, accreditation is the gold standard for EM residency. If the residency is accredited by the RRC, then they meet the standards for residency and they're going to be just fine for you. So 3 versus 4-year residency. I actually went to a 4-year residency. The 4th year really wasn't as much of a burden for me at the time. I was a single woman with really not a whole lot of obligations outside of my education. But there were definitely people in my residency who literally called it the $250,000 mistake. So again, if that 4th year is critical for you for something else, you might consider whether a 4-year residency is in your future. On the other hand, the RRC, like we just talked about, won't accredit a program unless that 4th year actually adds value. So if you're looking at a 4-year residency that does something unique, specific, and important to you with that extra time, then that might be the right program for you. Also think about when you're comparing 3 versus 4 years, what your plan might be after residency. So if you're planning on doing a fellowship and you know that out of the gate, is the extra 4th year worth it for you? Will it make you more competitive for that fellowship, or will it simply be one more year of time drag that you already know is going to take time after residency? And then obviously on a personal note, there might be other priorities in your life that are competing for time. So think about whether that 4th year is worth it during your, mid-20s. Again, the RRC has to justify why the program has to justify to the RRC why they're offering a 4th year, and they love to talk about it. So if you're considering it, just ask and see what their philosophy is about why a 4th year. Combined EM residencies. So this is an interesting animal, right? In order to qualify as a combined EM whatever residency, that program actually has to meet the requirements of each of the components. So EM Peds has to make sure that they meet the components of emergency medicine, but also pediatrics. Because there's a fair amount of overlap between those two, they can shorten it, usually to about 5 years. There are combined EM residencies with Peds, IM, FM. And my advice to you, if you're thinking about one of these things, is number 1, find a mentor who knows what it means to be an EM, whatever, resident and to have that program. You have to have a really clear plan before you apply why you need and want both specialties. This is a unique niche and you definitely need a mentor to help you navigate it. And that's the last of my slides, but I'm happy to stay on and answer questions if anyone's got it.
Thank you, Dr. Hiller. I think that was a great overview of a lot of the things to consider We have a few minutes. If there are any questions, feel free to throw them in the chat or just speak up. We'll give like a minute or two for people to muster some courage. Otherwise, we'll move along to the next session.
Can I ask you a question, Dr. Hiller, about, do you get the sense that, I've been doing a lot of advising in the setting of the report on the job market in EM, and the students seem to care more about, and this is great for our students to have this much foresight, because I think when I was a student applying to residency, it was just about what my intern year was going to look like. I was kind of not 3 steps ahead, but just 1 step ahead. Do you get the sense that a 4-year program, a 3-year program, community, academic, 3+1, any of those is better for, you know, the 10-year job market? And, you know, are you advising your students towards one program or another in light of that?
Yeah, that's a great question. Thanks, Dr. Kaman. I see a question in the chat that mirrors that as well, regarding 3 versus 4-year programs. And I will say there is one scenario in which graduates from a 4-year program win out over graduates from a 3-year program. So if you are intent in having a faculty position at a residency after you finish, that is a 4-year residency, you absolutely need to go to a 4-year program. They're not going to hire a graduate of a 3-year program who has the same experience as their 4th-year residents. Apart from that, I really think that the difference between 3 versus 4 years has more to do with academia and subspecialty. So if you have a specific interest in a particular topic. Lots of questions about the workforce study that came out. I'm guessing I'm not the only one to feel this conference. And certainly there is a lot to talk about. With regard to types of residency programs, I think, you know, we're really beginning to understand a lot better what it means to have a program that is a community program, and how it interfaces with business. It's not an easy concept to describe. It involves lots of complexities. For you guys as students applying to residency, I think I would really think about the variables that I've mentioned in this talk. Think about location, think about what type of setting it is, what type of community you're going to be practicing in. A lot of this, I think, is gonna hopefully wash out. Fellowships become necessary to secure a job. Boy, that's a great question. I don't know that I have an answer to that. Do any of the other folks with more experience than me on the call have an opinion?
I don't. I will say that because of COVID and the, you know, just uncertainty of the last year, not the, you know, 10-year projections, more than half of our graduating residents did fellowships this year. I think just like a 4-year program adds a year to your training, a fellowship adds a year to your training. So we actually have a talk in the afternoon where we have a panel of people with different career niches that I think we're going to dig into that a little bit more. I wouldn't do a fellowship just to do a fellowship. I mean, I think if you have a niche that you want to, you know, spend your career in, and you think it's going to make you more marketable for a job, I would do that fellowship. But I don't think, you know, your community program, you know, in the suburbs is going to look at somebody who has a fellowship over somebody who doesn't and pick them for that reason. That would just be my thought. Mike, I saw you unmuted. Do you have some thoughts?
Yeah, I'll share. You know, I think of fellowships like a really, really great junior faculty position where you're given a couple years. We have all our fellowships are 2 years now. They all come with graduate degrees that we have stipends for. We have 11 fellowships. So there's a lot of fellows running around. And, you know, they all have time. They all work 8 shifts a month. They're studying their, you know, their subspecialty. they're developing their niche and their research skills very early, and then they can hit the ground running as a junior faculty member. You don't want to be the junior faculty member at an academic shop who was never trained to be at an academic shop and then be expected to write papers and do research and things you just weren't trained for. So I think fellowship can really help there. But I don't know that it's the golden ticket to a job. I think every hire cycle is something different, right? Like we need EMS doctors this year in our staff. Last year we needed PEM doctors. So if you were the administrative fellow, you were out of luck because there was no jobs. So it depends whether you're going to kind of pigeonhole yourself, but that's what academics wants you to do. It wants you to develop a niche. That's what gets rewarded in the professoriate.
Yeah, I'll second that. And I will also reinforce your message about niches and timing and regionality. So while a lot of us are thinking about the workforce as a whole, there are definitely regional variables here. We are currently hiring like mad down here in South Central Indiana. So I think you're going to find that some of this is timing, some of this is your particular area of interest, and consider being flexible, at least for a little while. And there is a question in the chat about whether there are actually any true academic institutions, and I can assure you there are absolutely some true academic institutions. While many of them actually very deliberately take time and effort to rotate their residents in community settings so that residents have the exposure to those settings, there are definitely still academic programs that are very much academic.
Thank you, Dr. Hiller. That was great. And thank you for sticking around for some questions. We'll move on to the next session. Next up, we have Dr. Ryan Pedigo, who is the clerkship director at UCLA Harbor, and he's going to discuss kind of navigating VSAS and away rotations.
Great. Thanks so much for having me. Just give me a thumbs up if you can see the screen. Great. So yeah, I'm Ryan Pedigo. I was clerkship director for the last 5 years. I've now transitioned into a residency leadership position, still at Harbor UCLA Medical Center. And I'm going to be talking about navigating VSAS and away rotations. A lot of this will kind of build upon some of the things that Dr. Hiller had talked about in terms of looking at different programs, different types of programs, because this is the best way for you to be able to kind of see a type of program firsthand and kind of treat it as almost an extended interview, both for you and for them. And I have no relevant financial disclosures. What we'd like at the end of this talk is for just a few things. One is to have some idea of where to rotate, and that'll be different for every person depending on what their career goals are and what their medical school offers in terms of an emergency medicine experience. Know how many sub-internships to do, and that's a moving target from those who have experience with last year when, aways were put on a hiatus until now where we're looking for a maximum of 2 slows. So it depends on how many emergency medicine experiences your own institution offers and where to look for rotations. In the chat, I put 2 links. There's 2 really good resources that I always let medical students know that they should use. This is a screenshot of the EMRA Match website. There's also the SAEM clerkship directory. Both of those are in the chat. And so if you are early enough in your medical school career that you have not yet applied through VSAS, so if you're MS1, MS2, or MS3, just bookmark both those sites and keep them on the back burner. So that way, when it becomes time to apply, you can use these tools. They've gotten pretty robust. This is my program, Harbor UCLA Medical Center. You can see that LAC, USC, and UCLA, all of you are also in this LA area. But you can actually see immediately, one, do they participate in VSAS? So most programs participate in VSAS. However, some programs require a separate non-VSAS application. So it's important to know if they participate in VSAS or not, because you'll have to prepare a separate application for those schools that do not. And importantly, clerkship directors are asked to also include what rotation types do they have. So we have an EM sub-internship. We also have a pediatric EM sub-internship and an ultrasound elective. Other schools might have EMS rotations. So if you're looking for something other than just the standard EM sub-internship, you can also take a look there to see what's offered. And then there's also whether or not there are things like step 1 cutoffs, or whether or not there are any restrictions for rotation. For EMRA Match, when you click on that, you can then kind of blow it up and get the name of the clerkship director, the name of the coordinator if you have questions, if they're flexible in rotation dates. And so one thing that you'll notice as you go into your 4th year is that your medical school's rotations and all the other schools' rotations are unlikely to align. So you're likely going to have a little bit of week of downtime in between blocks sometimes, and that's okay. But if they have flexible rotation dates, then you might be able to make your schedule a little bit streamlined. It also includes interview policies. So does rotating mean you automatically get an interview? Do they consider DO students or international medical graduates? And so if that applies to you, this is really important. I wouldn't just go based off this though. If you are a DO student or an international medical graduate, I would go one step further before deciding where to rotate and look at their actual current resident list. So for instance, at Harbor UCLA, we have like 4 or 5 DO students and 4 or 5 international medical graduates in our residency program. And so if you were a DO student or an international medical graduate, what you would want to see is not only did they just check that box, but that's actually reflected in their match list. If they've never taken a DO student in the history of their program or an international medical graduate in the history of their program, you have to decide whether or not that rotation is going to be the best use of your time. Apply early. Most of us, there's unfortunately no unified release date for VSAS acceptances. There's no match process. And so what this means is when we go and sit down to actually make our decisions on who's going to rotate with us, then what we're going to have to do is make a decision and fill our spots. And anyone who applies after that date, we honestly are often not going to have as much room for them. And so try to get your application in. Usually VSAS opens on April 15th. With COVID, things got a little weird last year, but make sure that you apply early and broadly. Now, this kind of builds off what Dr. Hiller was saying in terms of choosing a rotation site. So there are, academic programs, county programs, community programs. Going to one of the earlier questions in the chat, most programs are a mix of all 3. So if their primary training site is an academic center, they likely will have a county aspect or a community aspect. However, how that training is weighted depends heavily on the program. So at Harbor UCLA, we are like 85% of your time is done at Harbor UCLA Medical Center, and we have some community rotations to give you that community experience. But by and large, you are committing to working at a county hospital, which is going to be, like Dr. Hiller said, knife and gun club, really high acuity, really high pathology. But, some of those things, like we don't focus on billing, the business of emergency medicine and things like that. And so what's really important at this point, because you don't necessarily know what you want to commit to yet, is rotating at a place that gives you an experience different than what your home does. So if you have a big county center as your home rotation, maybe you should rotate at an academic or community center. So that way, before committing 3 or 4 years of your life to a residency program, you can understand at least one instance of what that might look like. So if you have a really strong academic center for your home program, then think about applying to a county program for in a way, just to round out that experience and get a better stock of what you might envision yourself doing as a resident. And then second is fit for your application. And we touched on this a little bit when we were talking about, the filters in terms of step cutoffs in terms of if they accept DO students or international medical graduates. You really want to make sure that when you accept an away, if you crush that away, then you're going to go there. So that'll be a hard stop on your rank list. If you really impress them, you know, when they go to make their rank list, you're going to be in it. And that way that's going to be, you know, a place that you know you'll be able to go. The other thing is special interest. So if you've spent, you know, some of your undergrad or med school or had other interests in something special. So if you're really interested in social determinants of health, if you're really interested in medical education, if you're really interested in, you know, hyperbaric and dive medicine, right? This away rotation is a kind of extended interview. It's a chance for them to get to know you really, really well, and a chance for you to get to know them and their program really, really well. And it would be great if you envision yourself being there as a future resident, that they could also foster your career in whatever that you're interested in, whether or not that's, you know, peds or ultrasound or something different. When you go on interviews, every program, it's a recruitment event. They're going to be putting their best foot forward. They're going to be telling you why their program is the best. You know, they're going to be whining and dining you, or if you come to Harbor, eating in our cafeteria, which is horrible. But they're going to basically be putting their best foot forward and trying to show you all the highlights of why you'd like to train there. They're not going to be like, well, actually, we have this problem. And actually, you know, this service and our service, like we kind of butt heads a lot, right? And when you rotate somewhere, they're going to get to see the best part of you and also the maybe not so best parts of you. And you're also going to get to see the best parts of them and also potentially the not best parts of them, which gives you a much more realistic view of what life would likely be as a resident in that program. So now how many rotations? And this is always a moving target from last year to this year. So in ERAS, you can assign 4 letters to a program. Once you've assigned 4 letters to a program, that's it. You can have as many letters in ERAS as you would like. But once you've said, I would like to give these 4 letters to this program, there are no takesy-backsies. It's going in. Those are the 4 letters that that program will receive. And so in general now this year, because of COVID and the new recommendations, you're going to be looking at 1 or 2 slows maximum. Your non-slow letters, and I think there's going to be a lecture more specifically on slows and O-slows, so I'm not going to kind of belabor this point, is there are letters of rec, but the recommendation is that these are going to be O-slows, and this is basically an off-service slow. And then the 4th letter would be optional. No program requires 4 letters, but basically what you're going to be looking at is 1 or 2 slows. I would say most people will probably have 2 slows. And those 2 slows are going to basically be the maximum for this year. In previous years, people had done, you know, way too many aways, and hopefully this will kind of limit in a good way to make sure that everyone has, you know, equity in terms of the types of experiences they can get and the number of experiences they can get. So what does that mean for this year? So if you are an MS1, 2, or 3, I would definitely, before VSAS, talk to your mentors because this landscape is changing rapidly. Currently, aways concluding in July or later is okay. So as long as your rotation physically finishes in July or later, you can do an away. But again, we're going to be looking at a maximum of 2 slows. So if you do not have a home rotation, you know, you can do up to 2 aways, but what you'd like to do again is make sure those experiences are diversified. If you have a home, you can do an away. And at UCLA, and I'd be interested in the panel's thoughts on this, we have 2 home rotations. And so what we're currently doing is trying to very clearly communicate to students that if you decide to only do one of the home rotations, you know, we're not going to take that personally. We know that people need to do aways to make sure that if they have specific geographic preferences, if they have specific types of program preferences, that they can still have that valuable experience. And so we are trying to be very clear in communicating, saying if you don't rotate with us, it doesn't mean that actually we know that you don't like us or something like that. And we're trying to get them to actually do an elective later on in the year, just to make sure that we're not taking a spot from anyone else. But that's, of course, a more challenging situation. So if that is your situation, then I would just talk to your advisors to see how to best navigate that situation. So I wanted to leave some time to have people be able to talk about their own specific questions about OAs and VSAS. And, we have a very expert panel here, so hopefully we can leverage, their expertise. So I think that, let's see. So far looking in the chat, 10 out of 10 recommend Emra Match. It changed my life. Yeah. So both those search engines are great. Being able to utilize something that actually organizes things and makes cutoffs and makes kind of screening in a rational manner, I think is great. Tom had asked there can be problems with applying broadly. Absolutely. And the challenge, I think, is actually amplified by the fact that it's kind of a first come, first serve to some extent. So when our program decides we're going to review apps, VSAS might open on April 15th and we say May 1st, we're going to look at apps and we're going to make decisions, right? The challenge is that some students may actually have been offered acceptances before that. And some students might be getting acceptances later. And so we're actually sending an acceptance, but they might actually be waiting due to geographic or programmatic preferences on a different program, right? So this would be much easier if we just said, you apply April 15th, May 15th, everyone's gonna send their acceptances. That currently is not how the system works. And so, Dr. Morrissey makes a really, really important point that you don't wanna just apply overly broadly. So you want to apply, and that's where the mentorship that Dr. Gisandi had kind of talked about comes into play, is applying to the appropriate amount and breadth of places for your application. Because otherwise, if you find yourself on the day after VSAS opens with a few acceptances and they say, hey, you have a week or two to decide, then all of a sudden you're actually kind of putting yourself in a bind, because you may actually be putting yourself in a position where you have to make a decision before you actually know all the cards that are on the table.
I also just, while you're looking at the chat, Ryan, I put a link in for students who are underrepresented in medicine. There are a lot of great scholarships out there where you can apply and you get an award that would come with housing and a travel stipend. So I always recommend that to students that are underrepresented. And there's other awards that different institutions have. I know Stanford has one. So just thought I'd throw that out there while you're scanning the chat, and I'll kick it back over to you.
Yeah, no, I think that's really important. And so if you identify as underrepresented in medicine, there's a lot of financial assistance that is either on the national level or more likely at the program level. So we have a underrepresented in medicine stipend. I think actually all the programs who are represented here have one. And so that can help offset some of the economic challenges of doing an away rotation. Robert's asking about does what service or how many letters an OSLO writer has factor into its weight. So there'll be a whole talk on that, but that is the challenge, of course. As I was clerkship director for 5 years, I wrote 90 SLOs a year. So when I said someone was top 10%, that meant, I said less than 8% of those people or 10% of those people were top 10% that year. And I adhered to the SLO distribution guidelines. With an OSLO, that's a little different because that person probably only wrote one OSLO, and they so that distribution becomes a little more challenging. And I still think that we're working a little bit on how to contextualize what that means when people only write typically one OSLO because they're an off-service letter writer. The narrative comments for me personally are kind of the more important part of that. But yeah, absolutely. Veronica asks the best ways to shine on an away rotation. I think there's a talk on that later, so I don't want to steal anyone's thunder. Gannon or Nick, can I get a thumbs up if there's a talk on that afterwards? Yeah. Okay.
Yeah, we'll actually be talking about that next.
Oh, perfect. And then Justine talked about latest in away can end to get a SLO that'll be considered. So I would say it would be in your best interest to have one slow by the time the MSPE is out, because that's really when people are really going to start reviewing applications. If you get one later because of the scarcity and kind of weirdness of this year, I think that's fine. If it is substantially late for a second slow, though, I would recommend just emailing the program coordinator and saying, I'm really interested for these reasons, and I have a new slow, because otherwise that might get a little bit lost.
Nicole, did you have your hand up? Did you have a question?
Oh, I did. It was a follow-up question to the accepting spots, and sort of if you're in a bind. And I was just wondering if you do get accepted somewhere and and in this particular cycle, I'm a fourth year applying this year. So let's say you accept a program for an away in August, and then a week later hear back from a program that is higher up on your residency list. Would it be frowned upon to then cancel if you have maybe like a month or two before that rotation and then accept the other rotation? I've heard sort of a mixed response from different people, so I'm just trying to get as many opinions on this as possible.
Yeah, so I think that's a great question for this panel in the couple minutes we have before the next talk. My personal thing, so as I was clerkship director for 5 years, is if you accepted and then like a week or two later said, you know, I'm so sorry, like my schedule's changed, I can no longer like do the rotation, I was totally fine with that, because I know that this system is terrible, right? Because it's not like we're giving you all the options on day one, right? We're giving you this option on April 20th, this option on May 1st, right? So, however, if it was like a week before the rotation when I literally could not fill the slot and someone just said, no, like I'm out, then I might look slightly negatively upon that when it came time to review their residency application. Similar to how something might look if you're declining interview. If you decline an interview like a month, you know, whatever, 6 weeks before the interview date, like no problem. People's plans change, people's preferences change. If you decline an interview the night before the interview happens, you know, that's not looked nearly as favorably upon. So I'm happy to see if the panel also has some answers for that.
Yeah, I think it's probably somewhere between a week and a month. I think if you're outside of a month, you're totally safe. I think some programs may struggle a little bit with only a week's notice, just because I think in such a competitive market, you have to think about the kind of opportunity cost of you holding that spot and another student not necessarily being able to get to LA or Denver or Indiana in a week to fill that spot. So I think a month is plenty of time, but maybe as soon as you can.
We can actually have made this not a problem just by releasing everyone's acceptances on the same date, but we're not that smart or not that organized. So
hopefully one day. I think it is worth mentioning Dr. Morrissey's comments in the chat that if you're really serious about a specific program, I think absolutely it's appropriate to reach out. And Ryan, I'd be interested to kind of hear your experience with that as a clerkship director. But
yeah,
I would be wary about doing that to too many programs. A theme that comes up in this symposium every year is that the EM world is small. We know each other, we communicate. And if you reach out and say, gosh, I really want to rotate with you all, and then they make room for you, and then you say, well, you were actually second on my list, so I'm going to rotate somewhere else, that would be something that I could see kind of being at your disadvantage.
Yeah, 100%. If we're your top choice for rotations, you know, we got usually like 9 to 10 applications per spot that we were able to offer. And it's really, really hard to differentiate students, because VSAS has some limitations. We only get like half of your third year transcripts because, you know, your transcript's released before you finish your third year. You know, we have very limited information. If you're really interested for a specific reason that's not obviously apparent on your application, and we were your number one choice, and if we offered you a spot, you would take it, then 100%. We should reach out and say that. If you said that and then the day afterwards we offered you a spot and you're like, oh, just kidding, then that might look a little bit not ideal.
And I would just emphasize the specific reason thing. I think a lot of times a student wants to be in a city for, you know, a reason that wouldn't show up on the application, like you said, Ryan. So my sister lives in Chicago, or my family's in Columbus, or you know, those personal reasons we take pretty seriously, because, you know, that might be a reason why someone would come to that program. So, you know, if you have a personal reason to reach out to that program and say, my grandparents live in Jacksonville, and so I really want to, do my away rotation there. I think programs take that very seriously. It's kind of like when you reach out because you haven't heard about interviews. If you send everybody the same generic, hey, I'm really interested in your program and I haven't heard from you, that's not going to get the same response as, I haven't heard from you and I'm really interested in your program because of these specific reasons that might resonate with a program director. So I would agree. I think reaching out is appropriate for the right reasons.
And Ryan, maybe one last question. I think there are a couple things in the chat here about just timing. I'm sure it's variable, but with your experience, what do you feel like is a normal kind of turnaround time for application to answer?
Yeah, so it's interesting because we know we're under the clock. Everyone's kind of like wanting to fill their spots. And so, usually VSAS opens April 15th, usually end of April or early May. Basically, we've taken all of our spreadsheets. We've distilled everyone's applications to make it a little bit more readable. We send those to our equity and inclusion committee for review. And they basically also will flag people that we should pay special attention to. And then usually, super early May, super late April, we actually sit down and have like a rank list meeting, and it's like an 8 to 10 hour meeting. We go through all the VSAS applications with residents and with faculty, and then we make decisions on how many spots we have for each month and like who we would want to offer in what order to each of those spots. And then as soon as we've made that decision, we just send it out, because we know that those students that we'd like to rotate with us also are going to be getting other offers, and we don't want them, we don't want to lose them by waiting too long and they've already had, more formalized commitments to other rotations. We try to give them at least a few weeks because we know that this is a weird process. And if we're earlier than a program that they might really, really, really want, like, we're fine to just be like, yeah, you can think about it for a couple of weeks. And then, if you decline, then that's totally fine, but just let us know early, and then we'll move on to the next individual. So depending on how many iterations that is, that might actually take a few weeks, because for those spots, we obviously don't want to overfill or overpromise, and so we would want to wait. And so sometimes that takes through May at least.
Thanks, Ryan. That was excellent, and thank you for answering all those questions and providing that expertise. I think we'll move along here. The next talk is actually my talk. And someone put in the chat, how do you differentiate yourself on your visiting rotation? And I think that will be the goal of kind of the next 20 minutes, is to talk about that. So just for those of you who popped on, my name is Gannon Sungar. I'm an Associate Residency Program Director at Denver Health. And I'm one of the co-hosts of the Medical Student Symposium. So thank you for being here. We're really excited for this whole day. So this talk, how to succeed on your EM sub-internship, I think could just as easily be entitled How Not to Screw Up on Your EM Sub-Internship. And so we're going to talk through some kind of general themes. And I think a lot of the talks to this point have been kind of high level and included logistics. This talk is fairly simple. And some of you may roll your eyes even at some of the advice that's offered here. And yet I warn you that we see students fall into these traps year after year after year. And so I'd urge you to kind of pay attention and try to really take home some of these points of advice. So this is a quote from a paper talking about EM sub-internships. When 4 weeks of your time might dictate the next 3 to 4 years of your life, you want to make sure you cover all your bases. And I think there's a lot of stress in the application cycle. I'm not trying to increase that stress, but I think it would be naive to not recognize it. So these rotations, these months that you spend are critically important to the success of your match and your future career. We can look at this. This was a study done in 2000. It was a survey of residency program directors in emergency medicine. And they asked what factors are most important when selecting residents through the match. And the number one factor was emergency medicine rotation grades. So this was the SLO that you got. That's the number one factor that program directors looked at when considering applicants. If you want to look at how you do research, they about 20 years later, they just repeated this exact same study. They changed the scale, but found the exact same result. And so this is held up, that the 4 weeks you spend as a visiting student will be critically important to your application. for your emergency medicine residency. So how did I gather this advice? So personal bias, absolutely. These are things that I saw students stumble with or saw how students really differentiated themselves. I've been a part of our selection committee for our residency program for the last 7 years. And so things that came up in those meetings as we talked about applicants. I surveyed our senior residents for several years. At Denver Health, our senior residents work one-on-one with our students. And so surveyed our residents to see what are the things that really help differentiate students and what are the things that students sometimes struggle with or blunder. And then as a member of the Academic Life and Emergency Medicine Chief Resident Incubator, my 4th year in residency, I kind of did a national survey of EM chief residents to get some of this the content that will be presented here. For those of you that are interested, this was written up in ALEM. It's a little bit dated now. It was published in 2016, but I think that this advice holds up. Again, these are themes that come up year after year after year. So let's dive in. We're going to start first with the kind of don't side of things. So again, these are pitfalls that through all those sources of advice kept coming up with areas where students year after year after year make mistakes that can really hurt them. And I don't want that to happen to you all. So first of all is don't be late. Again, these rules are simple, but important. I had a football coach in college who said, if you're not 10 minutes early or 10 minutes late, and despite the confusion of the kind of space-time continuum there, I think it's good advice. I think year after year, I think about like the students who excelled in high school, who worked really hard in college, who differentiated themselves in medical school, and they show up to their away rotation and they stroll into rounds 10 minutes late. And you think about all the thousands of hours of effort that have gone into getting them to that position, and then they can really hurt themselves by showing up late. And I think, you know, timeliness is kind of an important part of professionalism, but I think it also, particularly in emergency medicine, we need to recognize that being on time as in a shift work setting is really a marker of your respect for your colleagues who are ready to go home and for your patients who are sitting in the waiting room waiting to be seen by the oncoming staff. And so it's really important to show up on time. I think for me, I recommend to our students, if you're starting at a visiting rotation at UCLA Harbor, get there a day early and go check out the department and figure out where you need to be and where you need to park and the route you're going to walk or the public transportation you're going to take, so that you're absolutely certain you can be where you need to be when you need to be there. Next up, don't lie. We talked about the pressure that is associated with these rotations. And you may sit here in your seat right now and say, well, I wouldn't lie. But I can assure you that you're going to want to lie, maybe more than you ever have in your career when you're on these rotations. As a 4th year medical student, you guys are all smart and you're hardworking, but there will be things that you miss. There will be questions you forget to ask. There will be exam findings that you forget to elicit. And when your senior or your attending says, that patient with a sore throat, what did their throat look like? You're going to realize that you didn't look in their throat, and you're going to want to tell them what they want to hear. But I assure you that this is incredibly dangerous. First of all, you won't get away with it. Your senior resident, your attending, will repeat those questions. They'll follow up their exam findings, and they'll immediately recognize that you were dishonest. And then most importantly, this really harms your ability to learn and grow. And I think for me, that's a signal that is most concerning when I see students lie, is that if I bring you here as a resident, you're not going to tell me when you don't know something. You're not going to disclose opportunities for yourself to be taught, for you to grow, and for you to get better. And so I actually love it when students say, you know, I didn't do that. I'll go do that right now. I don't know that. I don't know the answer to that, or I didn't ask that question, because it immediately shows to me that they do have that ability to be humble, that they can disclose areas where they have opportunities for growth, and it discloses a learning opportunity where we can dive in and do some teaching. Don't be a jerk. This is a long quote, but it's one I like. I read this to my 2 young sons quite often, to their chagrin. But I'll read this real quick. Don't swagger. The boy who swaggers like the man who swaggers has little else that he can do. He is a cheap jack crying his own paltry wares. It is the empty tin that rattles most. Remember that the hardest thing to acquire is the faculty of being unselfish. As a quality, it is one of the finest attributes of humanliness. This is Sir Frederick Treves. He was one of the first surgeons to do an appendectomy. And I think this is good advice. I think Dr. Gisandi touched on this with applicants sitting in the waiting room and speaking poorly about other programs. Recognize that when you are in town for a visiting rotation, almost everyone you interact with is potentially evaluating you. This is incredibly important for techs and clerks in the emergency department, for clerkship director, for clerkship coordinators, for program coordinators for residency programs. Perhaps the most glaring example of this was a story that was told at court a couple of years ago, which was an applicant arrived for an interview and took an Uber from the airport and treated the Uber driver horribly. The Uber driver turned out happened to be the husband of the residency program coordinator. And that got back, obviously, and the student was not a successful match in that program. So hopefully you're not jerks, but if you are a jerk, hide it. Find a way to get through a month treating people respectfully. I think this often comes up too in student-to-student interactions. We know this is competitive. We know that there may be some desire to differentiate yourself from other students, but remember to be humble, to share learning opportunities, and really do your best to portray the team member, team player you will be if you successfully match into that residency program. Don't break the rules. I think this is another area where students can stumble sometimes, again, in an effort to really differentiate themselves. Oftentimes, senior residents or attendings will kind of have a rough structure by which they hope students interact with patients. So I'd like you to give me a phone call before you pick up a new patient. I want you to call me if a patient has unstable vital signs or abnormal vital signs, just so that I'm aware of them before you go see them. Whatever those rules may be, stick to that. Recognize that those are important guidelines, that those are about patient safety and operations that allow the kind of student-teacher relationship to work effectively. And so oftentimes we see students struggle because they want to differentiate themselves and maybe they pick up too many patients. They don't follow those guidelines in an effort to do too much. And it really can put their patients at risk, but ultimately themselves at risk too, because again, it's not somebody that necessarily we want to teach if they're not going to kind of stick to the script and follow the rules. This is the last of the don'ts, but don't forget why you're there. So as medical students, you're here to learn, but more importantly, you're here to take care of your patients. And as medical students, oftentimes you have a little bit more time. And so really dive in and invest in your patients. Spend an extra couple minutes at the bedside. Do those things to help your patients feel comfortable and feel informed. I think sometimes we see students who invest their time in the department, trying to buddy up with that attending or trying to buddy up with those senior residents and make connections and are kind of investing their time in the people who will be deciding their fate. But ultimately, we see through that, and those actions are thin. The thing that impresses us most is the students who are kind of dutiful at the patient's bedside, advocating for their patients and doing their best to serve their patients. And so ultimately that will serve you as an applicant as well. So those are the negatives. Those are the don'ts. Again, areas where students may struggle or fall into holes. We're going to talk a little bit about the do's. So things you can do to really differentiate yourself. Be enthusiastic. One of the reasons that we educators in emergency medicine are in education programs is because we get the opportunity to work with students, and kind of our passion for EM gets to be refreshed year after year after year in working with you as students. And so, we love to see the excitement of seeing a new procedure or making a diagnosis. And so bring that energy and that enthusiasm with you to the department. I think the corollary here, and I know I said no more don'ts, is oftentimes in emergency departments, we can get a little jaded and we can have some of that gallows humor or dark humor. I think it's really discouraging when we see new medical students, kind of the fresh lifeblood of our specialty coming in, who fall victim to that kind of talk, right? Talking down about patients or about the circumstances of the emergency department. And so while you may think that that could ingratiate you to your colleagues or the group that's sitting around at the nursing station, we want to see that enthusiasm and really let that shine. Perfect your presentation. So this was a theme that came up over and over again when I was surveying various sources for this advice. I think as students, we don't expect you to be able to put in a central line without supervision. We don't expect you to do a lateral canthotomy. But the one procedure or the one activity that you do every single shift is your presentation to your supervisor. And so while you may practice a central line or practice suturing, I think oftentimes we don't practice these presentations. We think that they come naturally, and they don't. And so I would encourage you, before you start your sub-internship, spend some time looking at a couple of these resources. The 3-minute emergency medicine medical student presentation is a great paper that discusses some tips and tricks for this. The rapid model, again, is another one. But practice this. Sit down and present a patient. Walk through that kind of structure that we all learned in medical school that we all expect to hear as supervisors. Really focus on presenting what's relevant, right? We want you to know all the information, but we want you to clean it up and present it to us in a manner that makes sense. And then focusing on pertinent negatives and pertinent positives. Not only does that make your presentation better, but it really helps us to understand your thinking, right? So if you tell me in a young patient with chest pain that they have no lower extremity pain or swelling, they're not on any exogenous hormones, they've never had a DVT or a PE before, immediately I know what differential you're building in your head, and you can lead me down that path towards the plan that you've come up with. So again, I would encourage you, it may sound silly, but spend some time presenting patients to yourself to get the rhythm and the pace of this, or with a partner. A challenge, no notes. This is one of the things that I challenge a lot of our students who come through. I think it's great to have a piece of paper in your pocket and a pen to be able to jot down a vital sign or a medication allergy, but the ability to take a history and physical with taking notes through that whole time is just not something that's going to hold up for you in residency. And so you may as well ditch that now. I think the students who do this, you'll find that you are smart people. You care about medicine. You can talk about something that you care about, that you have expertise in. You're not going to forget those little details when you present it to your supervisor. And really, you'll find that your history and physical exams are markedly improved when you're not looking down at your notepad to jot down points, right? You can really invest in your patient and that interaction. Take initiative. This is another thing that I tell students is on those first couple days of your rotation, show up to the department, look around, find out where the supply closets are, know where things are, and put yourself in a position to be able to get the equipment you need to be successful. I think this is not do scut work. We're not asking you to mop the floors, but one example I give is at Denver Health, we have 4 ultrasound machines and we have 7 big trauma resuscitation bays. And so we get an overhead page that an ambulance is coming in with a trauma activation and it's coming to red 1. If you're the medical student and you grab one of those 4 ultrasound machines and you bring it into that room, it shows that you understand the needs of the department. It also puts you in a position where you can do the fast exam on a critically ill patient. And so recognize that you can take initiative to contribute to the flow of the department. I think this also shows up in kind of gathering the equipment you need for procedures. Commit. So we want you to have a plan. And I think it's hard to do this. One of the things that I like to say is if you were the only physician who this patient was going to see, what would your plan be? And your plan maybe is terrible. Maybe it's to get a whole body MRI and do an LP and admit the patient to the ICU. But a plan is a plan. And from there, we can have a discussion about what the next steps are. And so really force yourself that through the end of your presentation, you present a plan. And you can say, I'm not really confident about this plan, but this is what I think that I would want to do in this case. It shows that you're willing, again, to be honest about the limits of your knowledge, and it exposes the opportunities for us to support the knowledge and your knowledge and teach. Have a goal. I think this is absolutely something in my mind that differentiates students, to show up and say, this is what I want to work on today. This is what I find myself having struggled with for the past few days. Again, this really reinforces that idea of kind of a growth mindset and a lifelong learner, that you're going to show up, you're going to continue to be thoughtful about your own progress and invest in your own progress. And those are the exact types of residents that we want to teach. Lastly, user resources. I think a number of the speakers have put resources in here. I think EMRA is amazing. There are a lot of publications and online tools that are available to you as students through EMRA. Spend some time before you show up getting used to these, understanding how you will use them on clinical shifts so that you can quickly look things up. You can have ready access to those references that will allow you to really shine on your rotations. So I know it's a quick talk. Again, I know these things feel like the things we learned in kindergarten, but year after year after year, students find themselves falling into these traps. So just to remember, don't be late, don't lie, don't be a jerk, don't break the rules, don't forget why you were there. Do be enthusiastic, perfect your presentations, take initiative, commit, have a goal, and use your resources. And that's all I got. I think we're transitioning here into a break. I'm happy to kind of stick around for a couple minutes and answer any questions. And then we're going to get started at 40 minutes after whatever hour you're in with our next session. But thanks for your attention.
I'll just throw out there just to emphasize, there was a question in the chat about, do I have time before I present my patient to look a few things up? I would say not only do you have time, but that should be a part of your workflow. So, you know, when a student presents a patient to us, we're going to ask some questions, right? So, you know, think about what your differential diagnosis is, think about the pathophysiology that's going on with the patient, think about what the treatment options are. Obviously, I love commit to the plan, but, you know, if you haven't thought about those things before you present, that's, you know, I don't want to say a red flag, but, you know, we definitely want you doing that. So, you know, most of the time the attending is going to be running around, you know, taking care of other things, and you have plenty of time to do that. So don't squander those minutes before you present without looking up those things. I would absolutely emphasize that.
Yeah,
I would even say,
go ahead.
Oh, go ahead, Ryan.
Oh yeah, I would say I would agree, as long as your patient's stable, and that's obviously like if they're critically ill, obviously you can be like, oh yeah, I'm gonna go look stuff up. But yeah, I totally agree that I even tell my residents, like, you know, I would rather, because they take presentations too, I was like, yeah, I would much rather your sub-I give a few minutes to like look something up that they didn't know or add to their knowledge base. So then when they present, now we can actually have like a rational discussion versus like showing up to your plan and then just being like I don't really have a plan. So yeah, if your patient's stable, 100%. I think I even tell the sub-Is, like, I think it's totally fine to just be like, yeah, the patient's stable. I just wanted to look like one or two things up. Is that okay? If someone's trying to have you present like right as you're walking out of the room, because I'd rather you gather your thoughts and have like a good presentation than like blindsiding you. And we don't do it intentionally. You know, sometimes we just like, we see you and we're like, oh, you ready to present? But we should be more mindful of that.
And I think actually writing your note can sometimes help with that too. So not only looking things up, but taking a moment to write your note, which helps organize your thoughts a little bit. And so sometimes that can really make your presentations shine a bit more too. Tom, did you have a comment?
No, I was just going to echo that point of, if you walk into a room and a guy is blue and guppy breathing, it's embarrassing to run out and say, I'm scared, but I don't know why. But that's what I want to see if you walk into a scary situation.
Yeah, 100%. And actually our sub-Is, our ordering system requires a resident to co-sign an order anyway before it becomes active. And so they actually couldn't even resuscitate someone without the assistance of a resident or attending if they wanted to.
Looks like Jeanette, there's a question, kind of, my first EM rotation will be an audition. Any advice on learning as I go, but making a good impression for the slow. I think, again, I'd be super interested to hear what the panel thinks, but I think growth over a month is probably far more valuable to me as a program director or associate program director than how you are when you show up. And so really committing to taking the teaching that you're getting, incorporating it, seeking feedback and incorporating that feedback. So if you show up and you know absolutely nothing, but you leave as a kind of middle of the pack student, that's a huge benefit as opposed to you showing up being really smart and having a complete flat trajectory.
Yeah, I totally agree with that. I over the course of a month, we'll see you more than once. And if you come back a week later and say, hey, you remember that dissection patient that we saw? And I didn't know much about dissections now, but I read about it and I really enjoyed talking through that case with you. Anything that displays the fact that you're trying to take what you did yesterday and apply it to what you're going to do tomorrow will make you look like a self-driven learner. And that's what we're looking for in our residents.
And then Veronica's question of how do clerkship directors evaluate for trajectory? So we totally do evaluate for trajectory. I met one-on-one with each of my sub-interns midway through their 4-week sub-internship. And I actually read all their evaluations verbatim out loud with them, for better or for worse. And then I would write down themes, both positive and corrective. And we would talk about how to address those corrective themes if any emerged. And I would tell them, and I did, is if the evaluations at the end of that rotation were positive in that domain, then I always noted that in the slow. I would say by the end of the rotation, Veronica had very complete differentials and plans. Now the subtext as a program director looking at that is early in the rotation, there might have been areas for improvement on that, but they actually took the advice and improved that domain by the end of the rotation.
And I think that assessing trajectory, trust that the programs are doing that. It's our job to figure out how to do that, right? It's our job to gather evaluations from multiple faculty members and kind of consolidate them into some meaningful progression over the course of the month. But we do that, and we do that fairly well. And so really what you want to focus on is making sure that you're taking that feedback and acting on it and trust that it will be captured through the process. Okay, I want to be mindful of time, so I think we'll go ahead and move on. I'm happy to continue answering some questions in the chat. But next up, we're going to get into our slows. So we have 2 sessions on slows. The first will be...
So Gannon?
Yep.
We had a break scheduled until 10:40. Do you want to give people 3 minutes for a bio break while Sharon sets up, or?
Yeah, I think that's a great plan.
I have some flexibility in my timing, so it's okay to start a few minutes late. That's fine.
Are you all right
Thank
with
you,
that?
Sharon.
Okay. Let's take a 3-minute break, and we'll start at 43 after whatever time zone you're in. And that'll give her a chance to get everything up and running, and we'll kind of go from there. I don't think we need a full 10-minute break. People are probably checking in and out. So thank you.
So Gannon, I'll just go ahead and I share my screen, and that's fine.
Yeah, Sharon, I'm just making you a co-host right now, so you'll be able to share your screen.
Awesome.
And then we'll do a little introduction just to get everybody back in about 2 minutes.
Okay, wonderful. And Christine, I feel like I saw you on here. Are you here?
Yeah, I'm here.
It's nice to meet you.
Nice to meet you too.
Nick and Gannon had said, like, if we want to just kind of, if I say anything and you want to interject, totally fine. And I'll stay around for your presentation and, same thing. just because there is like a little bit of overlap in what we're talking about. So I hope I sent my slides to you yesterday. So I hope if you look at them, hopefully we won't step on each other's toes too much, but it's okay. Whatever.
Yeah, a little repetition is good too, right?
Absolutely.
I'll probably make some comments in the chat rather than interrupt your talk, but
perfect.
Yeah, I'll be paying attention.
Awesome. And it's good to see everyone. I wasn't able to be at Cord very much, so it's nice to see everyone's faces here. How have things been going, Gannon? Everything going well?
Yeah, I think it's been going really well. It's always, these virtual conferences are always a little bit different, but pretty good. I'm happy we've had good engagement. People are in the chat and speaking up. It's a good group.
Okay.
I think on that note, we'll go ahead and get started. So we're going to have two talks here back to back looking at slows. The first of which is Dr. Sharon Board. Dr. Board is the co-director of medical education at Johns Hopkins, or medical student education, excuse me, at Johns Hopkins, and then also was on the CORD slow task force, if I'm correct on that. And so kind of intimately involved with the processes that took place over the past year in terms of defining the individual types of slows. So Dr. Board, please take it away. Thank you.
Excellent. So good morning, everyone. I think it's still the morning for most everyone on here. I am on East Coast time and it's 11:40 here, so still the morning. And it's really good to see everyone here and to see all the medical students. The title of my talk is Slow Down, How Many Different Slows Are There? And we're going to be getting into the nitty gritty as to all the different slow types that exist. And Gannon is correct that I was actually co-chair of the CORD Slow Committee, which was newly reformed in this last academic year. And the reasons for that we'll sort of explore a little bit during our talk. You'll probably learn more about the slow than you wanted to know, because it's a topic that has become pretty near and dear to my heart here and a big interest of mine. What we're going to talk about is the history of the slow. Like I said, that's probably the part where you'll get more information than you wanted. We'll talk about how you get a slow, which is the part that you want a lot of information on, right? And we'll talk also about the different types of slows. And there are, I think, about 4 or 5 types of slows that do exist that will be helpful for you to familiarize yourself with. And then we'll touch a little bit on how is this year different from prior years. Whenever I say this for all the Jewish people out there, I always think of Passover, right? How is this night different than all other nights? So this is, how is this academic year going to be different than prior years? And for the most part, you all need to know how this year will be. Sorry, I got a mouthy dog in the background. Who really has a lot of bark, but no bite. Miller, shush. So this is the joys of doing talks from your home, right? That you have the barking animals and the cats that crawl on keyboards. So the history of the slow. So the slow actually first started out as the SLOR, and the SLOR was the standardized letter of recommendation. And there are definitely some clerkship directors and faculty members who know and are very familiar with the SLOR when it first started back in 1997. And that was when it was first used on applications. And we'll talk about why in emergency medicine we wanted to develop this letter of recommendation for our students and for our programs. In 2014, we changed to the SLOW. And this change in nomenclature goes from a standardized letter of recommendation to being the standardized letter of evaluation. And the thought behind this is that not all of these letters were necessarily going to be letters of recommendation, but rather a letter of evaluation as to how you performed during your rotation in the emergency department. And this is really kind of what the heart of the SLO is all about, right? The goal of this letter is to inform programs as to how you did during your rotation and during your time in the emergency department. And Gannon just gave a wonderful overview as to how you can really enhance your performance during this rotation. In 2016, we got electronically savvy, and the SLO changed to the eSLO, which is basically, from your purposes, the same kind of a letter, but what it does is it allows us to submit it electronically, and it allows us to better communicate from year to year and have our data carry over from year to year within our letters. So it helps our processes a little bit, but from your purposes, the letters all look very much the same. What are the goals of our SLO letter? Like I said, the goal is for us to communicate with programs so they can better understand your performance during your rotation. The goal is for this to be a standardized letter, for it to be a concise letter, and for it also to be a discerning and discriminating letter. The standardized factor is that everyone's letter is going to look the same. You can go on to the SLO website and you can look at what all of those different letter formats look like. There are actually pretty detailed instructions for everyone who's writing a letter to read over. So we make sure that everyone thinks about this letter and fills out this letter in the same way. Because even though it's standardized, there are definitely still sections that can be up for a little bit of interpretation. It's concise in the sense that there is a kind of a set area where we write our narrative comments, and that is the area where we will hopefully be able to display a really good depiction, again, of how well you did during your rotation and how you performed. Things that you needed to improve at the beginning that you improved upon by the end. And there are, people who just think about how we can write these comments as effectively as possible. And then it's discerning and discriminating. And the big concept there is that you are being compared to a certain extent to your peers who are also applying to emergency medicine from your institution and to other people who are rotating with you. Do you need a SLO? The absolute 100% answer here is yes. The SLO has been looked at and has been found by program directors to be the most important factor on your ERAS application. Now, no pressure there, right? It's actually relatively easy to get a SLO. I always tell students that this is something, especially if people are nervous, you're going and doing a visiting rotation. How do you ask for a letter? Is it awkward to ask for a letter? Who do you ask to write your letter? The best thing about this is the expectation when you go and do a rotation is that you get a group SLO from that rotation. And what that means is that that letter is written by the program director team and the clerkship director team. And we work together, and everyone does it differently at each institution, but we work together to look at our group of students that rotated in the last year to put people in these different tertiles that exist on the letter and to go ahead and write the letter. So do you need a SLO? Absolutely. Will it be easy for you to get a SLO? 100%. And the expectation when you do your rotation is that the end result will be that you will get one of these group letters. And that group letter is kind of that gold standard letter for what you want on your application. There's different flavors of the SLO, right? So the EM faculty eSLO, I put as like our classic vanilla. This is like the bread and butter SLO that exists on your application. The non-EM program SLO, I put a strawberry, right? I don't know. This is a letter that will be written, and some of you may be coming from institutions where you may not necessarily have an emergency medicine residency program, and there is a different letter format for those individuals. The letter, again, is very, very similar in content and in look and in feel, but The only kind of differing factor is that you're not coming from a place with an emergency medicine residency program in place. There are subspecialty SLOs. I define this as rainbow sherbet. We'll talk about them in a little bit more detail. And then there's the off-service SLO. And this is the letter that was developed over the last academic year and in this 2020-21 application cycle. And I have defined this as a rocky road. And we'll talk about that in a minute. And we'll give you a little bit of insight as to kind of where we see the OSLO going and, you know, a little bit of insight into the performance of how that letter did within this last academic cycle. You know, how do I get an ESLO? I already talked about this a little bit. You'll be getting this letter from a home emergency medicine rotation or an away emergency medicine rotation. And a group SLO will likely be the letter that is written from that experience. Again, you may want to clarify as you start your rotation that will be the process that is in place at the institution that you're at. But for the most part, that is the standard process. Different places may assign you to a different mentor, potentially in an area of interest that you have. You know, and again, the processes may be slightly different, but for the most part, the expectation will be that you get an ESLO from that rotation. The non-EM program SLO, like I said, this is a rotation completed at a location without a residency program. And for some of you, that may be your home rotation. And then there are subspecialty SLOs. The subspecialty SLOs, you can get an ultrasound, tox, a hyperbarics rotation, pediatric emergency medicine. And then there's also a little other category and an other checkbox. So if you've done a rotation in something that's not on the normal list, that's okay. They can go ahead and they can check off that other box. These letters also look slightly different than what the general ESLO looks like. But again, it's a very, very close mirror. You know, we will take a couple of minutes here to explore the OSLO. And the OSLO, like I said, was established in the 2020-21 application season. And many of you have probably heard of this letter along the way. This is a letter that's completed by an off-service faculty member, and it's a templated letter. And the reason that the Cord SLO committee chose to develop this letter is because narrative letters are sometimes less discriminating, less concise. Many of you have probably not had the opportunity to read through a bunch of ERAS applications, but for those of us who have, I can tell you that as you read through those letters and those narrative letters, they all can sometimes blend a little bit. Sometimes, you know, every student that you read is the best student in the world, right? They're all amazing. And the OSLO goal was to kind of look at those narrative letters and make them kind of, again, more closely mirror what our SLO letters look like. Now, interestingly enough, in this last academic year also, internal medicine actually created a similar standardized letter of evaluation for them to use on their applications. I'm not sure if that was developed due to COVID and COVID constraints, or if that letter was developed, you know, prior to COVID happening and was already a little bit in the works. And there are other surgical specialties that have used a standardized letter for a while as well. You know, this definitely came with some challenges, right? So it's a new letter. We're asking, you know, people from all sorts of different backgrounds to write these letters. There are people that may not necessarily have experience writing a letter like this because it's very different than prior letters that they wrote. And within that letter, you know, the goal again is to compare people to their peers. So not everyone is going to be amazing necessarily. It came in with some mixed reviews. There were a lot of left shifts on these letters. So a lot of people were still really, really, really great. So it might not have necessarily given us all of the information that we were hoping to gather. And, you know, some of the people who were filling it out did have some logistical issues, did have some questions or concerns about filling out these letters. So the information that I have for you is we are still kind of thinking and talking about whether or not this rocky road of the OSLO is going to continue in future years. The emergency medicine education community is being really thoughtful about whether or not we want to continue having these letters in our applications in this upcoming academic year. And whether or not we should, the first year, whenever you do something, is always a bit of a learning year. So whether or not to continue for another year and see what happens, and then make decisions from there. So for your perspective as students, keep your eyes out on social media, and we'll be discussing whether or not this OSLO will be continuing into this academic year. And we'll hopefully make decisions on that by June or early July. So you know what to kind of think about getting and asking for from your faculty who will be writing letters for you. Now, what will be on your ERAS application for this academic cycle? There will be 1 to 2 ESLOs, 1 from a home rotation, 1 from an away rotation. I'm sure that the COPA recommendations have already been kind of discussed here. I'm sure you all have already talked about them, your ability and the number of away rotations that you should be doing. And then you'll have 1 to 2 other letters on that application. So potentially an OSLO or a narrative letter, research mentor letters, maybe a subspecialty or non-EM residency program SLO will also be on there. And again, we're happy to answer any questions that exist about any of those. That's all I have today. I haven't been able to keep up with the chat, but I'm happy to answer any questions. I don't know if we're taking just questions from the chat and looking at them, or what you all have been doing.
I think we've been answering, a lot of them that have come through. I guess my thought is maybe since we have a second SLO talk coming next, are you able to stay for 20 more minutes?
Yeah.
Okay, maybe we could have Christine go next and with our part 2 of the SLO talk, and then we could maybe have some question and answer after that, if that's all right with everybody. Is that all right with you, Gannon?
Yeah, I think that sounds great, and I'll kind of keep track of questions from Dr. Board's talk and Dr. Kolstad's talk.
Okay.
Great.
Thank you.
All right, so we're trying to come up with like cute title names, things that play on the SLO word here. Some people say slowy, but it's really hard to come up with a cute title if you use slowy instead of slow. So for this, I'm really going to focus on the emergency medicine SLO, generally the one that you would get if you have a rotation at a program that has an EM residency, but it should apply to any sort of EM rotation SLO. So last talk, we talked about the SLOs in general. This we're going to talk about, emergency medicine in particular. What I'm going to do is cover what is actually on the SLO. I'm going to show you pictures of the SLO and go over all the different categories here. There's 5 different ways that I've sort of divided it up, and we'll talk about those. And then we're going to build a little bit on Dr. Sangar's talk about how you can do well in all those categories so that your SLO is as good as you can get it. So the first is just the facts. This is pretty self-explanatory, like what's your name, what's your telephone number, and who is writing your SLO. Like Dr. Board said, these are generally going to be group SLOs, so it's going to have the list of all the people that are on the committee that come together to write your SLO. On the bottom of this slide is where we have to say like how we know you. So if you try and get a SLO from someone who is just a research mentor, they're going to have to indicate here that they don't really know how your clinical experience is. The next section that we'll talk about is the details, and this is where we talk about your grade. Medical students are always focused on grades, right? But this is not really the most important part of the SLO for most of the people who read SLOs. So we get your grade, and then we find out what rotation this is. And we talked about growth a couple lectures ago, like how do you grow as a medical student? Most of you will do 2 EM rotations, so we want to see that you're doing better on the second rotation than the first rotation. If you are going down, that's really concerning, and if you're sort of staying flat, it's not as impressive as if you're growing. Then what we have to do is indicate what kind of graders are we? Am I a program that gives 60% honors or 10% honors? So all those boxes there show how we grade. Are we just pass fail, or do we have honors pass fail? And then what kind of groups do we put people in? On the side there is how many students we had last year. This really helps give some idea of how many students, how many letters have you written. Like Ryan was saying, he's written 500 of these letters. He has a really good ability to differentiate students. If you only have 1 or 2 students come through your rotation because you're a community site, you're not like the main place where students go, you probably don't differentiate students as well as someplace that sees a lot of students. So hopefully that clears up the basics. The next category is EM qualifications. And so there are 7 different ways that we evaluate you here. And this is where we introduce the thirds. So those of us who write a lot of these letters or read a lot of these letters start thinking of everything in thirds. Like that restaurant you went to, how was it? Oh, it's kind of middle third. If you hit it on a great night, it might be a top third, right? Like everything becomes thirds. And like Dr. Board said, this says we're comparing you to your peers. So if you're thinking like, oh, this is awesome. I rotated with Bob, who's going into pathology and is afraid of patients. I'm going to look so good. Not really. We're not comparing you to Bob. We're comparing you to Sally, who's going into emergency medicine and is a rock star, or not, but we're comparing you to Sally, not Bob. I'm going to talk about these categories in more detail in the second part of the talk. So next is your global assessment. And there's really 2 parts of this that seem very similar, but they have some key subtle differences. So the first part is like, how did you do overall in the rotation? And we got the thirds, but now we introduce top 10%. So we can really like highlight the people who are rock stars on the rotation. So that's, you know, kind of how you did. The boxes on the side are there to keep us honest. We all generally really like students, and we like students who are going to emergency medicine, and we want you to do well and want to say nice things about you. So there's a temptation for us to put everybody in the top, but we need to spread them all out in this whole continuum. So I have to say last year, I put this many people in top third, middle third, lower third, and that keeps me honest so I don't just write everyone like glowing letters. And then you also have to say again, how many letters did you write? So if I say, you're the best student I've ever seen, I wrote 1 letter last year. Well, you know, that doesn't mean as much as I wrote 500 letters last year. The second part seems to sort of ask the same question, but what it's asking us to do is predict how you would do on our rank list. So if you're at a rotation where you have to take a test and that test is part of your grade, you might be a bad test taker. And so you might end up in the middle third. But everyone loved you on the rotation. The nurses love you, the patients love you, the residents love you. You've got great end of shift evaluations. So I might put you in the top third on that second question because we really want you at our program, even though you can't take a test very well. Next is your written comments. I'm gonna find my headphone here. Sorry about that. So your written comments are where we really start talking about you more typically like you would see in a standardized, in a regular letter of recommendation, except we don't only talk about the good things. We talk about your strengths, but also your weaknesses, areas for improvement. This is where we might say, you know, they started off, they didn't really know differentials too well, but by the end of the rotation, they really, really got it. If we give you any negative evaluations, we're supposed to explain it here. So if you get lower thirds in anything or not going to be on our rank list, this is where we have to explain why we put that there. It's short, 250 words or less. We all have short attention spans, so it's not going to be pages and pages like your internal medicine attending was writing before last year. So we talked last talk about how this is supposed to be a standardized letter. It's supposed to be like a uniform way to compare students from different institutions as they rotate at different institutions. It's supposed to be uniform. It's really hard to be uniform in the world, in emergency medicine in particular. The things that I want for students at my institution, which is a large county program, we've got 22 residents per year, might be different than what someone wants at a smaller community program. And so the way we evaluate students might be a little bit different. Also, the number of students you have, the way you grade, it's just not the same, but the SLO has been really carefully designed to try and incorporate all those things very explicitly so the person who's reading the letter knows how to evaluate your performance at that institution and see if that performance is something that matches well with what they're looking for in a resident. Okay, we talked a little bit about knowing who your peers are, knowing who you're being compared to in this. Your peers are EM candidates, right? Emergency medicine is still a relatively competitive field. There are only 6 spots open after the MASH last year for people who needed to SOAP. The individual programs will have different levels of competitiveness, but overall, the group, you guys are really smart. So if you get feedback, you may get from some of your evaluators where they tell you you're third. You're doing middle third on this rotation. I know historically that students freak out. They don't want to be middle third. They want to be the best at everything, right? I want to be number one, not middle third. But your peers are amazing. So if you're middle third with those people, you are doing good. Like, don't worry about it. Even if you're lower third, on the website, the CORD website, where they give instructions for how to write the slows, they explicitly say that if you're lower third, you're still likely to match. Now that's assuming that you're doing all the things you're supposed to do that Dr. Sanger talked about earlier, but it's not necessarily like, does not meet expectations. All right, so we talked about a little bit how your EM rotation is kind of like a 4-week interview, right? So how are you going to do well on your rotation, on your shifts, so that the evaluations that you get allow me to write you a good slow? So these are the 7 categories we talked about your EM qualifications. And the first one is your commitment to emergency medicine. So how do you express that commitment? Like, understand what's going on in the field. You've probably all heard about this study that shows that in 10 years there'll be no jobs for emergency medicine physicians, right? If you haven't heard about it, find out what that is, because that will come up. You don't have to have the very in-depth, well thought out position on that paper, but you should at least know that it exists. Express interest in what's going on in emergency medicine. If I say to you, hey, there's a patient in room 4 with chest pain, do you want to go see them? I do not want to hear, no, I've already seen some patients with chest pain. I've seen more patients with chest pain than that, okay? Like, go, this is a bread and butter thing in emergency medicine. Go see that patient. It's totally okay if you don't know if you want to do EM yet. A lot of you don't do EM until late in your 3rd year or 4th year, and it's hard to know that this is for sure what you want to spend your whole life doing. That's fine. Talk to your advisor, talk to your friends, talk to your family about it. Don't go into every shift like, I don't know what I want to do, because you're going to be remembered as that student who wasn't really sure if they wanted to do EM. Work ethic. Again, this seems pretty straightforward. Like, don't be a jerk. Like all these things we talked about before. Work hard when you're on shift. How do you actually do that though? Know how your patients are doing. If they came in with asthma and you're giving them a med neb, know if it's done. Know how, if they're breathing better, do we need to give another one? Is the CT back? If your patients are all stable and there's nothing to do for them right now, offer to help out with other people's patients. Generally, you will have the least patients of anyone in your team. So if they need you to go evaluate their patient that just finished their med neb, be willing and actually volunteer to do that. We talked, there's some chat comments about looking at your phone. Yes, we know that you look things up on your phone, that's fine. Just make sure it's not like TikTok videos or anything like that. Unless your attending says, hey, show me one of those TikTok videos or something like that. And again, just like help the rest of the team. Don't think that you are only supposed to be focused on your patients. EM is a team sport. We also want to know that you have good medical knowledge. How do you display that? Well, one of the questions that's asked is your ability to create a differential diagnosis and come up with a treatment plan. So you have to have good medical knowledge to be able to do that. Hopefully you already do at this point in your career, but read EM specific things or listen to blogs or podcasts or whatever. I guess you don't listen to blogs. Read blogs, listen to podcasts, whatever way you like to learn, do that. Start before your rotation if you can, continue it throughout your rotation. When you're talking about your differential, be ready to explain your thought process. Again, a lot of people have short attention spans in EM. They might not want you to give the whole thing, but if I ask you, like, why did you think about PE? You can say, well, they didn't have a swollen leg, they're not on hormones, that sort of thing. Always consider life and limb threats. If someone fell down and they have a deformity in their wrist and that's their only complaint, you're not going to have more than one thing on your differential probably. But for everything else, you should have a couple things on your differential, and you should mention that you thought about something serious. Like I said, EM is a team sport. It's really, really important that you get along with other people, with patients, with consultants, with the team that works in the ED, and we explicitly evaluate you on this. When we start our orientation at our rotation, we talk about like how to get honors, like what are the habits of honor students, and it starts with be pleasant and engaged. That sounds like really, really easy. Like, why do we even have to tell you this? But if people like being around you, it also creates a halo effect. So when you do forget to ask a question, when you see a patient or forget something in your differential diagnosis, people are more positively inclined to you and will probably overlook that. Be available for any learning opportunities. It might not be that exciting to do, I don't know, put in a Foley catheter, help the nurse with that. But if you do that, they're more likely to find you when someone needs an LP or central line placed, if you're always that eager student who's trying to find ways to help out. Don't steal procedures if it's someone else's patient, or you'll be doing your rotations generally as the interns start. So if the intern is about to do a central line and then you ask if you can do it, that's kind of not so cool. Don't overstep your role. Your role will be slightly different each place you rotate. So ask what your role is when you start off. That's a good way to not do this. But in general, just try and find out what your role is. Don't do anything crazy. We had a student several years ago who became very famous for telling the attendings that he didn't think that was necessary in his clinical opinion. Like, it's kind of overstepping your role at that point. We talked about this a little bit before too. You're a patient advocate. Remember, we explicitly evaluate you on this, and this is how you're going to stay interested and engaged in medicine throughout your career. So how can you display a caring nature that we know you all have? Be your patient's advocate and be their liaison. Somehow being a patient in the ED is both incredibly terrifying and incredibly boring. You're spending a lot of time just sitting in your room where nothing seems to be happening. If you can go in there and update your patient, not only see how they're doing, how they responded to the treatment, but just let them know, we got your blood test back, they look okay, we're still waiting for the CAT scan. I still get patients blankets and sandwiches and urinals and socks and all that thing every single shift that I do. So definitely don't think that it is like beneath you to do those things for your patients. And those are some ways that we can see that you really care about your patient. You're not only focused on like showing how smart you are to us. Okay, so we'll do questions maybe for both talks.
Thank you for that. One of the last comments, Ryan, that you answered spiked a thought for me. I don't know if everyone does the group slow the same way. And so I think it's important to find out who is on the group slow. So, at Ohio State, our vice chair for medical education, our program directors and our clerkship directors are on the slow, but as the director of the 4th year of medical school, I actually am not on the group slow. And so I tend to write a lot of subspecialty slows because we have several other EM related rotations. But I would advise the students to really, when they arrive at their rotation, ask who is on the group slow and who has input to the slow. Do you guys have thoughts on that?
And I have no problem telling students that. I guess I worry that they would be, trying to show off so much for those people and not do the patient care and things like that. But as long as you're watching out for that, I'm happy to tell you.
Yeah. We always tell our students when they start a rotation who will be writing their group slow. And I think that it's a good, thoughtful question to ask when you arrive for your rotation, just to say like, and also just to confirm like, hey, I need an E-slow from this rotation. We meet with our students midway through their rotation block just to sort of give them some feedback as to how they're doing and offer them some, a brief advising session, even for our visiting students. So, I think that definitely clarifying that, I think is good. I'm curious.
I actually included I included it in my orientation. Like when I do the orientation with the students, I actually include that in the FAQ. It's like, I will be physically uploading your slow and writing it, but it's with input of, the education faculty and et cetera, et cetera, et cetera.
Yeah, I think that falls into sort of the know that it's a small world wherever you're going. And even at, UT Southwestern Parkland, where we have a lot of faculty, people will go out of their way to say, oh, that student was so great. And people will go out of their way to say, where's that student from? What? How did they get? How'd you pick them for the rotation? I'm just saying it's a small world, and most of us who are in the role of sort of slow writers are kind of, well known to everyone in the department, right? So just know that kind of be ready to impress everybody, and that kind of falls in that line what Dr. Colsa was saying of sort of, being cautious with talking poorly about I think asking really smart questions about, hey, how do you guys handle trauma here? How does that work is great. But, being careful about saying, oh, that's how you do it here? Or, well, that's a stupid way to do it. It's important, right? Like, to know that we kind of pay attention to those things, and they don't go unnoticed.
There was one question in the chat also that asks, was asking about, does a subspecialty SLO count towards the two max E-SLOs? And the way I interpret the recommendations and the consensus statement is no.
I was going to say no. Maybe.
Your subspecialty SLO is outside of your E-SLOs.
And so if you have 2 home rotations, it's actually kind of a nice way to still be able to like see a program. Is it later in the year, like even if it's December or January, if you do like an ultrasound elective or something, you still get to kind of see the flavor of a program, but you know, not fall astray of the requirements.
I would say, like, if you're thinking I need to get 4 letters and they should all be EM related, so 2 E-SLOs, and then I'm going to get an ultrasound and a tox letter, it's really hard to judge your performance on an ultrasound rotation generally. So I would rather see, and there might be some variety in this, I would rather see someone's like ICU letter than an ultrasound letter. You know, if it's that 4th one and you already have a good letter from surgery or you know, internal medicine, yeah, you can get that ultrasound letter. But you know, they generally, you're not evaluating and treating patients, so they don't have as much to write about.
I think that kind of goes along with the question that someone else asked, and I also had, which was, how do you kind of rank importance of the SLOs or the letters outside of an E-SLO? So like, you know, should I choose a research mentor narrative letter versus an O-SLO versus a narrative letter from someone in EM? Like, how do you navigate deciding which other letters to include?
Yeah, I'm sure everyone probably has differing opinions on this. The advice that I always give to students is pick the person who's going to be able to write the best letter for you. That I think will put you in the absolute best position. Outside of that, I think like what Dr. Kolstad is sort of hinting at here, like we don't want to see 4 SLOs on your application. Like I don't like, you know, 2 E-SLOs, and like we want to see a little bit of variety, I think. But I think whoever knows you the best, I always really, you know, when I'm reading through an application, I always really value those research letters, especially the ones that are like, they developed the project, they did all the work on it, they published it, you know, that to me is a great letter. Same thing for, you know, if you work really closely with someone on a off-service rotation, you know, ICU, surgery, medicine, I think are the ones that are most applicable to our specialty. I think that also is a really meaningful letter.
And I would just echo, I think the person who can write the best letter, but also I think with Dr. Board, a meaningful experience. And so I know that our ultrasound subspecialty is a lot of independent time scanning in the department. And so it's a 2-week elective. Students come in, they scan a bunch, they have kind of QI sessions with ultrasound faculty, but in reality, they're not getting a ton of touch time. And so to compare that letter to, like Dr. Board said, a research experience where you spent a year with mentorship meetings with somebody, not only do they know you better, but it's just a much more meaningful experience, and they can kind of highlight that meaningful experience. So I think that's another factor to bring into play.
I have a question about the away versus the home rotation SLO. I know there's some discussion about that this year, and the study that Dr. Sungar mentioned kind of said that program directors prefer the away SLO. So can you give any advice about that for this year with regards to the cord recommendations?
So hopefully everyone will be able to obtain 1 away rotation. I think that program directors are being very thoughtful though about how they look at applications, and will be understanding if for whatever reason there are extenuating circumstances about why you couldn't get an away rotation. So I do think the applications will be looked at differently this year than they have been in years past. You know, I think the thought behind this, and I wasn't at the talk, so I don't know exactly what was said, but when you write a letter for a student at your home rotation, and I hope this doesn't come into play when we're writing our letters, but ultimately, your university and your school wants that student to match. A lot of dean's offices are actually kind of anti the SLO because, like I said, it's a letter of evaluation, not necessarily a letter of recommendation. And they want all of you to match. Like your school is invested in you getting a residency spot. Whereas when you go somewhere else, we're not invested in that, right? So the thought is that potentially that letter will be a little bit more of a quote unquote honest letter. Now, whether or not that's true, I don't think we really know for sure. And the other thing that's good about an away letter is like you're going to a different place, a different system, potentially a different EMR. And like, can you rise above there, right? There's all sorts of different challenges other than just knowing the medical knowledge. Can you figure out how to, navigate all of those differences and assimilate into that team where you don't know anyone?
I also think that, that study that I presented was from 2018. And so that was pre-COVID times. And, last year, if we're just looking at how we're going to compare this upcoming cycle to last year, the vast majority of our students didn't have any away rotations. And so I think that program directors have already had to wrap their heads around that difference of understanding a home SLO in the context of what it really is. And I think home SLO riders probably changed a little bit in terms of how they advocated for their students. So I don't actually think it's a huge difference or as big as a difference as some programs may have considered it in the past, just based on the context of what's happened over the last 18 months.
Thank you.
Well,
and
I think
chat in case anyone if any of you have any questions or concerns or thoughts about the SLO, you can definitely feel free to email me. I'll do my best to help you. And hopefully you have access to an advisor at your home institution that will be able to help you out with any of these. But if not, CDEM has been working on an advisor program for distance people, for people who don't necessarily have a robust advising program at their institution. So I can also help you out with that.
Thank you, Drs. Board and Kolstad. I think that was super enlightening in terms of kind of pulling the curtain down to get a better understanding of the SLO process. I think in the interest of time, we'll move on. This next session is kind of a panel discussion. We're really excited to have representatives both from residency program leadership, but also some incoming interns from different medical schools across the country to kind of talk about what was this past recruitment season and kind of expose some of the challenges of the virtual recruitment season, as well as some of the opportunities that came up. So I'll just quickly why don't we have each person introduce themselves? Bonnie, we'll start with you.
Hi, everyone. I jumped on earlier today. I just want to say thank you to lecturers. Their advice is phenomenal. And I just am nodding my head along to everything they're saying. So please listen to everything. But I'm the program director. Again, and Dr. Sunger and I work closely together. I'm the program director for the residency Denver Health Medical Center. And I'm so excited because I see some of my incoming interns and I'm so excited to see them very shortly.
And then Simiao, would you like to?
Yeah, absolutely. So I'm Simiao Lee Sourwine, and I'm one of the assistant residency program directors at The Ohio State University. And thank you so much for having me on this panel. And I'm really hoping that the next hour is going to be informative, enlightening, funny, whatever.
And then we'll just go in order on my screen. Austin, you want to go ahead and just introduce yourself? Tell us where you come from.
Absolutely. Hi, everyone. Thanks for having me. My name is Austin Jones. I'm graduating from Tulane University and very excited to be an incoming intern at Denver Health.
And then Gabby.
Hi, everyone. Excited to be here. I'm Gabby Broda. I'm graduating from CU School of Medicine. Super excited to be at Denver Health shortly. I'm super excited to see some of my co-interns.
And then Robert.
Hey everyone, thanks so much for having me. My name's Robert, coming from the University of Chicago, and also super excited to be here and see my co-interns. Thanks for having me.
So I'll apologize that we stacked the deck with incoming Denver Health interns, but we got good representation across the country. And again, as we've done, I want this to be a pretty open session. Obviously, we have a number of other faculty members who are here who would be great if they'd be willing to chime in. And we're just going to talk a little bit about this last virtual recruitment season. I have a handful of questions. I think we'll start with kind of a big one. So maybe start with Bonnie and Simiao. But this idea of kind of in a virtual world, how do you display the feel of your program, the culture of your program? And so what were some of the things that you as program leadership did to try to kind of reach through computers and help applicants understand about your programs?
I guess I'll jump in first and then I'll hand it over. I got to be honest, this was, a black box for us initially. And so we spent a lot of time revamping our website. It was program leadership, but really I got to give credit to our residents. We're a very resident run program and they did a ton of work sort of to highlight our program and revamp it. So that actually took a ton of work. We ended up doing videos. So we did a lot of video tours and other videos that we also added on to that. And then we gave a lot of access, more than we have in years past, I'll say. We probably could have still done more, whether through fairs or we did one session where we did with applicants could join us and a lot of answering questions and a lot of reaching out to applicants. Those are some of the things that we started with.
Yeah, similarly, I mean, I think that this was really uncharted territory for us. I think it's really hard, being in Columbus, Ohio, like if you've never been here before, to understand how awesome city Columbus is and how much, you'll have a good time in residency here. And so I think one thing we really try to do is to recruit our residents to really demonstrate what it's like to be a resident here. So we recruited them to do little short videos to essentially talk about like their favorite places, in the city and what they like to do, and hopefully that way get a feel for our resident body as well. But yeah, I mean, I think it was really difficult to sort of give you that information up front because every residency program has a really shiny web page, and every residency program is going to talk about all these awesome things that they offer. But to be honest, I feel like after a certain point, they kind of all blend together, right? So you kind of just have to like show up and get a feel for, hopefully whoever that you talk with that day is going to give you a good idea of what it's like to be here.
And to our kind of incoming interns, applicants, what were some of the things that really helped you to understand that feel, or what did you find that programs did well to kind of demonstrate that? Did these videos help? Did the websites help? Did these information sessions that ran kind of all summer help?
Yeah, I can jump in. I think one thing that I did that helped me early on is, you can ask sort of the logistics questions, which is, how many months do you do this, or where do you do this? How often do you work at this hospital? And those things you can really look up, on the website or in EMRA sort of beforehand. And if you're able to do that, then when you show up to the actual program or the interview day itself, what you can talk about are kind of the specifics. And I feel like when you talk about the specifics of things, you see the passion come out in people. And that's what I saw, for example, with Denver, pipeline programs and community education is important to me. And we didn't just talk about like that broadly, right? It was like dive into the 4 different programs Denver has. And that was very unique. And even though I wasn't there, I got the impression that that's something that's incredibly important to this program. And so I like the idea of sort of coming in with specific questions because I think through specific questions, you get to see how passionate the residents and the attendings are about certain things.
I would just echo what Robert was saying is I think that in the interview process, you really get a good sense of what each residency program is super passionate about. And I think, kind of your first, second, third interviews, that might be a little difficult to distinguish, but as you kind of interview, you'll hear more and more of these kind of different stories from different programs. You'll have something to compare to, and it does become increasingly clear kind of what's important to each program. So I totally agree with Robert. I think there's a lot of detail that you can gain from the websites. I also really liked watching the videos for other programs. I was fortunate enough to be in Colorado, which is where I'll continue my training. So I knew Denver Health fairly well. But for other programs that I was less familiar with, I think those videos are really helpful. And then hearing kind of more about what residents would do for fun, what the city was like, just trying to get the best sense I could for a city that I had never visited before.
I agree. I mean, I think the website is the most high yield source of your information, especially for those logistics questions, and as Robert said, allows you the opportunity to ask more specific questions to your interests in the interview. I think I'll just complement the other two panelists' answers by I found useful were those summer info sessions or webinars. For multiple things, I think, first, it's a high level overview of most of that information, which you could find on the website, but then you get this added layer of meeting the program leadership, meeting residents, and really getting a sense of the culture. And if you can't be there in person, I think the more opportunity you have to interact with those programs at those info sessions, and then in your interview only really will drive home whether it's a good fit. And now I know there's at least this past summer, there was a tendency for medical students or applicants to go to as many as possible, thinking possibly that this was a level of interest taking into account their application. I will say for me, I chose maybe 3-4 programs that I was very interested and invested in. I went to their info sessions, and it's easy to get caught up in attending all of them, but it's not possible. So I think to just save those for maybe those of highest interest that you think would be the best fit.
So I'd love to dig into that a little bit more, because I think we're rapidly approaching that season again. And I know that there was kind of a calendar of pre-application residency info sessions that was going around. And every time I caught a glimpse of it, I had like extreme panic, because it seemed like there were 5 hours of scheduled sessions across the country each night. And I just like wept for all of you having to navigate that. So Austin, it sounds like you did not feel incredibly compelled to attend many of those. Gabby, Robert, what was your experience? Did you feel like that was something that you had to show up to? Did you feel like those things were useful? And then we'll talk a little bit to the program leadership about their thoughts too.
So I only attended a couple. I felt like my approach was really to focus first on kind of the characteristics of a program that I wanted to train at. So I kind of knew certain things about the program and the institution that I wanted to have. So like, what does their curriculum look like? Is that in line with my goals? Do they have access to academics? Am I going to get good county training? And then from there, I will admit that I kind of used my husband as a bit of a filter in terms of location and places that he absolutely opposed. And then from there, I was able to kind of narrow my list down based on, again, on the characteristics of a program. And once interview season rolled around, it was really about finding the right fit. And I think you kind of get that from conversations with faculty, residents, the videos, etc. So I didn't go to too many of the pre-interview, like the pre-interview stuff. I definitely went to the pre-interview socials. Those were important to go to.
I totally agree. I think that's such a good point. There's so many things that you can think of even before you step into any of these seminars that help you focus on what's really important to you. What's the work ethic of the program, county versus academic versus a blend. And then, family, partners, etc. I was couples matching, so that was another thing. We had plenty to talk before we even attended, these seminars. And I think I did a very similar thing at the beginning. I will admit, there was some pressure, because it was like, well, is this sort of part of this interview cycle? And I have a limited sample size, but from the leadership that I talked to, ultimately it wasn't at all. I think those were really built for us. They were really cool in that way, because you could go to, for example, one program might be talking specifically about what their county experience looks like. And that's like your exact question. Go to that specific lecture and don't feel like you have to go to the other 6 that they have. And in that way, you end up not having to go to, like we were saying, 5 hours a night. I think ultimately what I would tell you guys for that is that's built for you. And so use it as much as it helps you, but don't feel this pressure to attend.
Bonnie Simiao, is Robert lying to our applicants? Were we keeping track of all these students and tallying their scores?
No, he hit the nail on the head from our perspective. This was really for the applicants, right? In a really a little bit of a unknown situation, we wanted to just get out there as much as possible opportunities from us and our leadership. team, we had a lot of discussions that we also didn't want to overload the applicants, right? Because again, it wasn't part of our interview cycle. We didn't want you to feel like you had to do, you're doing so much already that we didn't want you to be honest, feel like you're wasting your time. Like we didn't want to waste your time. We just wanted to give you some high yield, have an opportunity to answer some of those burning questions that might tip you over to applying versus not applying. But that's the only thing we were thinking of. And that's how I feel about the sessions like here, right? This is about you guys, right? This is literally about just us here because we love hanging out with you guys and mentoring you guys, but it's nothing to do with or won't feed into our interview season. So just from our perspective.
Yeah, absolutely. I think I also had a heart attack when I saw that list of like the compiled sort of evening informational sessions. I think from a programmatic standpoint, for us, it really allows us to showcase the subspecialty things that we really excel in. So OSU has an amazing ultrasound program. We have a very robust research program, for example. Those are things that we want to trumpet. And so if you happen to be interested and you're available that night, then it's awesome if you can come. And from us, it's just another way to sort of reach out and get us on your list in terms of like, this is a program I want to apply to. I'm kind of interested. And I think it's a way for us to offer you mentorship as well. Like if you don't come to our program, then at least you have a little bit more information on the subspecialty that you might be interested in. But I absolutely agree. Like it does not play into our decision of whether or not to offer you an interview or whether to rank you highly on our list. I think that we should do a better job as programs this year to message that so that potential applicants to the programs don't feel compelled to, fill up their schedule every single weeknight, because that's exhausting for you. And we don't want you to feel compelled to have to do that to really demonstrate interest.
And I'd love for any of the faculty who are on as well, any other thoughts on these pre-interview or pre-interview kind of pre-application, we should say, sessions?
Hello, I'm Heidi Levine. I'm from South Shore University Hospital, which is part of the Northwell system in Long Island. So, I am not a program director. I'm director of wellness for our residency and our department and our hospital. But anyway, we just attended a lot of, student fairs. We had the same thing, the video, and just made ourselves really available. We don't ever track whether or not, you're participating in or look at our videos if you visit our site once or twice or 500 times. I mean, we're not looking at that per se. The PD, APD have, certain things that they do look at. And when we interview you, then you'll get more of an idea of what the program is like. Our residents are pretty active and we highlight, same thing as everyone else. We highlight, what we think are our shining stars and go from there.
I had Gannon, some students tell me that these pre-interview meet and greets were a good way for them to sort through some of their interview offers. And there were some programs that did a series of them. And I had students that, got really engaged with that program. And we actually had somebody match at, this particular example was Mayamides. They did a series. And the other thing that just was brought to my mind that I'd love to hear you guys reflect on is this past year, it seemed that existing relationships were relied on more than maybe in the past. So for our students, there are certain programs that we almost always match someone to every year. And it seemed like those relationships were leaned on, more so this past year, I think, because of the uncertainty. So I don't know if you guys saw that in Denver or if any of the other folks on the call saw that, but, it seemed like those relationships were maybe strengthened as well.
Yeah, I think that's a great point. I think in the time when information gets somewhat limited in your ability to actually show up somewhere, I think those kind of pipelines have helped because applicants can reach out to alumni of their medical school who are at a certain program and get a little bit of that inside scoop. To be perfectly honest, I don't know that that played out as much as we probably thought it would in Denver. Bonnie, I don't know what your thoughts are, but I do think that it's probably a great signal to our applicants of like really scour your alumni network from your medical school and find people who are at places you're interested in and try to connect with them individually, because that may allow you to get a little bit more of an inside scoop on what the program's like.
Yeah, I think you said it excellently again, and I don't think it played out as much as we thought it would. But actually, again, look at Robert, because him and knowing he has a pipeline in our program actually, and see sort of his perspective of that. I know Gavi, actually, all three of them had some sort of pipeline to our program. So I said that, and yet the three interns we have all had some sort of pipeline. So I'm like, hit it to them and see what their thoughts were.
I did definitely write down in my notes for this alumni, and I think that in terms of resources, as much as you can use it, is one of the best resources you can have. I talked to Cheyenne, who's a resident at Denver now, for probably like an hour and a half after my interview, and one, that was a sign, I think, how much I love the program. But two, I got to ask him like literally every question that I had in the book, and just hear a detailed perspective of what intern year looked like, of questions that you might not be comfortable asking during the interview for whatever reason, or of some of the details, logistics of like living in a city that you haven't lived in. And so I'd really, really tell you guys as much as you can, from these panels, we'll give you our information, from your alumni network, from different connections you make, really reach out, because I had so much help and information given to me. I think, as interns, as residents, we want to give that back. And so take advantage of that. Never feel like you're asking too much, because, that's what we're here for. And we want you to make a decision where you end up with the right people. And that's probably one of the best ways to do it.
Pivoting just a little bit, I want to talk to Bonnie and Smiao, kind of program leadership. What logistically, like, how did you prepare for this season differently? And obviously there was kind of the challenge of figuring out how to hold virtual interviews, but did you increase your interview spots? Did you decrease your interview spots? Talk a little bit about how this year was different from an organizational standpoint.
Absolutely. Okay, I'll jump in. Yeah, we spent a lot of time discussing exactly what this would look like, and because it was unknown, we looked. I'll actually look to Gannon, who did a ton of work for us on our end for our residency leadership group, and looked at sort of across the country numbers, and we ended up increasing by about 10% our number of interviews for this year in number of days. We were able to do that because of virtual. Actually, one of the pros that we found was the flexibility, not just on our end, but actually from the students' end. Now, whether that's good or bad flexibility because of how many interviews people were taking, that's a whole nother discussion. But that was definitely part of it. So going back to that, what would I do? I'd probably, knowing what we know now, we'd probably decrease, and nothing's set in stone, so don't quote me yet, but we'll probably decrease the number of interviews we do now, knowing what we know now. I think understanding how virtual interviews run and trying to get to that culture piece, we'll probably continue to explore, because I still think that's a struggle actually, and really hard. And what do I mean by that? I personally think really you guys understanding what our residents are like and how they interact with each other and how they treat each other and how much they care about each other and the physical environment that they work in. That's really hard to get at unless you're there in person, getting that energy. And I think we tried to supplement, and I think we still have some work to do from that. So that's something I would say, from that perspective. I think that we would decrease some of, although now Austin's making me reconsider this, some of the fair stuff perspective a little bit. But besides that, to be honest, I think there was a lot of benefit from a cost, from accessibility, and from a flexibility perspective. Those are my initial thoughts.
Yeah, absolutely. I think we were kind of similar in not wanting to go overboard in terms of the number of interviews that we offered. We kind of heard early on that maybe there was a 10 or 15% increase nationally from the applicant side in terms of the number of programs they were applying to. And so we tried to, adhere to that and not go overboard in terms of offering like double the interviews in previous years, for example. Like we didn't want to really overwhelm us, as a program team. I think in terms of other things that we really tried to do to get ready this year, I think it was really important to every program to have a really tight, sort of polished website and do a better job really trying to make your program shine through in terms of what your sort of central missions are and what are the areas where you really want to shine and display that to the applicants. I think in terms of lessons learned, it really is hard to, we mentioned this earlier, but it really is hard to fully showcase the culture of a program. We had a really awesome resident sort of recruitment chair, and we had a really strong team of residents who were able to make our pre-interview socials kind of fun and engaging, and hopefully get a sense of what it's like to be in that peer group. But I think we just all need to be creative and continue to push that if we continue to do interviews in a virtual format.
And then I want to talk a little bit about the interviews themselves. So just reflecting from, again, program leadership, to what extent did you feel like the virtual process worked well, didn't work well, limited your ability to assess applicants compared to prior years, or even enhanced?
Simia, do you want to go first?
Yeah, I can start. So, we didn't change the amount of time that each of us as program leadership had with the applicants for the one-on-one interview. So it really is a short amount of time. It's like 15 minutes. And so you really got to be like efficient and, get to the main points. And I think that that's true in the in-person setting as well. I feel like the thing that's different is that you just don't get as good of a feel of the applicants' personalities outside of that time limited, sort of maybe the mannerisms or how engaged they are during the pre sort of interview introduction session. I think that was a little bit missing from our end, but probably the loss was more on the applicant side, right? So like you really don't get to immerse yourself in the local area and in the department and to sort of observe staff members interacting with each other. Like, are people happy? Are they smiling at each other? Are they joking in the hallways? Like, that's the part that you kind of miss out on. I think the other part that, we were able to do in the in-person is that even though our interviews were time limited to like 15 minutes, if you really had a question and you wanted to get to know somebody, you could like squeeze it in there and sort of hold up the next person who was coming in. But Zoom is merciless, just cuts you off. You're in the middle of a sentence and just like, so that was probably one loss that we all felt. But the plus side is that we definitely ran on time every single day.
I so echo that, those comments. We were definitely on time, but we had to start ending early some of our interviews. So we were trying to not get cut off because it is merciless on that. Some of the pitfalls are, I actually think we go and get the applicant and bring them to our room. And there's actually some really valuable interaction when you're walking with someone, right? Where it's that chit chat and you get the vibe for the person and what that looks like, that we lost because you didn't really have time for that. So it was all business in these really short interviews. I think the pros for us is that we're as far as a program in Denver. And so I do think that we potentially had some more applicants as a result of that who were willing to interview with us and willing to check us out. I do think there was a huge cost benefit. I think there was a time benefit. I think the pitfall of that is if you don't go to just like Columbus, there are some perceptions of Denver that aren't actually always true. And I think there's a lot of value to actually going to a place where you're about to spend 3, 4, maybe more years of your time and seeing what that place is like, because that's really important, right? You want to make sure that you are moving to a place where you feel supported and you have a support network and you like the environment that you're moving to, and what you do for fun is around there, because you don't always get time off or time to travel. So I think that there are definitely pros and cons from that perspective. I think the flexibility too, we could get someone scheduled in 24 hours or less, even like the night before for an interview, right? And the flexibility from our end and their end We moved around a couple of interviews for applicants so that they could do 2 in one day. Now I felt terrible they were doing 2 in one day, but that was easy for us on our end, right? To help them out because we wanted to make sure that they were able to do it. So that's, I think, that was definitely a pro on both sides.
And then to our applicants, again, kind of going back to interview day, what were some things that maybe lessons you learned in terms of really pulling that fit or that feel out of a program on interview day, or what did you see that programs did well? What advice can you give to our students in terms of the actual interview day itself?
So I think everybody's talked about how this is difficult. It's difficult to gain kind of insight into somebody's culture via a screen. I think from my perspective, I felt like there was still enough to kind of inform my decision and help me kind of suss out my rank list. But that being said, I definitely towards the end was feeling the loss of the opportunity to do away rotations, having different programs in different cities to compare to. Definitely missed out on traveling to different areas and kind of seeing if there was a good fit there. That being said, I think the best advice I could give, and this is something I learned kind of throughout the interview season, is do not be afraid to ask the hard questions. You need to push, you need to get the answers you need in order to make a good decision. And so I will say at the beginning of interview season, I was like, oh, tell me more about your critical care program, which to be honest, I had been able to read about on websites. But you should be unafraid to ask the difficult questions if it's going to inform your decision making.
I completely second that. That perfectly well said. I think just to add to that, be ready for tech issues. I think for me, I was comfortable with Zoom. I had really no issues with Zoom, but when you start adding Thalamus, and I think there's another third-party software, I had a number of tech issues that led to continuing the interview over the phone or even once over FaceTime on my iPhone. So just be ready, be prepared. Don't take it in stride, and it will likely happen. So, and I think the only other thing I would add is, just like in an in-person interview, I would dress to impress, or maybe buy a new shirt or a new suit possibly. I think you can easily make relatively cheap investments for a virtual interview. Like I got a lapel mic for $35. I used my iPhone as my camera because it was higher resolution than my laptop. So you can use either make cheap purchases that will improve the video or audio quality, that really put your best foot forward. And I think that's an important dimension to also consider.
I think ultimately one thing to remember is that, like, even though it's happening over a screen, just like if you are fundamentally yourself, that's the most important thing you can do in this interview. And I think both of my co-residents kind of spoke to that already, but I think that that's just so important. And like being flexible with technical glitches is a great sign to show, right? Like you're going into medicine, you need to be flexible. You need to be able to handle stress, and I don't know, things will cut out. That's fine. We know that happens. And so I think, keeping humor in you, but being professional, being able to handle changes, you still notice all of those things on Zoom. And to Gavi's point, I think, showing what you are truly interested in is how you find a place that has those exact same interests. And so I feel a similar push sometimes when one program has, very strong X, and I don't necessarily do that. There might be a push to talk about that, but don't. I mean, talk about what you are passionate about, and maybe they're working on a program there, and then you get to talk about that the whole time. To the note, the one other point we hit on, which I think is a really important one very briefly, is this idea of like the number of interviews. And I think it is super important to realize that even though you're on a computer and you're going to do this in your room, like this will fatigue you. These interviews, you need to go all in, and you need to give your full self. And if you're doing 4 in a week, I don't know, just making something up, you won't bring your best self if you're back to back to back to back. I think it's just very hard to. And so be careful with that. Space it out as if you're traveling, because you want to be well rested. You want to know that program well before you go into it. And Zoom is tiring. I think we've learned that over this last year.
Austin, you mentioned kind of in addition to maybe wearing pants, some other like hacks for the interview day itself. Did you guys find anything else any resources that helped kind of give you advice about the specific virtual interview, or any other, to Robert and Gabby, any other things that really helped with that process?
There was a webinar about it, which I did attend. So I know people were anticipating it. I think there were resources over the summer from SAEM or similar webinar. I can't remember exactly, but it was touched upon. There were resources on the internet, but I think what it really boils down to is, you as Robert said, bring your best self forward, and then just you have to adapt to a virtual interview with some maybe modifications to your setup. But it's not overwhelming, and it's really can be done cheaply.
I really want to circle back to what Robert and Gabby said about not being afraid to ask the hard questions and being yourself. So, 15 minutes is a really short amount of time. And just as challenging as it is for you to figure out what the personality of a program is, I think it's really challenging for us to be able to sort of see all of your merits. So, we read every single one of your applications beginning to end, but we don't even get time to sort of touch on that. If you feel like there's something you really want people to know, make sure that you find a way to highlight your strengths and your accomplishments, because no one is going to sort of ask you like, what do you think is the best thing you did, or like why are you the best resident for our program? That might not happen. I do also think that asking the hard questions, like, you shouldn't shy away from it. You shouldn't be afraid to look critical. I think that it's a good way to demonstrate that you've been thoughtful about the questions that you're asking, and that you're just not like lobbing softballs at us. So I think some of the best conversations I had were with people who asked me these very well thought out, sometimes critical questions.
Sorry, one last thing, Gannon. It's a little bit of a divergent, but it was off of also, Robert, you were saying, just be ready for technology difficulties to happen. I think it's really important to remember that once the interview starts, that's everything's a part of your interview, and you should act accordingly. So be professional, give a lot of grace. We'll give a lot of grace to you, and that's super important. And so, these things are going to happen, but don't take it out on the coordinator, right? Just be professional, be thoughtful. And I think that's really important. I always say this to everyone, just treat each part of that in this professional realm, because things are going to happen, and we want to see how you handle it, and vice versa. You want to see how we handle it too. And so I just think that's important, and that was sort of brought up on the side.
And then we've got a couple minutes left, so I just want to offer one more, and we don't need to be redundant. I think there have been some excellent points here, but is there anything, both program leadership, applicants, advice you wish you could have given yourself a year ago before you were heading into a virtual interview season, that you kind of learned through the process? Anything that you kind of learned through this that you wish you knew back then?
I would say decrease the anxiety on all levels, on every front. I think people have gotten really, if it's virtual, Gannon put some information that there's no decision yet, just so you know, from the EM, but we're talking as if it was, that there's, we're all getting really used to Zoom. These technological things happen, but we're all going to get through this together, and we're going to have really great applicants, and we're going to have really great programs, and there's lots of options from all that site. So that I would say, that's something that I would just tell myself and our team and my medical students as well when they're thinking about this process.
I think my piece of advice would be really, and I think it was brought up by Robert and Gabby already, but really just know yourself. That's the best preparation you can have for interview season, especially what I would recommend is really boiling down to what you're looking for in a program into maybe 3 points and your 3 highest qualities. Because when you interview and you hear what other program has to offer, they're all going to be slightly different, and they're all going to have different perks, whether it's parking or food and training and didactics. And then some, it's easy to get really caught up in a lot of pros and cons. But if you really just boil it down to what are my 3 most important qualities and sticking to those, it'll be easier to navigate, easier to rank, and then it's ultimately you'll land in the best place that it will make you happiest. So just be true to yourself and just really know what you are looking for.
I really love that. I feel like you learn an incredible amount about yourself after answering questions by yourself for, half a year. But I think it's important to know yourself when you go into those. And another thing, this is probably a super annoying answer for you guys, but this gut feeling that we talk about, like it is real. And I didn't believe it was real, but after you interview, write something down, write how you feel, write like a couple key takeaways. Just remember that because I don't know, I think your brain does a lot of calculations that you might not understand in the moment, but when you feel like you're surrounded by your people and when you feel like there's leadership that are going to take very good care of you and what you want, it's probably very accurate.
I think all of the advice I would have given myself has already been said. Definitely ask the hard questions. Something kind of a little bit less insightful, but like feel free to relax at these pre-interview socials and actually get to know people. I felt like I was like ready with my metaphorical blazer, even though I did that for the next day. You should like have a glass of wine if you want to and like see if you really fit in with people. And I feel like towards the end of interview season that came together for me and I had a lot easier of a time really assessing if they were my people or not. So yeah, definitely be yourself. I feel like we have said that over and over, but it is true.
Yeah, my advice would also be just to trust that gut feeling with a couple specific pointers. So this is true in every single interview season, not just this bizarro interview season that we had. One great piece of advice that I got when I was interviewing was to actually just record a really short voice memo with your impressions, right? Because like some of you may have like really like detailed spreadsheets and all these sort of values filled out that might, yeah, with like a point systems assigned and like weights to everything. Some people get really extra about it and that's okay, but that also doesn't oftentimes capture all of the characteristics of a residency. And so, even if you're able to record just a quick, like 2 minute, like, you know what, I was at this program, like, I really loved it, or like, it wasn't for me, like, there was something off about the feel, this one interaction happened. Like, you may not take notes about that, but it is really important. And the interview season can be long, and you may forget what happened in October or November in February. And so, I think that was really helpful. And I think my last piece of advice is more general as well, which is, there is no one, residency ranking system. I know that there are, programs out there who are trying to make it a thing, but really it comes down to what program is going to be the best match for you, what is going to be a good place for you to thrive and to support you. And so really, don't feel compelled to choose a program because they have the best reputation or because so-and-so told you that it's awesome. Just make sure that it's a good match and you'll be supported academically and also personally.
Awesome. I think that's really great advice. Samia, I love that, just recording something. I think oftentimes kind of place triggers memories, and in that situation where all of your interviews for a year may take place in your kitchen, I can imagine it would be really hard to differentiate between them. So I love that idea of kind of making notations in real time. I think in the interest of time, we'll move forward. I want to thank our panelists. I do, just to summarize, I don't think we know for sure what this interview season will look like. Both ophthalmology and OB-GYN have committed to an entirely virtual interview season with maybe some opportunity for a second look visits late in the season. EM has not yet made a position on this, but I can't imagine there won't be at least some component of virtual interviews as we look forward to this upcoming season. So to our applicants, I hope that this was a helpful session to kind of pull some tips and tricks and advice. And I think in my own reflection, I was super impressed at how effective virtual interviews were from our side as program. I felt like it was a really great way to meet people. And man, it was easy, and the financial benefits, I think, for our applicants make it really hard to argue. So we kind of stole our break earlier in the day. I want to recognize that people have been sitting for quite. All right, hopefully that worked okay. I apologize if there were some clumsy Zoom transitions, but one second. But thank you all for your patience with that. And I think we're on to the next session. So next up we have Dr. McHugh with How to Master the Personal Statement. Mary, just give me 2 seconds to give you co-hosting privileges.
While you're doing that, Gannon, I just want to thank the faculty. I don't know what everyone's experience was, but there was in the groups I was in, there's usually as many faculty as there was students. So really kudos to the faculty that came, and thanks for giving up some time. And for the students, if you guys have particular questions of our faculty, you could privately chat myself or Gannon, and we'll get you email addresses, or you could privately chat those people and continue the conversations that were started. So Mary, are you ready to go here?
Ready to go here.
Awesome. Thank you.
Hi guys, you can all see me? Yeah, thumbs up. Okay, awesome. All right, so thanks. Sorry for having me here. I'm Mary McHugh, Dr. McHugh, currently the co-clerkship director at UT Southwestern in Dallas. I'm here to talk to you about the personal statement, to give you some insight into why I'm qualified to do that. I'll tell you that I've read a lot of personal statements. I've advised my students on their own personal statements, and I've written a couple personal statements. To attest to that, I'm going to talk to you guys a little bit about, I'm going to take you back to a moment at my medical school orientation. Now, that was a very long time ago now. I don't necessarily have a lot of distinct memories of my med school orientation, but one of the ones I have was when they made a joke about how we were all there because we, liked science and we wanted to help people. And it really dawned on all of us that, oh, yeah, everyone probably wrote that in their personal statement, right? Of course, it makes sense. Why do you want to be a doctor? I don't know, you like science, you want to help people. But bringing you back here to now, I can kind of see that you're all here at this talk, how to write your emergency medicine personal statements. And I can, use my crystal ball and tell you a few things about yourself. I can tell you that first, you've probably liked all of your rotations up until now, except for maybe the rounding. And the differential diagnosis and making that diagnosis is your favorite part. Maybe you prefer taking care of any patient, regardless of their insurance status. And of course, let me guess, you're pretty good at multitasking. At the end of the day, it's very true that there's some commonalities to the EM-bound student that make many personal statements alike. And if you write about liking all of your rotations and multitasking, depending on your whole application, you'll probably be fine. In fact, just like liking science and wanting to help people got most of us into medical school, it'll also probably get you into your residency, right? The liking everything and being good at multitasking. But you're here at this talk to maybe do a little better, maybe stand out a little bit more in a competitive field. And this is where I think I can help. So the thing to remember about the personal statement is it's really your only free form aspect of the application, right? It's the only part that you really get to create what you want to do and come up with your own thing. So it's an opportunity, and it's the only opportunity you really have to do that. So I'm gonna have you guys sit there and think and start with some basics. So first of all, a little reflection. First and foremost, how am I at writing opportunities? If you're a great writer who's published in creative writing journals, i.e. not most of us, that's great. Feel free to get creative. You probably already have a process and your readers will probably appreciate that. If you're like the rest of us, think about how much time this might take, how much you really struggle with writing. It's perfectly great to read some personal statement examples. And actually today on the Cord listserv, someone put out a new bank they created of personal statement examples. I think that's great. One huge caveat, read those samples early on in the process. Separate that time that you read samples from when you actually sit down to write it, so you do not end up reproducing or obviously no one would directly copy. We know that's bad, right? But you also can kind of indirectly copy someone's narrative and you don't want to do that. So next, go ahead and line up your resources to review your personal statement and start brainstorming. I'll tell you the first step is really preparing your CV. As you work on your CV, think about the things that you want to go on and on about, right? Think about the things that feel like, oh man, I can't believe this only fits in one line. Think about the things that you really got help define you and are not line items on a CV. Your relationship with your family, a long-term commitment to meditation. I mean, some people spend a big chunk of their lives doing something that they're really dedicated to, and it's just not really a CV line item. Those are ripe for including in their narrative. So as you think about those things and you think about those activities and this kind of concept of the opportunity, what are the characteristics that you find? Like, what is that narrative that kind of helps you puts everything together? So have you been an outstanding team player? Like, what did you do that showed what an outstanding team player you are? What experiences can you tell me that make me want to have you on my team? Have you displayed outstanding resilience? Residency is a challenging experience. We all want to know our future residents will respond to that challenge, right? Are you super mission focused? So did you decide to apply to medical school because of an experience you had before that made you want to be an ER doctor? That's great. Tell us about that. Think about these things in light of that narrative. And then kind of we transit to this idea of taking advantage of the opportunity. So with this opportunity, it kind of is a different opportunity depending on who you are. And I'm going to highlight like kind of three broad categories that this falls into. So I would say that the opportunity falls into an opportunity to showcase, an opportunity to see into the future, and an opportunity to explain. And we'll get into each of those. So with respect to the opportunity to showcase, this really is most students, right? And you guys can tell from how I'm giving this presentation, I really struggle with the Zoom format, right? I want to use my hands. It doesn't work so well with Zoom. So this is my showcase hands, right? I'm supposed to be giving jazz hands. So for most students, this is what it is, right? This is your jazz hands moment. So maybe you take those CV things. So maybe you founded an organization, right? Founder is one word on your CV, and someone could even miss that reading your CV. So tell me a story about what motivated you to found that organization, how you identified a problem, how you worked through that problem, what challenges you came across, right? Maybe you've dedicated your life to a specific athletic pursuit. And maybe it's something that, hey, varsity athlete, that looks good on a CV, right? But it still doesn't embody exactly what that entailed. Maybe it's one of those sporting things that, you know, climbing every peak and things like that, that really doesn't even fit that well. It kind of falls into this interest thing. But we know that that involves a lot of planning, a lot of mistakes, a lot of overcoming challenges. So tell us more about how you have experienced that. I've also mentioned this is an opportunity to tell us about something that doesn't fit into the personal statement. I mean, into any other place on your application, into your CV. So maybe it's a challenge that you specifically had to overcome. Maybe it's a hardship you endured growing up and something that defines you, that gets you out of bed in the morning. This goes back to the resilient resident, something every program director wants to have. I'll tell you that most of us, we feel like we can train someone who's academically capable and resilient, right? So there are a couple caveats to this, and I want to be clear about that. The greatest challenge to highlighting the non-CV hardship is it requires an opening up, right? Once you've brought something into your personal statement, it becomes knowledge to the reader. There's a good chance your reader will want to speak to you about this during the interview. So use caution if you write about a situation that you have a difficult time speaking. This is a great time to sit down with an advisor. Talk with them about the experience, what you want to highlight, why you think it could be good. If sitting down and talking to them is really difficult to do, then you have a decision to make, right? You can either practice talking about it, find a community of people that you can practice talking about, or maybe you have to say, you know what, I'm not going to be able to get through this. This is going to potentially derail the experience. So let me be clear, in that interview, when we talk about challenging things, it's okay to show an element of emotion, right? That's perfectly okay. And in fact, would be expected in some situations. But if it's going to derail your opportunity to showcase yourself, right, then it's probably better off not going on there. The other caveat to this is recognizing that if your personal statement reveals something about you that isn't otherwise on your application, and that legally residency programs are not allowed to ask, right? So there's certain laws that protect people seeking jobs, and that's what the residency application process is, right? So these are questions that we are not allowed to directly ask you in an interview. And you, though, have a choice to share those. I would tell you, and I think the advice you're going to get from most people, most program directors, is share something that's important, and the reception you get on that helps tell you if that program is a good fit for you. And I think that's true, right? I think that most of us would say, yeah, no, that makes sense. If you have a challenging situation, you want to go somewhere that's going to accept it. On the other hand, the caveat and the thing that's like nuanced on that is these laws exist to protect people for a reason, because whether it's stated or unstated, sometimes these are things that prevent people from offering someone a job. So you do have the prerogative to highlight other things and keep something to yourself that you think might be taken in the wrong light. So in that note, for some people, unfortunately, they need the personal statement as an opportunity to explain a discrepancy in their application, right? It's important to know that just like I talked about with revealing some personal information, this is a considered decision. Not all dirty laundry needs to be aired, but some things that should probably be covered. Examples. So let's say that you took your step one the day after your aunt's funeral and it isn't consistent with the rest of your academic performance. You had an illness during a semester of medical school, and again, that semester doesn't represent your best work. If you have a professionalism or legal issue that will show up in your dean's letter or otherwise on ARIS, you need to take your personal statement and you should address that situation. Use it to explain what happened. More importantly, focus on how you were able to use that experience to make you a more prepared resident, a more prepared person. So there are some situations that are kind of reasonably out of control, right? And with COVID this past year, there's probably a lot of different caveats and things like that. And it is okay to have the situation be, well, here's sort of a caveat. And that's okay to kind of just explain that. On the other hand, if you don't take some responsibility or ways that you would have done things differently or things like that, that's going to actually turn into like an additional red flag in your personal statement, right? Program directors want to hear that you're someone who, when a mistake is made, when something bad happens, you turn that around and you turn it to your advantage, right? So if you bring it up in your personal statement and you just make excuses for it, then you haven't done the right job of sort of taking advantage of this opportunity. As a caveat, remember, and again, I apologize, a lot of this is specific situation, right? But if it's something like, well, I'm not a great test taker, that's going to be apparent in your application. Highlight something else, right? Highlight something else. Again, so if it's a discrepancy, great, explain it. But if it's kind of something that you're like, you know what, I'm actually just going to spend another page of my application topic talking about something that's pretty obvious, then it may not belong there, okay? And again, that's kind of the considered thing to talk to your advisor about. So for some students, and this is a little, again, a niche student as well. So not necessarily most people wouldn't fit into this situation. You came to medical school with a specific idea of what you're going to do after residency, right? And your application to residency is just another step along that way. Maybe you have a specific community that you have plans you're already going to help. Maybe you have fellowship plans. Absolutely talk about this in your personal statement, right? So you can share a specific vision you have for yourself and how training in emergency medicine at wherever you're going to go is going to help you get there. Tie it together with previous activities, right? Show evidence that you know kind of what you're talking about and what you're going to get into. And this is where it's perfectly okay to take some imaginative license here. No one is going to track you down in 5 years and be like, hey, wait a second. You said in your personal statement 5 years ago, right, that you were going to do this. What are you doing now, right? All of us are probably somewhere a little bit different than we imagined 5 years ago. That being said, you do want to consider, like, how much have I thought this through and things like that. If between now and when you sit down in that interview chair, those plans might drastically change, one, remember what you wrote in your personal statement. That's okay, right? And have a reason of why that's kind of evolved or changed, right? So you always want to have like that little bit of insight, right? Because again, this personal statement is an invitation for people to talk to you about something during your interview process. So absolutely create a vision for us of what you want for yourself, but take that forward into the interview. So you guys, I've given you kind of an idea of some ways to shape your narrative, right? Some ways to make it a little bit different. And I'm going to talk a little bit about some caveats. I know that, most of the people on here, look at Tom Morrissey and the number of personal statements he's read, right? It can feel a little bit like, hey, let me tell you what not to do. And I wanted to avoid that in this talk, but there are a couple things that we really have to think about, things to avoid. So one is remember your audience, right? So your letter is going to be read by emergency medicine physicians. We want to hear why you and your experiences make you a good fit for our field, right? We don't need to hear about the field of emergency medicine and what that's like. You can assume we probably already know quite a bit about that, right? That's what we do. We want to know about how your resilience will make you good at emergency medicine, not how you need to be resilient to be good at emergency medicine. It's kind of a subtle narrative difference, but it really makes the difference between you kind of be someone you want to meet and like, oh, wait, I have to read more about emergency medicine. And I just got off my shift and I'm reading these essays, right? In that light, be cautious with any flair for the dramatic, right? So telling a well-written dramatic story about something that happened in your life sounds great. Pass the popcorn. But it's very hard to tell a dramatic story about a patient you took care of in the emergency department that will impress the people who already did this for a living, right? These personal statements are okay. Sort of like, I like science and I want to help people, right? The moment I put my hand down and felt the return of the pulse, I knew that I wanted to be an emergency medicine physician. That's okay, right? We all love those moments. We all strive for those moments, but we also recognize that the breadth of emergency medicine and what we do is a lot more than those moments, right? And you don't want your personal statement to come across as, this is the adrenaline junkie and that's going to be their focus, right? You definitely want your personal statement to sell more about who you are. Another thing, so some of you are great narrators and some of you are very intentional people. Everything on your CV actually goes into this great story of how you're going to be an emergency medicine doctor. Stop. Hold up. The person reading this essay will either have just read your CV or they're about to read your CV. Don't waste it just sort of repeating every item on your CV, right? I guess if you put the caveat in there now, you don't have to read my CV, but generally speaking, you wasted the opportunity, right? Use it to expand on something, use it to create that narrative, use it to make it a little bit different. Don't just waste time sort of repeating things that are already known. It wouldn't be a talk about personal statement unless I talk about the personal statement, right? So do I need to create a personal statement for every program that I apply to? In general, no, okay? If there's a few programs that you have a very specific interest in, okay, or a geographic area, and you can incorporate that into your narrative so that it cohesively makes sense, right? Then absolutely you can do that, okay? But if that very specific interest means I've read your website multiple times, we do not need to hear repeated language back from a website to us, right? It actually comes across as pretty obvious. And again, it's sort of a waste of your time and a waste of the person reading that personal statement, their time. So certainly feel free to incorporate, right? Specific things, specific programs. For most applicants, that should be a very small list, right? A couple personal statements that you might make different. Now, the huge caveat to that, right, is use extreme caution when you're uploading to ERIS, right? Label these things super obvious, make it very obvious that what you're doing and make it really easy for yourself so that when you upload these things, you do it correctly. It's certainly not going to help you to send a personal statement saying how surfing is the #1 way you relieve stress to me in Dallas, right? I'm like, well, you're going to be pretty stressed in Dallas if surfing is the #1 thing you do, right? So be super cautious. Make sure it goes to the right programs. Remember, this is one person's opinion. In preparation for this talk, I read a lot of personal statements. I did some research into some other people's thoughts. And as mentioned many, many years ago, I too wrote a couple personal statements for different things, right? Actually, one of those was one of those messy, difficult to write ones. I recognize for most people, the challenging topic isn't necessarily the issue. Maybe you feel like I kind of have the straightforward CV for emergency medicine. I don't necessarily have a great hardship to write about. You don't have to have overcome an incredible hardship. You don't need a complete 5-year plan to write a good personal statement. your personal statement may even fall into that like science and helping people category. That's okay. Use spell check and keep it short. Keep it to the prescribed length and let the rest of your application speak for you. Thank you guys. If anyone has any questions, I'm happy to take them.
Thank you, Dr. McHugh. That was excellent. We have a few minutes if anyone has any questions about personal statement. I think there was a ton of really actionable advice there, so thank you.
And thank you, Sarah, for sharing that personal statement library for examples. Again, use caution. Don't accidentally repeat someone else's personal statement.
Great. I think we'll go ahead and move on. Our next session will be co-presented Dr. Lexi Mannix and Dr. Melissa Parsons about taming ERAS. Both Dr. Mannix and Parsons are assistant residency directors at the University of Florida Jacksonville EM residency program. And I think Dr. Mannix is also assistant clerkship director, if I'm correct in remembering that. I don't know which one of you is going to share, but if you want to take, I think you both have co-hosting privileges, so feel free to get started, and thank you for being here.
Thank you for having us. Lex, you there?
I'm trying to unmute myself. Give me a second. Sorry, guys, you would think we'd be better at this after a year. I'm Lexi Mannix. It's nice to meet you. I'm here with Dr. Melissa Parsons, and as Dr. Sungar just introduced us, we are both faculty at the University of Florida College of Medicine in Jacksonville. I assume you guys can see our intro slide, and that includes our Twitter handles. If you have any questions after the talk, please feel free to reach out to us.
As far as financial disclosures go, it's not really a financial disclosure. We run a website on the side called GMD. That's about it.
Okay, so in med school, have you ever felt like everything was on fire? Like your life was going up in flames, like everything was falling apart? And do you feel that way when you think about applying for residency and for the match?
As an emergency medicine physician, assistant residency director, wife of a firefighter, and stepmom to teenagers, I spend the majority of my life putting out big fires. And I found that the best strategy to stay on top of this is to put out the little flames before they become those big fires.
So how do we put out the little flames instead of having it turn into a big fire when it comes to the match? Well, first you have to be prepared for what's coming and know what's going to be expected of you. Attending this talk was a great first step.
So next you need to know where to go to get information. And so this is the AAMC website. And what's cool about it is you've kind of progressed along, right? At one point you were using the applying to med school tab, but now you actually get to use the applying to residency tab, which seems like a really big deal. So this is you, and from here you're going to get more information about ERAS, which we're going to share with you as we go through this talk.
So what is ERAS? Is it just another medical abbreviation that you've had to learn over the past 4+ years of your life? Yes, but this one is a little more important than maybe some of the others. This one stands for the Electronic Residency Application Service. And basically this is one place where you put in all of your information, so you only have to submit one application, and then it streamlines kind of how all of the residency programs receive those applications.
So this is where you're going to find tips and tricks to applying for residency. It's also where you're going to register, and you're going to find timelines, frequently asked questions, like all of the information that you need, the most important being timeline.
And this is another really great resource that is updated for this coming year. If you can scan that QR code, it'll bring you there. But basically, this is just updated for this cycle and is your guide to ERAS.
So like I said, timeline, most important, right? You have to know the dates. One way to very quickly make a small flame become a big fire is to miss one of the deadlines, right? So ERAS is going to open in June, and then you all will submit your applications September 1st-ish. And we will get to start reviewing those applications around September 29th this year.
And like Dr. Parsons said, if you miss those dates, that's going to be a big fire. So keep an eye on those dates, make sure that you're ready to submit when the time comes.
So what actually goes into your ERAS application, right? And you guys have heard a lot of different parts of this throughout the day, it seems like, especially as we just heard about personal statements, but we're gonna touch on kind of all of them as we go through so you understand what those of us that are faculty here will be looking at once you apply.
So the first thing is just kind of your basic information, right? What is your name? What is your date of birth? Where are you from? And it includes a lot of other like random stuff. So be prepared to kind of answer all of those questions.
And then you're going to input a CV, right? So you actually fill in a bunch of blanks that come in as an ERAS form, but then you get to upload a CV also. And that is really important because it gives us a look at like how you wanted to format your CV, what that looked like itself. So you want to make sure it's up to date, it's clean, organized, all of those sorts of things.
The next thing you're going to have to upload is your transcript. And we can't change or edit or do anything to our transcript, but what we can do is make sure it's uploaded. If you think about all the other students in your med school has to upload all of these. And I would just kind of stay on top of it and make sure it gets uploaded by the time it's supposed to be there. Another important thing about your transcript is if you're at a medical school where you went to undergrad, your undergrad grades may be on your transcript. So just be aware of that. There's nothing we can do to change it, but someone might ask you about Calc 1 during your residency interview.
So then you're going to upload your USMLE and COMLEX scores, your board scores, right? And those are things you can't change them at this point. You can't do anything about them. You just need to make sure that they're there and that they're available for everybody to see.
Okay, so now we're going to talk about your picture. So you're going to have to, well, not absolutely have to, but I honestly would probably recommend uploading a picture. But there are some kind of rules around pictures that we should upload, right? Probably not a selfie, probably not a mirror photo, probably not at a football game. So all of these photos of Dr. Parsons and I are probably not the right photos to use.
I think the fishing one's pretty good, in all honesty, but continue.
You'd be pro that one if you saw that pop up on your application review. So we'd recommend kind of focusing on something like this, a photo where you're by yourself, where there's reasonable lighting, where you look like what you look like. You don't have to be in a white coat. You don't have to be in a blazer, but I wouldn't use a random photo from, going out partying with your friends. Take an intentional photo for this where you look professional and then also look like what you're going to look like on interview day.
So dermatology actually did a study looking at match success in ERAS photos. And what they found is people who smiled, people who wore glasses, and wore jackets were more likely to match. Now, that being said, I don't wear glasses and I don't expect you to go out and buy glasses just for your photo to help your chances of matching, because I don't think that's what it's all about, right? But it is important to have an appropriate photo. It is sometimes helpful if you look similar on interview day to how you look in your photo. I will say sometimes for us, that triggers like, oh, I remember interviewing this person when we pull up your photo and we're making our rank list and we haven't seen you in 3 months. We haven't talked to you in 3 months. We don't remember what you like. If your photo clicks with what you looked like on that interview day, that's a little bit more helpful to us. So maybe putting on a jacket may be helpful. Please don't go out and buy glasses just because this study showed that was helpful. And then you're going to include your medical student performance evaluation, which is your dean's letter, is going to be in there. So this will have your grades while you've been a med student, commentary from your third year electives. A lot of the programs will talk to you in advance and kind of will get information about what things you think are really important on there to be included. You want to make sure that you read it, make sure that you proof it. It is one place where we really pull stuff to ask you from in your interviews. So if you are dumbfounded by what's in there on your interview, that's going to be a scary experience for you, and it's questionable for us as well, right? So you really want to make sure that you know everything that's going in there. It is a little bit like having a letter of recommendation from your mom, right? Because all of your programs are going to want you to match, right? So it is a little bit biased. We know it's coming from your mom, but it is helpful. So make sure that you know what's in it.
So while the MSPE might be a letter from your mom, the SLOs are kind of a letter from our friends, right? The people that we know from conferences, from years of doing this. And I know that y'all have already had a little chat about the SLO, so you already know they exist. You already know you're going to need to get them. But what I would say is important when you're thinking about ERAS is make sure that they're uploaded and make sure that it's specifically the one you want to share with that program is uploaded. If for some reason you have a certain letter of rec that might come from one of our grads, that would be great. And we would probably really love that. But another program may not want that letter as much. So just think about the letters you're choosing, make sure they're uploaded, and make sure they're assigned to the right programs.
So the personal statement, we just heard a great talk on this. I'm not going to go into a ton of detail, right? The advice I normally tell people is don't be the person who tries to have the most ridiculous personal statement ever to stand out, because it doesn't always work in your favor. If you have big red flags on your record for some reason, or something you think is a red flag, this is your opportunity to talk about it and let us know why we should consider you, despite what we may see on your CV or your grades or your board scores or whatever it is. And keep it simple. One page. But also don't assume that we've read your personal, like we may have read your personal statement 3 months prior, and when you come in on interview day, we may not remember something awesome about you. So never assume that people know. Go ahead and tell people that in an interview also, because I think a lot of times, like, I will purposely not read some of the information so I can go in with an empty slate and let you kind of present who you are to me without me having any ideas from reading your CV. So that gives you an opportunity to repeat yourself, and that's fine.
Okay, so know the rules. We're going to share with you kind of the big, broad rules of submitting your ERAS. And the first rules are don't lie, don't embellish, and don't plagiarize. And that kind of goes in all areas of your professional career, but especially here. Anything that you put in there, we can ask you about. And you don't want to put something in there that's not true. And then if we catch you in that, that's not going to be great.
Yeah, so be yourself. We want to match people that are going to be happy at our program, and we want you to be happy wherever you go, right? So one thing is, I had a rotator come in who said, I love fishing, blah, 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 because she was at Florida. And I don't think she expected me to know all sorts of things about fishing, right? And then when I was like, oh, what do you love to catch? What do you do? Blah, blah, blah. It was very apparent that she actually has never fished in her entire life and was just saying that, right? So don't do that. Be yourself, let yourself shine, whether it's in your application process or on the interview trail.
So be ahead of schedule. My phrase is always early is on time is late, and late is unacceptable, right? And especially here, like, know the timeline, have your stuff ready to go, and be ready to submit when the day comes. Because it gives you a little bit of flexibility if something is delayed, whether it's your transcript or your letter or whatever. If you're ahead of schedule, you will definitely be on time.
And then be neat, be concise, and make sure that you proofread.
And don't certify until you're sure. So once you've actually certified your ERAS application, you cannot make any further changes. So please be sure you're ready to go. Have a friend review it. Have your clerkship director, if they're available, or somebody else who is willing to take a look over everything and make sure that everything looks great before you certify.
All right. So normally we do this in person, right? And how many of you are in a long-term relationship? How many of you are married? And then my next question will be, did you make an Excel spreadsheet about the positives and negatives of that person before deciding to enter into any long-term relationship with them, right? And I think most of us probably didn't. We probably just figured out whether or not it was a good or bad thing, right? But a lot of us go into the searching for a residency program with this, like, I'm going to make an Excel spreadsheet and I need all of these things to be positives and I can't have anything in the negatives column because I have to find the perfect fit program for me, right? And that's not really probably realistic. I think the thing is you need to find a place where you think you can be happy. I know for me, I found a place where I went to work every day and was really happy on my rotations and was like, I don't know if it can get any better than this. And it hasn't yet. So no program is going to be perfect. There's going to be positives and negatives of every place, right? Kind of like whoever you're in a relationship with, you make the best of your partner's imperfections. You're going to do that in residency too. But you can still keep your Excel spreadsheets if you feel very strongly about them.
I feel like you would have an Excel spreadsheet that's color coded, just knowing you as a person, but
I did not. Just to be clear, I did not.
So we hope that this talk today has helped you turn the big fire into a very reasonable size candle flame to help you moving forward. And we are here for any questions. I think we've got about 5 minutes, but like I said in the beginning, we're also available on social media, on Twitter, if you have any additional questions afterwards.
So we did get one question. I think Morrissey answered it. But thank you to Tom Morrissey, because 2 or 3 years ago, he voluntold us to give this talk, and he's now here laughing at us while we do it. But somebody asked about uploading the CV, and do you do it as a PDF of your CV, or are you also putting everything into boxes? And it is totally redundant. It's both options. And that's why I say, like, how your CV looks is important. Some of us prefer to look at the ERS version of it, and some of us would prefer to see your version. And so everybody gets kind of to pick their preference in that scenario.
And by pick your preference, you mean faculty can choose which way they look at it. I would strongly, strongly recommend uploading both formats. I would not just choose one or the other.
And then the next question, does submitting on September 1st versus September 28th matter? Go ahead, Mannix. You're shaking your head.
I personally would say probably not, but I would make sure that everything is uploaded by September 28th. And if you upload earlier, you've got a little bit more flexibility to see what things you're missing.
Yeah, I do think submitting applications after residencies have already, like, once we're able to pull data, we pull data. And so we may miss somebody who applies to us after that time period. And you may have a phenomenal application and we just may miss it because we kind of pulled all of the people that applied to us and started searching through everybody's applications.
Thank you, Dr. Parsons, Dr. Mannix. Excellent talk. Your comment about embellishment, I think we've all heard the horror story of, like, saying you're fluent in French and then having your interview conducted in French. But apparently it happened once. And so take it to heart. We have a few more minutes. If there are any additional questions, please feel free to raise your hand, just chime in or throw something in the chat. But I want to thank you both for being here.
Thank you for having us.
Thank you.
I have a question. If you can just be a little more specific about those PDFs that we upload. I haven't ever seen any advice about, like, font, spacing of the lines for the personal statement. I keep hearing 1 page, but, like, what should that look like? And then I wasn't aware we have to upload a PDF of our CV. So is it supposed to be like the 1-page quick look resume, or is it like an actual CV?
So the CV is your actual CV. So whatever that looks like, I think having more than 1 page is perfectly reasonable and kind of expected. I wouldn't necessarily present, like, just a resume, but include other stuff you've done in it. In terms of the formatting of that, that's kind of up to you and your mentor, and for you to figure that out. And honestly, we kind of learn a little bit about you based on the way you format your CV and what font you choose and what the spacing looks like and what things you think are the most important. As for the personal statement, Dr. Parsons, please correct me, I think it's formatted through ERAS. Like, I don't know if it's an actual PDF. Is it a PDF? Gannon's shaking his head.
You copy it into a like text box, and then it's formatted but I would be careful when you copy it, because if you're coming from Word or a different word processing program, it may copy in extra spaces and stuff. So use like the simplest. I think people will give you the advice of using like Notes or whatever is like the simplest word processing software to make that transition, because it seems totally idiotic, but we reviewed, last year I reviewed almost 200 personal statements, and you get used to seeing a pattern, and then you see something that's like got 11 spaces between paragraphs, and you're just like, I can't read this. And so try to have it just be completely simple. It's typically going to be single spaced with a break between paragraphs, and very clean, limited formatting. I don't know if that answers the question. Okay. Just looking here. CV question for something like SAEM oral presentation where an abstract is published in a journal supplement. Should we put the oral presentation, published abstract, or both? Welcome to academic medicine. You should put every single thing that you can possibly claim on your CV, so that it can be 150 pages long when you're applying to be a professor. But yeah, you can double count things if they're presented in multiple formats.
And be ready to talk about it, because we might ask you.
Yes.
Well, and that's why in academics, we talk about the idea of a regional presentation, a national presentation, and then turning that into a publication. So you get all the bennies you can get out of that project. So I agree.
Excellent. Thank you, Drs. Mannix and Parsons. I think we'll move forward. Next up is Dr. Cynthia Price. Dr. Cynthia Price is a Associate Program Director at the University of Connecticut Emergency Medicine Program, and she's going to talk to us about Interviews 101.
Yeah, sorry about the infringement of my video just a second earlier. I thought you were getting ready to say, and on that note, but then you didn't. You answered another question. And so then I kind of got waylaid a little bit. So I'm going to really quickly talk about interviews. You guys have heard a lot today. I hear a lot of some of the information that I'm going to cover. And so I'm going to just try to get through the end. I tried to pull out the pictures so you guys could screenshot and look at stuff easier next time. But yeah, it's important. I will tell you, going forward, I am pretty sure we are going to end up back with virtual interviews this year. A couple of programs have already made that declaration. And I know as of this past Friday, that was the recommendation to the ACGME for this time. Has not been officially adopted yet, but that is the recommendation. And so we're going to go forward from there and then see what happens. You guys have a little bit more information on virtual interviews coming up. Well, let's see how I can get this to, oh, there you go. So very quickly, preparing for the interview. Some things you guys should know. I want you to know a little bit about my program so that when you are preparing to come into UConn, I think you should ask yourself, why us? Why? What are you looking for that makes you want to come? It is going to make you be able to target your questions. And when we ask you questions, to be able to hear that coming back sounds great. So in preparation, do a little tiny bit of research. You might get a list of the interviewers that are coming in before. Look them up. Is that the SIM person? Is that the ultrasound person? So you kind of know, again, how to direct your questions and how to answer the questions that they're asking. I think it's strange for anybody to apply to my program if there are graduates there or current residents there that have not been reached out to, approached, asked for some questions. I want to know, oh yeah, well, my best friend is Rahul and he is there now and he told me some great things. So please, if there are any graduates at the med school from my program, please go ahead and reach out to those people, because they in turn will come back to me, hey, my buddy is applying this year. Don't cancel your interview the day before the interview. You'll keep hearing us talk about how it's a small club. It actually depends on the platform. So you guys know on Interview Broker, if there's a week you will be able to cancel that and somebody else gets automatically slotted in, and I'll get the change, and then the day before we can get that. But at some point they lock, and if some people are using not an automated program, you look so bad if you take the opportunity from someplace or somebody else to interview when you decide that that's an interview that you don't want to go to, or something untoward happens. You can't predict all the bad stuff, but my goodness, do your best to reach people in real time the day before, an hour before, to try to give people a heads up that something really unfortunate has happened and you have to cancel. But if you can avoid that at all times, please avoid canceling last minute. In preparation, this goes on your ARAS application. Try to get a professional email address. We had somebody apply to us recently that was like Dr. Boopsie Matupsi or whatever was their email on the application. And so that just was kind of, first of all, you were calling yourself a doctor before you even graduated from med school. And then the fact that it was kind of a goofy name didn't exactly come off maybe the way you thought. So get a professional email address instead of imthebest@gmail.com. Please read your CV and personal statement the night before. As I just heard somebody said, all of that information is beholden to you guys. You should know. A lot of people will start out their personal statement with a great quote, and then I ask a question about the person who made the quote, and you go, who or what? So please make sure you are familiar with your CV and personal statement from the day before. Transitioning from preparation to that actual interview day. Do not be late. In virtual world, check the time zone. We had a couple of people who missed out on things because they mixed up the time zone. Review your devices and the Wi-Fi. If you are changing places, make sure your iPad is charged up and your laptop is ready to go and you have the cords, you know your camera works, all of that stuff for virtual day, particularly because there's not really much of a backup other than me picking up the phone and then trying to interview you over the telephone. Please check your devices before. Do not be late. If the overview starts at 9 o'clock, try to get logged on by about 8:45, 8:50 to make sure that everything is in accordance. Please don't chew gum. It's bad in person, but it's so much worse on video. Please do not chew gum. Be a little bit conservative in your dress, even online. You don't want to be that person who we remember because you were wearing something a little bit crazy. So, there's some basic collared shirt that should be out there. Slacks is a good idea. I'm hoping that we won't see from the bottom down, but you don't ever know. So just make sure. Cleavage is always an important thing. Be mindful of your tattoos, body art, piercings, and the camera angle. So when you've got things that are angled down or angled up and there's particular decorated parts and pits hanging out, we want to remember you, and we are emergency medicine. We are probably the most tatted specialty out there. If there are going to be piercings, we in emergency medicine are going to have them. However, during the interview, I don't want to be distracted by seeing things moving and things going on where probably that would be something for a later day, maybe a day out at the lake, and I have to notice different things about you. So just be mindful of those things. Put your cell phone on vibrate. It's always distracting. People forget that. And I will tell you, it doesn't matter how you're keeping track. Make sure you value the impressions the program makes on you and the people and keep track of it. Get some sort of way that you have so that you can assess fit. A lot of people have talked about fit today, but I think from the interview day, that is one of the most important things. I think if you're worried about, I got to remember, get some boxes, tick things off. You'll have some time during the interview day to make sure that things are happening so that you can concentrate on what's actually going on. So answering questions, be consistent and honest in your answers. I just heard, but don't tell the sim person you want to do sim, and don't tell the ultrasound person you want to do ultrasound. Be consistent and honest in your answers. Answer the question asked. All the time, like, tell me a weakness about yourself, and that gets turned into oh, well, let me tell you something good about myself, or let me tell you a weakness about emergency medicine. Listen to the question and answer the question asked. That is a very, very, very common thing that we see. People, you guys have prepared and you've done all this stuff. And so you have these set answers in your head, and you want to make the question that I asked fit into that prepared box of dignified, qualified answer that you put together. Make sure you are listening to the question and answer the question asked. Don't get flustered if you get a curveball question or critical thinking question. Take a minute, take a breath, and say, okay, this is the best that I can do, and just put it out there. There are some questions that might throw you for a curveball. You know, well, what do you think about this part of the United States? Or have you ever had to handle 6 months of winter before? And what do you think about it? Maybe nobody else has asked those things. Don't get flustered. Just take a breath and go, wow, I've always wanted to try winter sports, and I'm very excited about maybe looking for those things. So just take a breath. We know that we are asking you things that potentially could make you need to take a second. So here's some questions you may be asked. So these are some of those things that you should have in the box. Why EM? Why this program? What are some of your goals? What do you like least and best about emergency medicine? I want to hear that you kind of at least know that the schedule could be crazy, or you might have to work Christmas, but maybe the best thing about it is you don't have to carry a pager when you're not at work. You're off when you're off, and you're on when you're on. I want to know that you know what you're getting yourself into. And if you're like, oh, I love everything about emergency medicine, then that tells me maybe you haven't done as much exploration into the specialty that I do every day. And so be prepared about asking and answering these things. Why should we pick you? What can you bring to the table? What are your strengths and weaknesses? Most of us also will ask you, what questions do you have? And this goes back to your prep work. What do you know about my program, where it's located, or some special strength that I have, whether it's a helicopter program or a pediatric thing, or how many hospitals do I rotate out? Please pick a couple of questions so that you can seem interested, even though you might not be at this point. Some questions you may want to ask. Yeah, what do you think is the greatest strength of the program, and what kind of curriculum is out there? How many hospitals participate? I will tell you, if there is an overview, and most of us are doing an overview when you come in or at some point during the day, try to pay attention so that you're not asking a question that we spent 5 minutes covering in the overview. Funding and time for conferences and meetings. That's probably something that I already addressed. So make sure you are paying attention so that you can cross those particular questions off. If you want to ask about the patient mix and what is the community like, those are great questions, because it makes me think this is a person who not only is looking at the program, but they're also looking at the patients that are coming through. Questions you should not be asking. I just heard the previous presenters talk a little bit about the illegal stuff. These are questions that, while you should not be asked them, I want you to come up with a polite way to not answer the question, just so you have it in your head. What are your plans for a family? That is nobody's business but yours. Are you married? Do you have children? Many of you will include these things either in your hobbies or in your personal statement. If it is in ERIS, it's fair game. But if it's not located anywhere there, then again, not anybody's business. So just politely figure out a way to sidestep around these things. We are not supposed to be asking how many programs and how many on the East Coast did you apply to, and where do we stand? I really only want to talk to you if you are, we're high on your list. We can't ask you those things. So just think now about some crafty ways to step around those questions, but your business should be your business, and make sure that you are holding people. And maybe that's something you mark down in your paper at the end. They kind of ask me a few illegal questions, and then think about how you felt about that. So some general advice: be polite to absolutely everyone, even if you don't know. We already heard about the Uber driver and the person who threw towels on the floor when they stayed at the resident's house. The interview starts at the time you guys are doing some of these virtual get to know my programs and virtual look-sees by SAEM, or all of these different things that they have. When your camera is on and you are looking at us, please know that's still part of the interview. If we do get to interview in person, your interview starts when you step off the plane. It might even start with the person you're sitting next to on the plane. So just be very cognizant that a whole lot of your life at this time of the year has to do with the presentation of your best self, your best self. You guys can, I saw it be a jerkomania or something earlier, but you gotta hide it. You gotta hide it for a little bit of time so that you can figure out how to be your best you and put your best foot forward. Home, please do not badmouth other programs. I think this is one of the biggest mistakes we see. If I'm at UConn and you're gonna come and you're gonna badmouth Yale, you gotta know we're neighbors. You gotta know we're a small state. We are a small specialty. We all know each other. Please do not say negative things about other programs. You can talk about your fit and why something is good one place and maybe not another place, but you're overall bashing a person or a particular part of that program. I think it doesn't bode well for me to think that you're going to bash my program also after it's over. I can't tell you how important this next one is. Stay energetic. You see me, even though I've been on Zoom since 8 o'clock this morning, sometimes I'll even turn my camera up and stand up. Stay energetic the whole day. Do not look bored, even if you are. You just got to figure out a way to fake it. Expect that after a dozen interviews or so, you are going to be tired and a little bit bored, and you might have already done a few of your top programs. Maybe think about scheduling your most important interviews in the middle so that you've gotten a few out of the way and you've developed some great answers to the questions, but you are not quite at the point where you're overly tired. Thank you cards, either by handwritten or email, are not required, and some programs will actually ask you not to send them. If you do send them, please, the blanket statement of thank you for interviewing me doesn't really do much for me. Say, hey, I loved hearing something about UConn. I think it's great that you guys have a helicopter program and you are uniquely situated between New York and Boston so that my money can stretch far because I want to get a dog. Those kind of things make it a little bit fun to read your thank you card. Again, they are not required, but if you're going to take the time to do it, at least make it a little bit interesting for the program. Do not be discouraged if you've got one bad interviewer. Please, there's that old curmudgeon person that sometimes just sitting around that they honor that person by letting them on your day be part of the interviewing staff. Don't be discouraged. Some people are just odd. Some people just like making people awkward. We would like to think that we as a program are also putting our best foot forward, but every once in a while it goes a little bit awry. So it only takes one person on the panel to really like you and hopefully get jazzed up. And if something else doesn't go right or you couldn't answer a question, just let it go on to the next person. We'll get it there. If there's a night before activity, do it. It is part of the interview. They say it's optional. Please let me just tell you, it is not. If there's a night before activity, again, it's your opportunity to be the best version of yourself. Remember, when staff or faculty are not around, people are listening and that information might get back to us. Our coordinators are in the waiting room and we're waiting for you guys to pop on screen, or they're the ones that are showing you into our coffee room and we are waiting for interviewers in person to start. They are part of the process. So just be very cognizant of what you are putting out there in the ether because you just don't know. Couple of closing thoughts. Remember, you will be spending the next 3 or so years there or more if there's a fellowship or you love it. So pick a place that is a good fit for you in regards to the people, the opportunities, the location, and your specific priorities. Just that's the most important part of the whole interview thing. I will tell you, we get about 1,100, 1,200 applications for our 18 spots. If you are interviewing at our program, it means we already saw something about you that you cut through the chase. So relax and enjoy yourself. Smile a little bit. Know that you are a wanted person just because you made it through the door. We'll be happy to take some questions If you have any, I will try to look at the chat. I'm trying to look. I have approximately a minute and 42 seconds left.
We have a break after this, so
awesome.
we can go into the break if people have questions. We have time. So feel free to offer questions for Dr. Price.
Quick question, Dr. Price. How
Yeah.
would you answer the question, what is your biggest weakness?
Figure out, say, maybe my biggest weakness is that I tend to get overcommitted. And so as I work through my last year of med school, I'm figuring out what things are really important to me and what things I can jettison, because that's something I'm going to be working on, the focus of my career trajectory for the next 5 years as I go through training, right? So I just took something that said, yeah, I'm a little bit of a scatterbrain, but I made it into something that will sound decent during an interview. So it's about doing the okie doke a little bit, but those are one of those things I want you to think about before. If it's going to be test taking, then you sure as heck better follow up with, I'm not a great test taker, but some things I've discovered during 4th year is that if I do this and I do this and I make myself do this, then I can overcome the challenge that is put in front of me. Whatever you lay out there as a negative, you sure as heck better follow it up with the top part of that sandwich that says, this is my bad, but this is my good, and I've covered it up now.
Great, thank you.
Thank you.
Go
ahead.
I was just going to say, there's a really good question in the chat, and I anguish over this with my students with, you know, the questions that you're not supposed to be asked. I.e., do you plan on getting pregnant during residency? Do you plan on having a family? What are your thoughts on how to respond to those?
So again, it's why we think about it now. So what are your plans for family? You know, I love the opportunity to come here and think, in all honesty, in terms of my 5-year plan, I've been focused on my academics, and my personal life at this point is personal, but I am still very much excited about coming here and interviewing today to see how those things will meld together in the future. Right, so I was a little bit of pushback, like they know they stepped on a little bit of a bomb, but I didn't come off as a complete jerk or a complete, oh my God, that was an illegal question. It was just like, I've been focusing on this and not on this. I will tell you, they will come together at the end, but you also did not answer their question. Get pretty creative, but that's the kind of flavor you want to leave.
Yeah,
background screens, I'm asking, please think about this. Don't put, we didn't rank somebody who had a bunch of beer cans in the back of them as they were going through their interviews. It should be neat, it should be clean, get you a plant, a couple of books, don't have a lot of clutter around. We want to focus on you and not the stuff that's in the background. So resident socials in the time of virtual interviews. My program, we throw 6 residents in there. We fed them before they get on the screen, and they actually break themselves up into groups of 2, and then each have 2 applicants with them to answer questions and to talk at whim about the best things that they like. So I think that's pretty much what everybody is doing. Some people will have themed nights like Hawaii night or Western night, and they'll say, hey, they'll all be dressed up with a cowboy hat or something silly. We're trying to put our best playful foot forward, and we hopefully will see that reciprocated. That's awesome. If you guys scroll up the chat and you've been there all the time, you will find my email. I'm actually typing it once more, hhchealth.org. It is in there. If you guys want help, you have not great advising, you want a second look at your personal statement, you guys win because you're already here trying to accumulate extra information. So by all means, take my email if I can help you in any way. Prepare for this important but fun time in your life. Don't hesitate to reach out. I thank you guys for listening today.
That was great. Thank you so much. And thank you for being available to the students. I agree. I think the ones that attend today are going to be kind of ahead of the game. And looking at the schedule, it looks like we have a break scheduled until 10 after, wherever time zone you're in. So Gannon, are you good with us taking that break and then getting back with how to find a mentor at 2:10 Central?
Yeah, let's take about 5 or 6 minutes and we'll get.
There's Dan. All right, so it looks like it's 10 after. If you guys are all ready, we have a great session, another great session coming up today with Dan Egan. The session is how to find a mentor. And we'll let you go ahead and get started, Dan.
Awesome. So thanks so much for having me. I was inspired after Dr. Price's presentation. So, and I was like, wow, she is really good at answering those hard questions. So really, it seems like a great person to learn from. So we're gonna switch topics a little bit now and have a conversation about how to find a mentor, and kind of have taken it a little bit of a step further, and then also not only about how to find a mentor, but also I think a little bit about kind of how to be a good mentee in that relationship. And so I'm Dan Egan, as you just heard. I'm the program director at the Harvard affiliated program at Mass General in Brigham here in Boston. There's my Twitter, another, you'll hear that as an example of ways to find mentorship. And I'm here today, one, because I was asked, but two, I was asked by a person who I consider to be a mentor, who has a leadership role in SAEM, and I think was involved in planning this a couple of years ago. And so this is an example of why finding good mentors is really important. It has really, I think, I attribute most of what I have gotten in my academic career to people who've really guided me along the way and been really good mentors to me and have presented me with a lot of opportunities. And so, and remember sitting in your shoes as a, I think a second year or third year med student and going to the SAEM meeting, to the Medical Student Symposium, and kind of just being in awe of all these people and kind of just desperately wanting to be part of that world. So kudos to all of you that are already here and doing this and really taking kind of the reins of your career development. You're already ahead of the game, I think, like Dr. Price was just kind of saying. So I think the very first thing about, thinking about mentorship is really to take some time to ask yourself what you're looking for. So as we'll talk about, there are many different types of mentorship relationships, but that's a really important piece to be aware of for yourself when you're making that kind of leap as to try and just decide on who you're going to approach to be a mentor. So are you looking for someone who's going to function more in kind of an advisory capacity? Are you looking for somebody who's going to help you decide where to do your sub-I rotation, or where to go on your interviews, or how to finalize your rank list? Or are you looking for somebody who's going to help you decide if an area of interest, maybe now as a student or potentially later as a resident, is aligned with what your career goals are, or even interesting to you? Or are you looking for someone who's going to mentor you and help you develop an area with scholarship or research or presenting an abstract? Or are you looking for someone who's going to be a mentor in how to deliver a good talk or how to make slides? So there's all different types of mentors out there, and really reflecting internally before you kind of take that next step as to what exactly is what you're trying to gain from this new experience is going to be really helpful to having a successful experience when you actually do have that mentorship relationship. And when I was practicing this talk, which as a mentoring tip, always practice your lectures before you give them. So I always give them to my empty living room. My poor dog heard this talk several times in the last couple of days. And every time I said mentorship relationship, I thought I had said the wrong word because it sounds really weird next to each other. So I just did that now, actually, internally when I just said that out loud. So I think a really key piece to thinking about mentorship is the idea that you will not have one mentor. You will have many, many mentors over the course of your academic career or your professional career if you decide not to ultimately go into academics. And one of my colleagues, Dr. Adara Landry, who's at Brigham and Women's, has done a lot of work in the mentorship space, particularly in Twitter, as I'll mention in a little while. But one of the things that she talks about is this idea of having your own personal board of directors. And I love that analogy when thinking about mentorship. I think that if you think about how organizations kind of design, or nonprofits or whomever design their leadership structure, they've got a board of directors, and each of those board of directors has a little bit of a different area of interest or area of expertise, and they bring something different to the table. Your career and your development kind of requires multiple different areas of expertise, right? You need someone who's going to help guide maybe your clinical development. You might need someone who's going to help divide, what you're going to do as an academician or a scholar. And then potentially somebody who's going to help you decide on where to go to residency or how to make those decisions or getting a job. So there's all different needs along the way. And so thinking that you're going to have one mentor is probably not a great way to enter into this conversation, but thinking that you're going to find people in different areas who can provide different needs for you depending on the kind of stage of your career and your development. And so I think an important concept to remember that you will, at the end of your medical school career, you can probably reflect and think about different mentors you had, and the same will happen in residency, and the same will happen in your early academic career or your later academic career. So I think one of the earliest and easiest places to meet mentors is through kind of natural introductions that you have with people. This doesn't take a whole lot of effort on your part other than potentially attending events that may already be established. So if you're at a medical school that is fortunate enough to have an EMIG group, EMIG groups are a fantastic way to get to know emergency medicine faculty members. This is actually a picture from one of the EMIG events at Harvard where one of my colleagues is just really, you can see just by the tone of this meeting, sitting around while people are eating lunch, talking about cases and just having a really casual conversation. What does that do? That immediately breaks down the barriers of that person being a faculty member. It makes that person seem very approachable. And it really just allows people to have a conversation with someone who is there to really provide them with some clinical knowledge. But what that also does is give you the chance after a meeting to say, hey, can we have a conversation afterwards? And I think that's really, really helpful and just a natural way to meet someone. The other thing is that I think just like you have a board of directors for mentors, you also need to have different types of mentors. And so for those that don't necessarily have a lot of opportunities close to home, EMRA has this great kind of near peer experience where you have the opportunity to form a relationship with a resident who's kind of closer to the process than the faculty members, and will provide you with a whole different type of insight into what you might want to be doing. And then for those that might identify as part of a group that is underrepresented, ACEP has a new activity, and I've done this as a mentor for diversity and inclusion, and have had several mentees in the last year that just reached out to me through this program, and we now have a mentorship relationship. And so this is another great opportunity for those that don't have resources at home to find a mentor. Twitter has become a way to identify people. I think this is an awesome way to actually just passively receive information and to kind of get tips in the application process from many of the different people that are posting on Twitter, but also does break down a little bit again of that barrier and allow for some direct messaging with potential faculty members. And then lastly, you're already doing this one, you're here, right? And so you may have attended the speed mentoring event, opportunities again, to just have networks, to have interactions, to have conversations with people that may be the foundation and start of a new relationship. So I think if you're gonna now take this step and kind of take the leap of faith and actually ask someone, you're gonna have to make a decision about as to who you're going to ask. And so which door are you going to go through? And so, I think the sort of obvious answers here are that it should be someone that you admire based on things that you've seen about them, somebody who's successful in the career and the space that you want to work in, somebody who seems like they're approachable. And then I think also somebody who's going to push you. I think part of this experience is that you're going to have someone who's going to tell you, you know what, you've got to do better, or you've got to work harder, or this is what you're doing is amazing, but they're not afraid to be honest and not afraid to give you kind of that meaningful advice, while simultaneously, I think, being a role model. I think the best case scenario is somebody who you really see and respect in what they do every day, so that you can emulate and sort of learn from what they have done in their own career that will help to guide you on the development of your career pathway. And use your resources, use your friends, use the students in the classes ahead of you, talk to them about who are the approachable faculty members, who are the ones that actually will make time for you, who will take you out to coffee, who will do those things, and get the resource the same way that you do with questions about programs and interviews and things like that. And then in this process, I think a real good rule of thumb is to be assertive, but not aggressive and not too pushy, and recognize that faculty members have limited bandwidth in terms of time. And they're all really excited to try and find space and opportunity to talk to medical students, but also we don't want to make it overwhelming for them and hear too much from you in that time. And so an email introduction is a really easy way to start. And basically, hi, this is what I'm here for. This is what I'm interested in hearing from you. I'm looking for a mentor, and also give them an out. I recognize that you're really busy. If you don't have the opportunity or don't have the time to do this, could you recommend someone that might be able to meet with me? And then once you've done that, you've succeeded in establishing that relationship. The next thing is to make sure that you follow through. So you want to make sure that you respect their time. You make sure you follow through on your commitment of time. Be flexible in scheduling such that the faculty member can sort of navigate their busy schedules. And then show up with a plan, show up with an agenda. Really have a task list in your mind of what you want to achieve at the end of that meeting so that you've left and they've left with kind of the ideas and the goals that you've set forward as to what you want to get out of that meeting. And I think the important thing is for you to come in with questions, but also to come in with expectations and to share those expectations with each other so that both of you are on the same page and you leave there achieving the same goals. And then the last and most important thing, I think if you want this person to be an advocate for you in the long run, do not fall into the trap of ghosting. So ghosting is part of our culture in many different ways of not responding to a text or an email. This is not the situation to be the ghost and to sort of just kind of disappear and never be heard from again. So that was a really quick overview on topics that sometimes get hours at conferences on kind of how to build these relationships. But I would just re-emphasize things you've heard before, that people want to do this, people want to help you. It may not happen immediately on your first attempt, but you will ultimately find someone. You'll probably find multiple people to help you guide you along the way. And you've already succeeded in starting the first process by just being here at this conference. So congrats and thanks for listening.
That was great. Thank you so much. We have, a little bit of time before the next talk. Any questions about mentorship and, how to kind of get this relationship started as a medical student?
I have one, if I may ask. Thank you, Dr. Egan. That was brilliant. And mentorship is so important. It's great to have this forum to kind of start that process. I wanted to ask you about kind of ways that we as med students, either as we're developing relationships or if we have some, what's the best way to kind of organically maintain it? You don't want to kind of pop in when you need something, and that can sometimes feel like how a mentorship connection can go. So like, how do you make it a little bit more persistent and longitudinal?
Awesome. So thanks. And I'm glad you guys have questions, because I intentionally built this talk because I thought real life examples and questions would be helpful. So I think that's a really important piece here. And I think that sort of gets back to this idea of someone that you feel like is approachable, but not only approachable, I think we all sort of align with people that have shared interests, right? And so it may be a shared interest over a clinical topic, but it may be a shared experience. And shared experiences, I think, lead to very organic relationships. And so, for me, when I was a medical student, I aligned with one of the faculty members in my department who identified as a gay man, and we had that shared background. And so I immediately it felt like a very organic relationship and meaningful relationship with him, not just about the area of interest that we shared in terms of a research thing, but in terms of being able to have a shared life experience and being able to kind of connect on a personal level outside of sort of what it was to be a student in medical school. And you automatically have that shared experience of being in med school and kind of going through the process. But you also will potentially have shared life experiences. And I think that's why a lot of these efforts that have taken place to really promote mentorship and pipelines and experiences that do align people with their shared experiences really do allow for kind of, I think, just that natural organic experience like you're describing. And then I think, outside of that personal thing, because that's not always going to be the case, I think really just seeing someone who's doing things that you see yourself doing, because you're going to be interested in hearing about their work and probably be motivated to get involved in that. And all faculty members respond really well to people who are not only just interested in what they want to do and want to talk about what they do, but also if you want to help with things that they do, that's also just going to be a win-win situation for everybody involved.
Great, thank you.
Yeah, question is that fine line of how to be assertive without being pushy. And so I guess I'll give you an example. So I had an experience in the last couple of years, and I'll be vague about the timeline, of a person who had reached out to me, and it was somewhat of a cold call email to ask for mentorship. And I try my best to, just because I feel like I have really benefited from mentorship experiences over the course of my career, I really try my best to say yes when I get those requests. But that being said, I also, that sort of the sand time thing that I'm totally blanking on the name of the hourglass. I'm like, what is that called right now? You know, that's a very real thing. We're all really busy. And, you know, this person had, you know, I'd set up, I said, you know, let's set up a Zoom. And the first meeting request came in through for an hour, which is a long chunk of time out of like kind of a quote unquote 8-hour workday. And I was like, hey, can we just try to make it a half hour? I'm kind of busy this week, you know. And then that was one piece of advice. And then a week later, you know, she reached out and said, I have some more questions. Can we set up another time, and sent a Zoom request? And again, it was for an hour. And I said, hey, just kind of like last time, I'd like to try and limit these to 30 minutes. And that actually happened like 3 or 4 more times. And that to me was assertive and pushy rather than, I'm sorry, like aggressive and pushy rather than just kind of being assertive and trying to get some time on my calendar. You know, I think a meeting every month, every other month or something like that. And I think the tone and email tone is really hard. I think we live in a culture of texting and writing rather than a lot of phone calls and communications these days. But an accusatory tone of an email of not responding to their last email is also, it's never the right way to start off a conversation. So, you know, I emailed you last week and I haven't heard back from you. That tone that's how I read it, whether was the intended tone or not, and based in kind of what was said, that's what I heard when I read it to myself in my head. And so I think just being professional, being respectful, you know, say, hey, I sent this, I know you're really busy, I just want to follow up. So, you know, to just get it to the top of your inbox, no rush, just want to, you know, make sure that we have the chance to connect within the next several weeks or a month or something like that. That would be a much easier email for me to swallow. And then I would actually feel bad because then I had forgotten to write back, as opposed to the other tone that I read where I felt kind of like frustrated and not super inclined to want to have another conversation, if that makes sense.
I think that's a great explanation. I would just add, and, you know, we don't want to discourage you from seeking advising and mentorship. That's absolutely not the goal, but there is a question on the SLO about amount of oversight an applicant would need. And, you know, I think we've all had that applicant that's, you know, kind of up in the EM offices more than the faculty. And, you know, that can be a little bit of a, you know, I don't want to say a red flag, but, you know, we want to give you advice and then let you guys go out and act on it. And so I've had similar experiences, Dan, that resonated with me. But, you know, again, not to discourage you, it's about how you do it, you know.
Yeah, I would say that one of the best talks I ever heard on mentorship was kind of, and if you Google these things, you'll see it, and you'll see it not just in medicine, but in the business world, on this concept of like mentoring up and really having a really active role as the mentee, which is a really easy relationship for the mentor to have. And that just is, again, it's kind of accountability, it's responsibility, it's maturity, all the things that we're all craving in residence. And if you're sort of already demonstrating those characteristics as a student, that person's going to be really excited to work with you. And also, I think at the end of the day, be a strong advocate for you in your application process.
Other questions?
I have a quick question.
Go ahead. Sorry.
Go ahead, Nicole.
Thank you. It's a question on sort of the different types of mentors that you can have. I think you kind of touched on this a little bit, but I think it's important to have mentors that align with a lot of your interests, but also that may not have those and can help you explore. Sorry for the background noise. But I was just wondering if you could talk a little bit more about how to build a relationship with a mentor who may not have like specific interests, like, you know, social emergency medicine, or maybe interested in ultrasound and you have different interests, but can still develop a relationship with them as well.
So I think that probably gets back to that very first sort of point that I made, which is that kind of self-reflection of the question that you are looking for in that relationship. So what are you trying to achieve by that relationship, right? So if you meet with someone and you're not at all kind of sharing in their interests or their goals or anything, they're going to kind of be questioning about like, what was the purpose of this meeting? So really reflecting internally on like, what am I looking for out of this relationship before I get to the stage of actually meeting with them, so that when you get there, it's very clear, like, oh, you know what, I don't think that I want to do ultrasound, but I'm really interested in learning more about it so that I can be a better student or a better clinician when I get to residency. And so that's really why I'm here, because I just want to have a little bit more knowledge and have you expose me to a little bit more in the thing that you're expert in, which is not my long-term career goal, but I see the benefit of a relationship with you. And so that's what I'm trying to achieve today. And that just sets the tone. And then the expectations are shared, which I think if you start from a level playing field of shared expectations, the chance of success in that relationship is much higher.
Thank you.
Brock, did you have a question?
Yeah. Yeah, if you don't mind. So I was just wondering if you could speak about kind of mentorship versus coaching. So I was in a different session last night, and they were kind of talking about those differences, and I've kind of thought about them interchangeably in the past. So I was just wondering your opinions.
Yeah, I think to me, I think of them as, I think mentorship as sort of this long-term career developer or, you know, kind of a longer pathway. I think of coaching more as sort of more specific and more behavior-based and or more specifically task-oriented. So I'm going to coach a resident next week and meet with them to help them on their verbal presentation skills that they're struggling with in the department. Or I'm going to coach a student on like, you know, interviewing and thinking about how to succeed at your interview. But my mentors are people that I'm putting down on my CV, my mentees, that I've had this long relationship with over a course of years and help them to grow and to achieve something in terms of their career, kind of in the bigger picture. And so to me, it's more of a longer relationship. You did have coaches in kind of the traditional sense of athletics and sports and things like that, but they were all sort of geared a little bit more towards like a skill set or a behavior or something like that. And I think that the mentorship relationship is a little bit more longitudinal, sort of higher level than actually like a coaching on a day-to-day kind of basis.
Great, thank you.
Great. Well, thank you again for that great talk, and for your email address is in the chat. So if people have questions, it sounds like they can get a hold of you. You know, just a quick plug that there are mentorship programs that exist within EMRA, RAMS. There's one at this meeting, and actually one of the students that I met with last night was in the talk. And so if you're at a shop that doesn't have a residency program, or you know, perhaps you just haven't found a mentor at your place, I would just put in a plug for, you know, those programs as well. Great. All right, so the next thing that we have on board is the career options panel, and that's something that I'm gonna help moderate here. So let me put my, are you guys seeing my slides, or are you seeing the presenter mode? Okay, good. So this is the career options panel, and really I kind of see this as an extension to what Dr. Hiller kind of gave us today. So she talked about different practice options in residency. This kind of takes the career in emergency medicine from residency to, you know, fellowship and beyond. So we have a great panel, and I'm going to just talk a little bit about fellowship first, and then I'll introduce our panelists. And really, this is going to be a discussion with those panelists. I think 2 of the 3 have done fellowship, and you know, myself and the other panelists, and really most people in academics have typically a career niche. The list of fellowship training opportunities in emergency medicine seems to get longer every year. So the ones that I put in bold are the ones that tend to have a board affiliation where you can sit for a boards or become board certified. The other opportunities tend to be fellowships that you can do, but you wouldn't necessarily get a board certification. And one of the things that I'll just say about fellowship is they're all very different. So I know this morning Dr. Jazandi mentioned that the fellowships that they have at Stanford are all 2 years and come with an advanced degree. Some of these come with advanced degrees, some of them come with board certification, and some of them don't. So they all need to be really investigated in different ways. And these are some of the other fellowships that I saw. I went to the SAEM fellowship directory and really just looked through the directory, and I found things here that frankly I didn't even know that there was a fellowship that you could do in some of these things. So it's just great to see, you know, what we have available to us in terms of different job opportunities. So, you know, I talked to, you know, some people about why would you pursue a fellowship. So, you know, I'll talk about my career experience here in a second, but I didn't do a fellowship, and we were talking about it at lunch. You know, when I was a resident at Wake Forest, and when I was there, I really enjoyed the 3 years that I spent there, but I would have loved to stay on for a fellowship, but they only had sports medicine and pediatric emergency medicine at the time. I think if they would have had medical education, EMS, disaster medicine, or maybe even wilderness, I probably would have done a fellowship. So if you think that you're maybe going to have the motivation to do a fellowship, I would consider that when you are starting to look at residency training programs. But also it's important to know that this has to be a part of your long-term goal. So at Ohio State, we have several fellowships, and more than half of our residents have chosen, our graduating residents that are current third years are choosing to do fellowship. And, you know, when I talk to them about, you know, why are you doing health policy? Why are you doing wilderness medicine? Why are you doing EMS? You know, it's important that they've thought through, well, it's not just because the job market in Columbus isn't that great and I want to hang out here for another year. I mean, I think you have to have good motivation for that and good long-term goals. And then also consider what the subspecialty is and what's the cost. So, you know, Dr. Hiller mentioned in her talk that doing a 4-year residency training program in emergency medicine over a 3-year program should be done for the right reasons. And I think she talked about that. And a fellowship is really no different. So my career niche is medical education. And more recently, I've been doing a lot of disaster medicine. So when I was a resident at Wake Forest, this was during Hurricanes Katrina and Rita, and we took care of a lot of the displaced patients. And I really enjoyed, you know, thinking about natural disaster response. So I joined Ohio's FEMA Urban Search and Rescue Team, and have deployed now to 3 hurricanes in the last 4 years, Hurricane Harvey, Dorian, and Laura. And it's really been a great piece of my academic career. And so I think that there's a way that you can get extended training for what you want to do, but not necessarily do a fellowship. So I hope our panelists will be able to reflect on those things. So I'm going to introduce them right now. The first person I'm going to introduce is Nicole Dubash. She is a fellowship trained educator at Harvard Medical School. She's their director of undergraduate medical education and the director of their fellowship, which I think is the same one that she probably did. I'm biased with this panelist though, because Nicole was a student at Ohio State and participated in our boot camp course. So I'm embarrassing you publicly by showing a picture of us when we were younger. So, you know, it's great to have her on the panel. The next panelist is Doan Boatwright. He is an assistant professor of emergency medicine at Yale and did the Robert Wood Johnson Fellowship. And he was actually a classmate of Gannon's in residency. And then our final panelist is Sanjay Gupta, who is the chairperson of emergency medicine at South Shore University Hospital and is an associate professor of emergency medicine. And he's going to talk to us about his career niche in administration. So I'm actually gonna stop the slideshow, and I think I'll kick it to Nicole to start. And you know, the first thing I would like each panelist to do is just reflect on what your career niche is and why you chose to pursue that career niche in emergency medicine.
Great. Thanks, Nick, for having me be on the panel. I have never seen that picture, so I actually just screenshotted it and I'm sending it to some of my classmates from OSU who went into EM. They'll appreciate it. So why did I choose, you know, first a fellowship in medical education? I think, first of all, and you guys are all, you know, ahead of the boat, like you're thinking about residency already. I actually didn't even know what I wanted to do in terms of academics or community when I was in your position. But basically, as I went through residency, a couple of my mentors at my institution were involved in medical education, and I developed an interest both in teaching and the research component. Now, I had never really had any formal research training prior to residency, but I had discovered that I actually really liked it. And I was thinking about doing a career that encompassed both teaching and research. And I realized, hey, I actually like research in medical education, for better or for worse, given some of its challenges. So I decided that that's what I wanted to do. And in order to get to that academic education leadership job that was going to involve teaching, some administration, and research, I thought the best path for me would be to do a fellowship. Now, 20 years ago or so, you could get most jobs as a clerkship director or program director, you know, even vice chair of education without having done a medical education fellowship. The landscape is definitely changing, and I think this is true for most niches within academic emergency medicine. So given that, you know, as you look, you know, I see on the cord listserv and SAEM, the job postings, a lot of these positions at academic institutions do request that you have a fellowship in medical education. So that's one of the reasons why I decided to pursue it. I did the medical education fellowship at Beth Israel Deaconess Medical Center, where I now work and direct. And it was actually in the first year of its fellowship. So this was not an ACGME fellowship like some of the other niches within EM have. And there actually aren't any ACGME to the fullest fellowships in medical education. My fellowship was SAEM accredited, meaning, or SAEM certification, meaning there was some rigor in that you got research experience, you had to submit an IRB, you had to do a study, and you had to have some didactics. So that's kind of one of the, and there are many of these fellowships now if you look at the SAEM website. So I was already in Boston. This was a new fellowship. So there was a little bit of, you know, this is going to be kind of a learning year, like trial. I'm going to be the guinea pig with it, but I liked my institution. I wanted to stay where I was. I had personal reasons to be in Boston. So I did that fellowship. Now mine was a year long. We actually do, my current med ed fellow is doing a 2-year option because he's also pursuing an MPH during that time. So it's really kind of, you know, and there's a lot of variation in fellowships, but a lot of them let you kind of tailor to your own interests. So that's how I ended up doing a fellowship. And now I, you know, stayed on. The person who had my role previously had left. So I had been at my institution and got offered my current position.
Great. And I also want to say congratulations. So Nicole is the incoming president of Clerkship Directors in Emergency Medicine. So clearly, you know, capitalizing on that fellowship. So congrats to you for that. So Doan, do you mind reflecting on your path, why you chose, you know, advanced training and kind of where you are right now?
Sure. So, you know, when I was a resident, initially, I always had an interest in doing research, but I initially was interested very much in trauma research, especially pediatric trauma. But as I progressed from my intern year to my second year in residency, I really became interested in workforce diversity and trying to figure out ways to increase diversity in emergency medicine and academic medicine in general. And at the advice of my chair at the time, I actually began doing some research in that and I actually just loved it. And actually completely transitioned my focus away from trauma onto workforce diversity and also studying elements of bias and discrimination in medicine. So I was doing that throughout residency, and near the end of my third year, I just happened to come across kind of an advertisement for the Robert Wood Johnson Foundation Clinical Scholars Program. And it was a health policy 2-year research fellowship that also in many situations had a focus on healthcare disparities, which I thought would go well with my current research interests. So I decided to do that fellowship. But to some degree, I was still a little bit torn as to whether or not I should do it, and I actually met with one of my advisors who also was a researcher but did not do a fellowship. And one of the pieces of advice she told me was, she was like, I would only do the fellowship if you thought it was a once in a lifetime opportunity. She told me, she didn't do a fellowship. She's been successful in terms of publications, acquiring grant funding. And she was like, you can make this work just by transitioning to a faculty position as well. So I kind of took that advice to heart. And when I interviewed for the various fellowships, I really thought that I would only do the fellowship, again, just kind of like she advised, if it was a once in a lifetime opportunity. And actually thought this fellowship would give me a lot of skills in addition to protected time to actually focus on my research interests that I wouldn't necessarily have otherwise had I just gone into a faculty position. So that was pretty much my decision making.
Great. And finally, Dr. Gupta, would you like to reflect on your career niche and administration and kind of how you got to where you're at?
Sure, yeah. Thank you for the invite. I'm going to reflect on the fact that I'm from a certain vintage where we didn't have a whole lot of fellowships in emergency medicine. So, I think, a lot of pathways are kind of forged with opportunities that come up. So my first attending job was actually at a brand new residency program in New York City. So it was a really interesting opportunity to basically do every single job that a residency program had to offer, being, one of the first, board eligible people. I was at any one point the SIMS director and the medical student director and the residency research director and the assistant residency director, over the course of 9 years, and core faculty. And then, kind of with those different opportunities to navigate and, contact and making connections, not only within our specialty, but through the hospital, you realize that, our skill set in emergency medicine can translate to really kind of enacting change and thinking about global processes. You think about how we can get things done. You think about, for you students, you'll come to realize that once you're residents in emergency medicine and when you're off service, sometimes you'll find that attendings just kind of gravitate toward you to get things done, because it's kind of a reputation that we have. We have the ability to kind of navigate tough situations, think in kind of big algorithmic ways, and kind of complete a task. So actually that is what parlayed me into administration. I think I've always been fortunate to not ever having given up, EM practice, or even what is my kind of academic niche, which is actually wilderness medicine. Again, when I graduated residency, there were no fellowships. I kind of forged one, over the years through the Wilderness Medical Society, while still being administrative. Now with that, I've been a department chair or an executive vice chair for the past 7 years plus at this point at community sites, but mainly at academic sites, including where I am now, where I had to not only be a change agent for an 80,000 visit department, but actually start a new residency training program. So it's been, kind of a wonderful path to maintain academic skills in EM, but yet, forge away at a level in administration where my impact is very different. Rather than direct patient impact, I impact how our department is seen, how our department functions within not only the greater hospital, but also within, a huge health network. And I think that is where the benefit of administration comes in. So I think a lot of people gravitate toward admin when they feel like, I hate being glib and going, I want to help more, I want to help more, but it's where you can see where your time and effort goes into more of a trickle down area. So you do lose things, things to consider is you do lose that direct patient connection in a lot of respects. I'm still active, but only 20%. But the impact on your department and kind of the functioning of your department for the greater good of your community, of your hospital, your health system is bigger. What I will say, in taking that path, I did finally focus and stop jumping around. I really did have to focus on specific education. So not doing a fellowship, but I was part of an administrative high potentials program within my health system, which is the largest health system in New York State. I actually went and got an MBA in the past 7 years to kind of assist in, the business aspects, in managing P&Ls and other such things, and making a concerted effort to be, kind of more educated in those pathways. I'm getting my Six Sigma Black Belt currently, so it's you have to consider, no matter what fellowship you do and what path you take, you're always going to have to be a lifelong learner in that as well. So that's it. Sorry, I don't know if that was terribly focused, but
no, that was great. I will just say a few things, and then I'll throw out another question, and then maybe we can open it up to the audience. I will put in a plug for academics. So like Dr. Gupta, I didn't do a fellowship, but when you work in academics, he mentioned 20%. Typically, you can buy down your time, and you might work less clinically than other emergency physicians. So, if you work in the community, you might work, between 15 and 19 shifts, let's say, a month. But in academics, we tend to work less time, and you can protect more time. And in that time that you can protect, you can often pursue an advanced degree, or you can pursue advanced training. So in my case, I did med ed training and disaster training through FEMA. So that's a way that you can do that. Now, the next question that I was gonna ask our panel was, what are some of the things that you wish you knew prior to starting? And for me, it's something that resonated when Dr. Gupta mentioned this, and has become more apparent during the pandemic. I really wish that I would have gotten an advanced degree. I feel like if I had to do it over again, I'd do either a med ed fellowship with a master's in med ed, or a disaster medicine fellowship with a master's in public health. I felt like during the pandemic, having a master's in public health would have helped, with some of the work that I was doing with COVID-19. So let me throw it out to the panelists. Are there something you wish you would have known prior to starting that you could, enlighten our participants with? Nicole, if you want to go first.
Yeah, so that's a good question. I think so. I'm going to answer it in two ways. One is for me, and then one is for some other people I've seen who kind of wish they knew stuff before. So for me personally, I was pretty set on what I wanted my career path to be: medical education, the full, academic gamut with admin and teaching and research. And I think what I didn't I kind of underestimated at first was the power of mentorship and finding mentors even beyond your own institution. It wasn't until a couple of years ago that I actually kind of started reaching out and really making an effort at making those connections, like what Dr. Egan was talking about earlier. And it really expanded my network career-wise. Like, I went from really thinking like, oh my gosh, how do I even get a talk at a conference? How do I even find people to collaborate with on a manuscript, to just like too many opportunities at this point. And I'm kind of a more timid person initially. So it did take a lot to actually, make those connections, or you're introduced to somebody at a conference or whatnot through email, but to actually do that extra step and follow up, because if you don't, you really don't have anything to gain from it. So I think for me personally, that's what I would recommend for you if you're going into academics or not, or going into community medicine. Just really keeping an open mind about your mentorship and reaching beyond your institution. The second thing I'll say, just from some of my colleagues who have done fellowships, is think about why you're actually doing it. Typically, this is to get an academic job, and that entails publishing. If you're working at an institution, they're going to expect that you're going to get promoted. They're going to expect you to do research or scholarship and actually produce something. I have some friends who went into medical education because they said, I like teaching. And they realized the admin is their worst nightmare and the research is their worst nightmare. And they really just want to teach at the bedside. So specifically for medical education, for those of you thinking that and thinking like many students do and many residents do, teaching is fine. Like it's satisfying, I want to teach. Think about where you want your overall career to go. There are more jobs involving teaching that do not require a fellowship than that actually do require a fellowship in medical education. So there's a whole spectrum of kind of where you could work. You can work at a community hospital that's affiliated with a residency where you get residents rotating through in emergency medicine or other specialties, but you're still a community doc and you get to have that teaching experience on a shift. But at the end of the day, you don't have to go home and think about your next research study or your administration and getting your milestones in if you're a program director, or sitting on, meetings in the dean's office or whatnot, versus the full kind of academic job. So that's one thing I've kind of seen other people do, where you can, if you like medical education because you like to teach, you can find that without having to do a fellowship and without having those other affiliated roles.
Great. Dr. Boatwright, some things you wish you knew prior to starting?
And prior to starting fellowship in particular?
Yeah.
I think one of the things I didn't realize was just how quick fellowship was going to pass. And again, I even did a 2-year fellowship. And I remember when I was starting, people used to talk about the second year, you'd have a ton of time to really work on your research projects and so forth. And what I found was first year was a lot of classes. And then second year, I spent pretty much the whole time just finding a job. So I think looking back, I would have been a little bit more aggressive about just taking more advantage of all those opportunities I had during those 2 years and just recognizing that it was going to pass so quickly.
Great, thanks. And Dr. Gupta?
Yeah, I think one thing that I wish I had known before embarking on this, it's been a great career in academics and residency training and administration, is I think a topic that's become very important in the past few years is the topic of wellness and balance. And just understand, as we talk about, protected time and this, anytime that you have released, you're going to be spending scales of that time doing work that is not clinical time. So, it gets to a point where you have to consider, you may not consider that now, but down the road, if you end up having a family, if you have other interests, that, sometimes the time that you've given up by not working as much clinical, you have, kind of passed on. So I'll give you an example. My phone has been on continuously for the past 7.5 years. So I'm never off duty. I missed my niece's sweet 16 because I had docs who called out sick and I couldn't get covered, so I had to cover. I missed going on vacations with my family because the Department of Health and Office of Mental Hygiene for New York City came to my department for 9 days, so I had to cancel a vacation. So those are things that you have to consider as you start embarking on jobs with kind of different and mixed responsibilities outside of straight clinical responsibilities, that you are giving up something. It's not bad. I've loved it. I've had a very understanding wife who certainly encourages me. My kid gets it. She's on 3 lacrosse teams, so she certainly understands. I certainly understand what she's doing, so she understands what I'm doing. But it's something to keep in mind that when you start thinking about fellowships and academic jobs or teaching jobs or jobs that give you release time, it's not an hour for hour replacement. So don't think that by 4 hours protected to teach, that's all you're going to have to put in that week. If that's what you're released for clinical time. So I wish I'd known that a little bit more in order to develop the balance. And, I think that's something that I find that a lot of junior faculty members struggle with at first. where they're kind of on all the time. And some of them I've seen many of them, especially with young families, give up that pathway because they feel like they can't handle it and they go back to clinical, which there's nothing wrong with that, but I feel like they almost felt, left a career that was unrequited.
Thank you. Well, I have a couple other things that I might, run by the panelists, but I also want to give us time for you guys to ask questions. And we have, at this point, 11 minutes left. So does anyone in our audience have questions for our panelists on, a research fellowship, a medical education fellowship, a career in disaster medicine or administration? I see Sarah turned her camera on. Do you have a question? No? Okay, just.
I do have a question.
Please.
Thanks a lot from all the panelists. So right now for me, it seems like I have a lot of different interests within the field of emergency medicine. I like health policy, medical education, disaster medicine, sex and gender. And I'm not sure that if I should find some place to bring all those interests together, or I should just choose one.
I guess I'll tackle that first. I think emergency medicine tends to draw people in that like a lot of everything, right? So as medical educators, we've all met with a student that said, I really loved everything in medical school, and they try emergency medicine and they love that too because of the variety. But in the same way that you have to differentiate at some point, it's best that you differentiate. I guess my advice would be to look for a residency training program that allows you opportunity to do that. And to be honest with you, a 3-year program like I did, at Wake Forest or even our program at Ohio State does not offer a lot of elective time. So that's something that you should really consider, I think, when you apply. But let me throw it out to our panelists to see if they have anything to add.
Yeah, I would say that's normal to have lots of different interests. And I think as you go through residency, you'll probably get involved. Most residents require some sort of project, whether it's QA, whether it's research or whatnot. See what you gravitate towards too. At the end of the day, when you're going to bed and thinking about your day, what's going to make you most excited? If someone's like, you need to do a project tomorrow, which one of those areas are you going to be most passionate about? Because one of the things that, I see a lot of people, myself including, doing is getting involved in stuff and going down a path that someone else suggests for you and tells you what to do. And if you're not really bought into that subject area or their topic, and you're not passionate about it, it is going to make it 100 times more painful to do as opposed to being something enjoyable. So I think just keep an open mind, and as you're kind of, when you go through your social media and there's your Twitter and your med ed stuff and see, what's the latest articles, what do you gravitate towards the most? What do you find the most interesting? And just kind of keep a track of that and you'll figure it out.
Thank you very much.
Any other questions for our panelists? Well, go ahead, Ryan, and go ahead.
So when do you think is a good time to start thinking about fellowship and kind of making decisions on that while you're in residency? I guess timeline wise.
Panelists, what was your experience, Nicole?
Yeah, so I think, definitely start thinking about it in your second year and probably have an idea if you're going to apply to fellowships by the end of your second year. My fellowship, we put out an announcement typically beginning of July, and then we start interviewing people in the fall, like September through October. So I would say kind of around that time. And you also, like applying to residency, you want to have time to get your letters of recommendation, put together your CV and a cover letter. It's not as extensive as ARAS if you're not doing an ACGME fellowship, but you still want to kind of have your story of why this is the area I want to pursue. So I would say end of second year, you should know.
Thank you.
And that's assuming you're at a 3-year program. If you're at a 4-year program, end of your 3rd year.
I wanted to ask, Dr. Gupta talked about wellness, and I had a question for you guys. How do these roles impact your wellness and work-life balance? And, I think we heard from Dr. Gupta, but I wonder if the other panelists would reflect on that. Doan, do you want to start, on how your fellowship, if it's impacted your work-life balance or your wellness?
Sure. And I guess during fellowship, I was actually fortunate enough to have probably 80% of my time protected. I mean, it was really designed to develop a research niche. So in that sense, it was great. I actually had substantially more time to do research or just to myself than when I was a resident. But then after fellowship, things changed dramatically. And, when you're on faculty, not only do you have more ships again, but then just like Nicole and Sanjay were saying, you now have additional administrative responsibilities. So I think there's, especially probably with any additional responsibility beyond the clinical workload, there's the potential for it to become all encompassing. And, a day that someone else might have off to just spend with family, you're going to feel pressure to maybe get a paper done, or as Sanjay was saying, you might, have pressure to miss a holiday that you schedule. So, I think it can be very impactful and encroach on a lot of your, what otherwise would be time for wellness. So I think you have to be very aggressive about, if you have the ability to, in terms of partitioning time that you spend for yourself, time that you spend for family versus time that you spend for work, and really limiting, if you can, the amount that you will spend on the work, but still be able to be productive. I think if you're not aggressive about it, I think it'll be very easy to lose any type of work-life balance.
Nicole, anything to add?
Yeah, and I'll echo what Sanjay had said earlier. Like just because you work, like I work 10 clinical shifts, which is actually a little bit high for academics in my group, which seems like I have all these days off, but they quickly fill with meetings and emails, and you're always on. So it's not necessarily actually more time off. A lot of people, including myself, will underestimate those research and those admin roles as well. So just know what you're getting into and be prepared for that.
Great. And I think, I'll end this on a positive note. If you find the thing that gives you enjoyment, like the panelists have said, the thing that you enjoy spending your time on, it can certainly improve your work-life balance from the standpoint of when you're at work, you're really enjoying what you're doing. So for me, that's been, finding the things that really give me enjoyment and not doing the things that potentially don't, has been a really good way to kind of develop those career niches. But any other, we have, looks like only about 2 minutes left. So if there's no other questions, we can certainly have our panelists maybe enter their email addresses in the chat, and we'll move on to our last session before we wrap up. And then we'll have, optional breakouts, like we said, for military applicants, international medical graduates, and osteopathic applicants. So thanks to our panelists for coming on and sharing your life experience and your career experience. And I'll go ahead and introduce our next presenter. So Dr. Joe House is the clerkship director at the University of Michigan, and is active member of CDEM, and he'll be talking to us about zooming your way through the virtual interview. Joe?
Yeah, and I'm going to I completed a pediatric emergency medicine fellowship, so I want to echo a little bit what Nick had said. I actually did fellowship.
Yeah, please.
I actually did fellowship for work-life balance. What I mean by that is I found I actually enjoyed working with kids more than adults in some ways. So I do both adult and peds, and I tell people if I did all adults, I'd be annoyed. If I did all peds, I'd be bored. So for me, that mixture is important. So again, that's why I did it for fellowship, and then obviously got into clerkship director and other educational stuff from that. So going on zooming your way through virtual interview. Now, a lot of what I am going to talk about actually has been talked about in the multiple different sessions. So some of this is going to be repeat. We'll probably have a little bit of time at the end too, if people have any other questions about interviews, or again, I can talk about PZM fellowship if people have those questions too. So no conflict of interest. I will say that one thing you need to do is recognize your own biases. So some of the things I'll talk about on here is some of my own biases when it comes to the virtual interview. So I do try to point that out. So we're going to talk a little bit about kind of the 8 tips to acing your next virtual interview. And I'd say probably the biggest thing that I can say, and one thing, looking at some of the material online, I can't say what it looked like in 2020, but I can say since then, there are lots of different resources available online about Zoom interviews and, what's the right way to do it, talk about backgrounds and the right view and everything like that. So again, I try to pull some of the resources that I found. So one of the things to say is practice. And again, someone had brought this up earlier. I think Dr. Price talked about practicing your answers to questions. I tell our students when it comes to kind of those quote unquote illegal questions, how do you answer a question by not answering that question? So for those that, again, I'm getting old, I'm sure Nick knows who this is and a couple other people, but so Allen Iverson, very competitive. They had just lost the game, and someone asked him about, well, you missed practice. And he says, what are you talking about practice? I just missed the game. Or we just lost the game. But I think, again, for this, it's practice. And it's practicing at a time of when you're potentially going to be interviewing. So again, things to think about is, think about your connection. I mean, I'm sure people have just on these or during this session, people losing internet connection, people dropping connection, people freezing, there being echoes. And think about it, like I said, when you're actually at that time likely to interview. Most of the time when we're, not at work, it's in the evening, maybe less people on, or, at night. But think about, okay, so I'm likely going to be interviewing from, 8 to 5. What is your connection at that time? Are you freezing? Are you dropping? Maybe you need to find another location to do it at. So, going to, your med school, if it's open, for us, our library was closed. So students couldn't even go into the library to do any interviewing for a while. So again, what does your connection look like, at that time? Check your angle. And I'll show you what I mean by this. And again, 6 tips for learning your best camera angle. Now this one, again, is a little different than what we'll be talking about. But again, think about just the positioning. I think someone mentioned earlier about actually buying a extra camera, or maybe was using their cell phone because they had a better pixel quality. But think about the angle you're at. So again, obviously, I'm sure we've all seen, again, even in this session, when you're seeing someone's forehead, so again, what angle are they at? You're getting that lower shot when people have, 6 chins. Or the person who just looks like they're never actually looking at the screen. They've got 2 screens that they're looking at, and they kind of are going back and forth. So think about putting something as simple as putting a book under your computer. Or I have a little computer stand, but still, when you look at it, even if you have it straight ahead, it's not at the right angle. So again, propping that up a little bit. Thinking where are people looking at? What is that angle going to look like? Then again, like I said, lots of different tips on there. So they talk about, making sure that you fill the frame. So are you sitting way back so it looks like you're 10 miles away? Are you too close where, again, people are just able to see the pores on your nose, that sort of thing. So again, what does the camera look like? Is the camera at eye level? Or again, they even say if you can get it slightly above, because that's generally a little more flattering appearance. Again, front lighting. I'm sure we've, again, been on those Zooms where people just look like a shadow. So you're not really sure, again, are you able to really kind of convey? Because again, I think Dr. Price talked about making sure that you're showing that you are interested and you're excited, but again, if all you're seeing is that black silhouette of that person, like, are you actually able to show that you are interested? That you're able, or that you're excited about that interview? Again, background. Again, this is one of those areas where I may be a little biased to some of the virtual backgrounds. Sometimes it might be a conversation starter, But again, are you that guy on the left there? Is that the conversation that you want started? Is that where you want to go? So really kind of looking around on what's around you, what you may look like. In all honesty, sometimes I think about when I see the virtual backgrounds is what are they hiding? What does it look like behind them? Do they have, a bunch of dishes piled up because they, are in their kitchen? Usually for lighting, they talk about trying to get that natural lighting. So maybe, being in front of your window. Well, if I was in front of my window, then you'd see my messy desk behind me. So again, think about background. And like I said, again, know your biases. My biases, I don't love virtual backgrounds. Someone was actually talking earlier on a different meeting that they were talking to someone who actually had like green eyes. So and behind them was like a stained glass window, virtual background. They said every once in a while they'd position their head and it looked like they had like red eyes or laser beams coming out of their eyes, just because again, the way they kind of blend into that background. Again, in that same meeting, we were talking about people's hair and what looks better with the virtual background. And someone said, if you've got really curly hair, it shows up wrong, weird because you're shadowing, or if you're someone who talks with their hands, again, you're gonna get the white halo sometimes around it. So again, sometimes it can just be distracting. Again, just thinking about, is that what you want, someone to kind of focus on, is like, what's behind them, wow, that looks weird, that sort of thing. Because again, you want that focus to be on, like I said, that your talking points on you on that interview. So again, professional background. Again, I think Dr. Price had talked about, just again, clean behind you. I saw plenty of students who, when I was doing interviews that just had like a bookshelf behind them. And again, you can have those conversation pieces, just with some simple items like this. So I was actually talking to someone earlier, and you could see like their Harry Potter books back there. And hey, if that's something that you're interested in, that could be a conversation discussion. Or again, someone had talked about, I think it was in one of the questions from a student, was I just am plain, I just want like a white background. And again, I think that's perfectly fine, because again, the focus is really, like I said, on you, on your discussions, on your questions, or on your answers to the questions, versus again, what's behind them. I know I was doing a mock interview with the student, and they just had something stuck on the wall, and I kept thinking to myself every time they kind of moved a little, I'm like, what is that back there? It was a command hook. But still, it's like, those are some of the things that, especially with me, I'm a little ADHD, I'm sure, and I kind of start wondering if it's not a great discussion. And again, it can be distracting, or maybe it's just a curtain, kind of like me, I've got the windows behind, but again, you just have to be careful that you're not getting that backlighting, so that you're not getting a great view of people. So again, a lot of people, when I was doing the interviews, actual interviews and doing mock interviews, again, just kind of sitting by a window, getting that light from the front, and nice clean background, so that again, things aren't distracting. And the other thing I'd say is practice kind of, when you're doing it and where you're doing it. Someone actually brought up that they were by a hospital and all they kept hearing every once in a while was sirens going by. Again, I was in a talk earlier, and someone had people clean the windows. So again, all of a sudden there's this noise in the background. So again, think about where you are, what you're doing. Are you being at that time? Do you need to get, like someone had talked about getting like a lapel mic so you can hear them a little bit better? Do you need headphones? So again, you aren't picking up a lot of background noise. Kids coming and running around. Kids just got home from school. They're yelling at each other. I had to figure out who was killing who. So again, how do you kind of block out some of that background noise? So things, again, I talk about this, practice when you're going to do it. So again, are there any things that you may not anticipate? Practice where you're going to do it. So again, you can kind of take a look at that background, record yourself. So again, then you can kind of look at yourself, are there mannerisms that you have that again could be distracting? Do you have tics that you may not know that you have? So again, I used to do this in person with a lot of my students, and it was easier to pick up some of those things. But now that we're doing things virtually, you may not have that opportunity to do that. So again, can you look at it? And again, have someone else take a look at it. Have someone who you think can be honest with you, someone that you trust, so they can kind of say, what, you look kind of weird, or you make this thing with your face that I don't know what you're trying to say, or I don't know what you're doing. So someone who can be honest with you. So things that we did with our students this year, like I said, we used to meet with all of them individually so we could do the mock interview. With the virtual interviews, we still did that. We had some students who were visiting their family, and some in Michigan, we're visiting their family in Denver and doing it electronically. Because again, that's what we're actually going to be doing. I had people that they couldn't make it during the normal time when I had my office hours, so they recorded it to me. They sent it to me later, and I was able to provide them some feedback that way. So again, you just have someone else take a look at that and provide you that feedback. And then again, this was brought up earlier. This is a formal interview. And again, not that I saw any of this. I did have someone I work with had talked to a chair, not our chair, but a chair, who it was a job interview, and the person who was interviewing for the job was in kind of normal clothes, which again, I think since we're all in our houses or somewhere else, I think we kind of picture it as, again, dress for success. Dress as though this is an interview and you're walking into someone's office. And again, as someone pointed out earlier, wear pants. Who knows? Someone may say, "Oh, what's that back there?" And you may turn around or stand up and look over and "Oh, what's interesting? What you got into there?" But again, I think if you practice and act as though it's an actual interview, you will be you'll be a little more formal and not necessarily take it more seriously. But it'll just come out that more professional way. So again, now I have another attending or someone I work with who always says, there's technology conspiracies everywhere. So have a backup. And again, this was brought up earlier. I did one interview where I could hear the person, but the screen was completely black, and we just kind of rolled with it. We actually, on our very first interview day, it was great. It was a Monday, and the entire hospital system network went down. So we had no internet throughout the hospital, throughout the system. So again, how are you going to roll with it? We had phone numbers, so we were doing, just phone calls. We were doing, FaceTime interviews. You just got to be able to roll with it, and you actually do get, in some ways, kind of some bonus points showing that you can adapt. And we actually had some data where we were looking at just a single site for ourselves. We looked at when you were on an interview, were there AV disruptions, and really looked like for those they were able to adapt and to roll with it. It actually did not hurt your assessment. And if anything else, it added a little more humor in there. I actually had one where I think the other person was a little more comfortable after we had to call her on the phone because things went down. So again, just roll with it. Like I said, if you're someone who just again, internet goes down, what are you going to do? If you crash, if you freeze up, if you don't know what to do, what's going to happen when the department's burning down? Believe me, the computer system goes down all the time. Our hospital system loves to do their updates on Saturday night between 2 a.m. and 4 a.m. because the hospital's never busy then. They do it that way so that way on Monday morning when the clinics open up, they can get things fixed. They don't, so again, how are you going to roll with that when your system goes down? When you're writing on the whiteboard which patient has what complaint, that sort of thing. So like I said, kind of roll with it, go along with it. Just figure out the way to make it. Because again, you may actually get some bonus points just for making do with kind of what there is. So again, I kind of started out with some the 8 tips. So again, practice, and I'd say practice when and where. Look and listen. Look around you, what's going on. Listen to any sort of distracting noises there might be. You could kind of say, be cautious from the virtual backgrounds. You may end up with, like I said, light beams looking out, coming through your eyes, or half your head disappearing. Remember, this is an interview. Again, look at yourself. So again, do that recording. And when I say, do the recording, again, get dressed up, shirt and tie, coat if you're going to wear a coat, dress if you're going to wear a dress. Again, how does things look? Again, I think Dr. Price brought up, kind of cleavage, that sort of thing. So again, where's your camera angle at? If this is a dress that you're going to wear, for your actual interview, what might it look like on a computer screen? Because again, it may look differently than it would when you're in person. Have alternatives. So again, what is your backup plan? Is your backup, you've got your phone, it's charged, it works, you have good connection there. I've got great internet connection and terrible phone connection. Again, maybe you should go somewhere else so you've got that backup plan that works. And like I said, just roll with it. So here are some other things that are out there. So I have my email, so again, feel free to email me if you guys have any questions. Again, I think Nick had brought this up and a couple other people have brought this up. If you are at a program that maybe doesn't have great advising, feel free to email me your video. I have no problems giving people honest opinion. I've had some students who I've given that to and have never met with me again until it's soap day. And other ones, again, who are very appreciative, and I try to help them out. Again, there's tips from Emra. There's some tips on how to do the interview. There's tips on how to the video, so again, some best practices. Academic Life in Emergency Medicine has some podcasts for student videos. AAMC also has some, and then AEM, resident student general interview advice. So again, there's lots of resources out there. And like I said, I think for this interview season compared to last year, there's almost too much information out there. But like I said, I would practice it's a real interview and look for someone who can kind of help and provide you that feedback. So any questions from anybody? Like I said, I know a lot of this has already been covered in bits and pieces in previous talks.
I had a question. So if the interviews are virtual, one of the things that's different about doing on the computer is you can have other screens open, like a page of notes or maybe even your CV to kind of give you ideas or maybe write what the question was. I don't know if you would do that, but I don't know if you have any experience with people doing that and it being distracting or hearing about people doing that and it being helpful.
So I've been involved in like some interviews actually for chair positions, and we actually had someone who he did write down the question, and we actually gave that individual kudos for doing that because he actually answered the question. Because sometimes you'll have people who you ask a question to and they're like, that's not really, they gave a great answer, but it may not be the question that you gave. So I think, again, as long as it's not distracting, if you're sitting, this way the entire time and not making that connection, because again, obviously you're trying to make that connection with the person over the computer. So if your face is always this way, since you can't even see my hands which way they're going, then I think it actually takes away from things. Versus being able to, again, I can look up and down like you normally would when you talk. I mean, you're not always kind of staring at the screen because that's weird too. But if you're, look down, take a couple of notes, then look back up, again, you're trying to connect with someone who, again, you're not sitting in the same room with. So I think as long as it's not distracting, I think it's fine, because I will definitely say I've been in meetings or interviews where I'm taking notes myself. I've done it with students too, where I'm writing things down because we have our own form that we're supposed to be filling out, that something really interesting that they brought up or something else.
I think the only thing I would caution with that is sometimes depending on your keyboard, like you can hear the actual tap, 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 which I think similar to what you said, Joe, with the kind of sirens and stuff can be kind of distracting. And I think just because you're on a computer doesn't mean you have to be using your computer to take notes. And we're certainly all used to interviewing or talking to people who have a binder or a notepad. And so I think it's easy to look down and write some notes by hand. And you can use your computer, but be careful about the kind of distracting noise that at a certain point you feel like you're on trial and someone's writing down everything you're saying. So I would just worry about that. I also think depending on where you're looking on your screen, that can be sometimes awkward. Oftentimes we look at ourselves or the person we're interviewing with, and so in Zoom you can position that person's video box to be right next to your camera. But if you're typing and you're looking in some corner of your screen, it can also be somewhat distracting.
So that's what I'd say, if you're someone who wants to take notes, record yourself and what it looks like when you're taking those notes. Because definitely that system we used last year, the picture of the interviewer, so yourself, was at bottom left-hand corner. I definitely caught people looking down at that bottom left-hand corner, where again, if you can position it where you've got top, bottom, or what I found with that system, which I warned some of our students when we were doing the mock interviews, you actually can take your own picture off on some of these systems. So is that the way to do it, is actually just remove your picture altogether so you're not trying to look at yourself?
That's really good advice. I do that quite a bit. I'll look in that far corner where my picture is. It's just, I don't know if it's habit or what it is, but any other questions for Dr. House? All right, well, it looks like we're right at 3:30. Our agenda says wrap up, and then we have breakout sessions. And so I think in terms of wrap up, Gannon, do you have anything in particular that you wanted to hit? I think you're muted.
Sorry. No, I think it was a great session. I know these are long days on Zoom. And so I appreciate everyone's attention and kind of sticking with us and staying engaged. I think we had an excellent group of presenters. And I think, like multiple people said today, the fact that you all were here for this, I think really puts you ahead of a lot of your colleagues, because I think there was an incredible amount of really valuable information that was presented today. The last session we had was just kind of this optional kind of special advising session. And this is really born out of the fact that when we typically do this in person, the day kind of ends and there's an opportunity to kind of group in the lecture hall and have specific questions answered. And given the fact that that's much harder to replicate in the virtual realm, we wanted to create an opportunity to have people go into breakout rooms that were kind of specific. So we had, based on past years, we kind of were going to plan to have a breakout room for international medical students, and then osteopathic students, students interested in military careers or the military match, and then allopathic students who have additional questions. And so feel free to stick around to participate in that if you have additional questions or if you fall into one of those groups. If not, feel free to hop off. We would really ask that you fill out an evaluation for this session. Those evaluations are through Juno, but it really is hugely valuable for us, kind of making sure that we're giving the content that you all need, and we can make improvements for next year. So those would be the things. We'll give a couple minutes for people who are not interested in sticking around to hop off. If you are interested in sticking around, we'll create a couple rooms here shortly and give you the opportunity to hop in. Nick, did you have anything else you wanted to add before we sign off?
No, I think, I don't know if we're able to get a roster of our attendees, but I think we could maybe try to send out a summary of who the speakers were and what their email addresses are. If you want to get a hold of our speakers, you could also, just email us and we could find those people for you. So, if one of the speakers particularly, resonated with you, I think most of these folks are, advisors at heart and, would be happy to talk to you on a Zoom. And, so I'll volunteer their services for an email, and you could just let them know that you enjoyed their talk and you'd like to talk to them a little bit more. As far as the breakout sessions, I want to thank, the faculty that have agreed to come on. Dr. Amy Cutright does a lot of advising of osteopathic students at her institution. And we have Air Force Colonel John Whiteman, Navy Captain Sherry Rudzinski, Air Force Lieutenant Colonel Leslie Vota, and Army Major Laura Tilley. And I don't know if we have, in years past, we have had military applicants. I don't know if there's any on the call, but I just want to publicly thank you, first of all, for your service. And second of all, agreeing to be, participate on this session. And if we don't have a student, students that you can advise, when we're in person next year in New Orleans, I think it's probably pretty likely that we will, and I'll just offer personally, every year at Ohio State, we have, 4 or 5 students that are doing the military match. And I always found those to be kind of the hardest students to advise. And really the system that we've worked out at Ohio State is the 4th year student kind of advises the students in the year below them. And that's been a system that can be fraught with challenges, but has probably worked pretty well. So thanks to you guys for joining us, even if we may not have students for you to talk to today. At least, we'll run point, and if we encounter students who need advising, we'll send them your way.
Yeah, Nick, just to throw in, we're available by email, and anybody can get to anybody through me, so you can always send out my email address. But also in November, we typically have what we call specialty night. It was done virtually this year, where all the program directors are on. It's sponsored by AOA, but it was done virtually for the first time and worked out fabulously. So people who are interested in participating in that, you can always point it to, to us, and we can get on the date and time if it's virtually. Otherwise, it's held on campus at the Uniformed Services University, and people travel from all over, sometimes Connecticut, sometimes, Missouri to get to Bethesda just for this one night. So it's another option too. Over.
Great, thank you. Yeah, I would love for you to send that along, and we could make sure that we get the word out on that. All right, Gannon, are you gathering information if people want to jump in, or you want them to just put it in the chat?
I'm trying to set it up so that people can assign themselves. Give me 1 second.
Okay. If you weren't so Zoom savvy, this would not have been
Oh,
as
I'm
functional.
not. This might be the challenge that breaks me. So that should get you to the point. If you go down to the breakout rooms, there should be an opportunity for you to choose a room. And it looks like we just have the 3 rooms. So we'll have military, DO, and then allopathic students. I'm happy to assign folks if that's helpful. If you are a student who's interested in being in a specific room, go ahead and just drop it in the chat and I'll get you there as quickly as I can.
And Mike Smith just texted me. He's was going to be our representative that would advise international medical grads. He's walking to his car and he's going to try to log on as soon as he can. So I know we have a couple of international medical graduates. Maybe you could put me in with them, and when Mike joins, you could add him to our room if that's possible.
Absolutely.
Awesome. Great. So I just texted him. Is everyone in this group an international medical student graduate, or participating in international medical education?
Yes.
Yes.
Yeah.
So yeah. So this is always been a little bit unique for us, and I think the first thing that I would say is you're putting yourself a step ahead by participating in advising sessions and trying to find advising. I think that's great that you're able to do that. Dr. Michael Smith is going to join us. He's at Ochsner, which is in Louisiana, and he does a lot of advising for international medical graduates. He's just kind of making his way over to his car and going to try to join us. But maybe in the meantime, could I answer any questions about the content that you got today? Was there anything that you felt like needed reinforced or was confusing? The one thing that I mentioned, and I don't know if I mentioned this during the lunch, so I may not have told all of you, but Dr. Gisandi started the session by saying emergency medicine's, not as competitive and maybe more on the peer with peds and IM. I think it remains competitive for certain populations. And I would say that you guys are in that group. And so, you know, I don't tell you that to try to stress you or give you anxiety or anything like that. But I think for his students at Stanford, it's probably not as competitive. But I think for certain students, you know, I'm being transparent, that it can be competitive. And at Ohio State, we actually had 3 students this year not match in EM. And one didn't have a spot after the SOAP, which almost never happens to us. So my personal bias is that I thought it was a competitive year this past year. So, you know, what you have to do as you progress is you have to make yourself as marketable as possible. So, you know, how do you do that? You do that with experience, with teaching, with research, if you can, with service. So those would be things that, you know, I'd offer first off. The things that remain true for you are that the EM clerkship and the letters that come out of it are still going to be very important. You know, I think the thing that's hard is getting that clerkship experience. So, you know, I can tell you at Ohio State, we have a mandatory clerkship for 200 plus students. And so we don't typically have room for a lot of visiting students. We only have, there was a year where we had less than 5. This year, I think we're shooting more towards 15. But our residency program kind of oversees who those visitors are. And they want to pick people that are viable candidates for a residency. And typically, we've not had international medical graduates rotate with us. And, you know, I tell you that in full transparency. So, you know, you are going to need to start looking for a place where you could do your visiting rotations. You know, that's a welcoming place for international medical graduates. And there are a lot of those places out there. I think, you know, like I said, we haven't traditionally been, you know, able to do that because of our numbers, but that would be my first piece of advice. So what has been your experience with, and Amy, this group of folks are predominantly international medical grads. So, you know, feel free to kind of reflect and, you know, on your experience as well. So have you all, you know, been looking for a rotation to do, or are you at that point in your, you know, medical school career?
Yeah, actually, I can jump off that if no one minds. Yeah, so I think at least I can speak for Catherine, Tim, and I are all at the same spot. We're all MS3 is about to be MS4 is looking for summer electives. And that's actually probably been one of the biggest. I mean, in normal years, it's hard enough to find clerkships, find electives. And this year, actually, I know one thing was reaching out to programs early. I think I started probably, you know, February, March, trying not to run into reaching out during the match. But yeah, it was a lot of places looking at VSAS opening the 15th, and then it did, but almost all those rotations weren't open for, and currently aren't open for, international graduates. So I think there were 3 programs that were open for international graduates or 5 total. 2 of them weren't actually open for US IMGs. They're only, I think it was, one program is only open for foreign medical graduates. So yeah, it's kind of, the big question now is navigating that. And like you said, it's finding those clerkships, finding those programs, reaching out to community programs, and just kind of, you know, anywhere that has external applications. I feel like a lot of us are firing out those apps.
How about the others? Have you, so Tim and Chris, and who was the other person that's at your institution?
Catherine right here.
And Catherine. So have any of you found a rotation yet, or you're still kind of looking?
So I was lucky enough to get a rotation at the new Kaiser EM program in Modesto, California. I had emailed them before they were on VSAS, and I'm not sure if they had planned on actually opening up applications to international students, but because they were new and I emailed really early, they did. So I'm really fortunate to have gotten a place with them. But yeah, everywhere else, same as Chris, kind of figuring out how to navigate that that issue really.
And Mike Smith has joined us. I don't know, Mike, if you're available. So again, he's at Ochsner in Louisiana and helps with IMG advising. And then, you know, Amy, feel free to chime in. I know you and I had a conversation about you advise students from a lot of different institutions because of your geographic location. Mm-hmm. There's not a lot of you know, other options in the area. So what are your thoughts about finding a rotation as a IMG candidate?
I don't know that I have a huge amount of like insightful things to tell you guys. Unfortunately, my own institution won't even consider IMG applications they just set up VSAS to not take IMG. So unfortunately, it's not even a conversation I get to have with anybody because it was made above my head. We've had some IMGs in our program before. We never had any issues with that. So we certainly welcome residency applications, but as far as clerkship spots go, it gets very tough. Ultimately, outside of what you guys are doing, which is, you know, reaching out early and asking for spots, you know, that's kind of the best that you can do, unfortunately. I wish it was a little bit more straightforward as to what the options are, but it's not. And unfortunately with COVID, that's gotten even narrower, and it was already a narrow field to begin with. If you can't swing any EM rotation, then I would recommend you do rotations that get you as close to the emergency department as possible, and ask them to comment on that, or rotations that might have an elective in the emergency department, if that's a possibility, is where I would kind of suggest that you do those things, especially if they give you time in the emergency department. That would be my next step if you can't get the clerkship itself set up. I recognize that's very, very limited set of options for you guys.
I think that's great advice. The more I reflect on it, I think the one thing that may have changed in your favor is the new guidance that students only do one away rotation. I've seen some banter on the listserv about away rotation applications actually being down because, you know, instead of students doing 3, they're only doing 1, and so there's more for other people. And then the other thing I've seen happen is because you can only do 1 away rotation, people are offering subspecialty rotations, at least in my opinion, more subspecialty rotations than they used to in the past. For example, this is the first year we're offering our ultrasound rotation to visiting students. And we also have an EM-IM program that has a visiting student option. So I guess I would tack on to what Amy said with, you know, make sure you're looking at the subspecialties. So not just looking for EM. I mean, that would be the best case scenario, is to do an emergency medicine visiting, you know, audition rotation where you're going to get a slow and the whole bit. But you know, if you could go somewhere and do ultrasound or EMS and you get emergency medicine exposure and a subspecialty slow, I think that would be probably a nice, you know, second place to that.
So our students at Ochsner are all U.S. citizens, and they do their first 2 years in Australia and then come to the U.S. and do their clinical years in New Orleans, but their degree is conferred from Australia, so they're by definition IMGs, and they still have a road to go with getting into a lot of places. So you have 2 separate issues. You have to get past the biases of the emergency departments, if they have them, and also the registrars of the medical schools. And the registrars tend to reject IMGs more often for rotations than the emergency department. So in theory, if you're rejected at a place for a rotation, that doesn't mean 100% that you couldn't match at that place. But that's the difficulty in getting the rotations. So you may have a emergency physician that welcomes you, but the medical school won't let them rotate at that institution.
Can I ask a question? So I am currently doing a fellowship in sex and gender and emergency medicine at Brown. And so fortunately, I have this opportunity to do shifts with different attendings at PEDS emergency, ultrasound attendings, and others. But I'm really concerned about the application process because I see that a lot of programs are talking about diversity, that they want to increase diversity in their programs, but still they're not really even considering applications from IMGs. So I am thinking, is there any way to just like convince them to look at the application, not to just automatically filter them out?
It's a really great question. I mean, I think when we talk about increasing diversity, you know, residency training programs often look at candidates that are underrepresented in medicine, not have decreased access to our residency training program. And so your point is very valid. I mean, there has to be, you know, work done, and Dr. Smith mentioned bias, and clearly there is that. It's probably gotten better with the combination of allopathic programs and osteopathic programs. I think I've seen the boundaries being blurred more so, but still, you know, our students will routinely look at a program and they won't see any DOs next to any of the resident applicants, you know, and you know what that program is really targeting. Whereas, you know, if you pull up the residents of a certain program and they're half MD, half DO, you know that they, you know, are going to look more favorable on osteopathic candidates. So your point is certainly well taken. I don't know what your thoughts are, Amy and Mike, about that.
I think it's easier for me as a clerkship director to sort of advocate and harass the departments of emergency medicine to get them to look at a residency application because I can make a connection with people that I know. If it's the registrar sort of blocking it for away rotations, that's much more difficult. Now, the thing that you've got probably this year too is that the IMGs sort of had an advantage with the away rotations being shut down during the pandemic. And I think if I understand correctly, they can't, students can't sign up for anything before August. Is that correct, Nick?
Well, the applications are supposed to open May 15th, but from what I'm hearing, and they're not supposed to rotate until July, I think was the revised guidance. It was initially August, and then the coalition released some advised guidance that they could rotate in July. But from what a lot of my students have secured aways already. So, you know, just like all things emergency medicine, we're going to release all the interview dates at the same time, and some of the programs do it and some of them don't. So, you know, that's a challenge. But one thing I heard from you, Mike, that I think maybe bears a little bit more discussion is this idea that emergency departments and residency training programs might be willing to have the right international medical graduate come rotate with them, but that application never gets to their eyes because it's held up at the college registrar office. And I think what I'm hearing, you know, from you that could be advice for our students is maybe to reach out to the programs if you're, you know, able to find out, you know. So we talked about there's a lot of scholarships for students who are underrepresented in medicine to do visiting rotations, and there's email addresses attached to those applications. We know there's a clerkship catalog. So in our specialty, and you did hear this, come through, we're a smaller specialty, and we talk to a lot of people, we know a lot of people. It might be worth reaching directly out, to the clerkship director and say, hey, I'm currently doing a fellowship, or I'm currently an international medical graduate, but I'm really interested in your program, and here's my CV, and this is what I have to offer, and this is why I'm interested. And that might be enough for a clerkship director to tell the registrar. In our case, it's, there's a coordinator who just manages the applications, right? And they filter them through to us. It might be, a chance to say to that person, hey, when you get this application, I want to see it. So I think that's probably pretty good advice.
Yeah. The ultimate reality is in the application process, it's highly variable from location to location, which gives you some advantages, because what doesn't work at one place will absolutely work at others. If you reached out to me, unfortunately, my side, it wouldn't make a difference, because our institution has decided they are not taking IMGs, period, end of story, not up for discussion. I was not involved in that decision. I didn't have any say in it whatsoever. I was just informed that this is now the change. And I was like, well, what if I don't agree with that? They're like, we don't care. I'm like, okay, so I guess we're not having a discussion about this. They're like, nope. I'm like, okay, well, that's awesome. It's my rotation. I feel like I should get to, offer spots how I want to, but that's not how they view it. The reality is some of that may be higher up discussions about insurance and other things that I might not be privy to. So I think you just have to kind of see what each rotation is looking for in applicants, what they historically have taken as far as applicants, and go with that. And see. Unfortunately, there's a little bit of legwork on your part, because there isn't a great list of all this information that's out there.
Yeah, I would second the last part of that, and just, emphasize that there's rotations available outside of VSAS or VSLO, and, doing some, internet detective work on Google to find some of those opportunities might be the way you secure that rotation. So, Catherine, you mentioned, finding a program, and I don't know if that was through VSAS, but there are programs that come online every year that aren't in the match, or they just got certification. And so finding one of those can find you a diamond in the rough that, might be a new rotation, but also you have the chance to kind of be one of the first people through.
Yeah. Well, and some of them won't use VSAS, particularly because they want absolute control over what happens with the rotation as well. And sometimes that, the old school paper process gets you that.
I don't know if this may have already been said, but I think Ryan Pedigo mentioned it earlier. I mean, looking at residency composites and seeing programs that have taken folks from your school, or even just any IMGs in the past, because I'm a DO, and that a somewhat similar path is trying to figure out what programs are going to consider DO applicants versus not consider DO applicants. And it's not like this is published. It's not like it's clear. Oftentimes it's cultural. And so, to waste your time banging on the door of a program that's never had an IMG resident is exactly that. It's a waste of your time. So really doing your work up front to say, hey, this is a high yield. There's a chance this will be successful.
I also have one more question about year of graduation. I'm graduated in 2019, and because of COVID, I was able to come to US 1 year later. So I'm not sure how important that is for applicants. I mean, I worked clinically after I was graduated, because we are licensed to do that. But the year of graduation itself, how important is that?
I think the big things are if you have any kind of gap, that you can explain that gap. During the gap, that there's been clinical activity, like you said. And as long as during that gap between graduation and that year's application, there hasn't been multiple applications. So you're not reapplying like, for the third or fourth time, because that's something programs use to filter people out.
Yeah, and I would just add, that's all great. I would add that US applicants, US seniors have the highest match rates. So, one of the things that we'll do is if somebody doesn't match, oftentimes we won't graduate them, and that way they'll remain a US senior. I don't know if that's true in the international world, that if you don't match, you remain a senior, or if you become a graduate, you're a graduate. But it's important to get the advising on what's the best move for you, because when it comes to residency application, it's very individualistic. So the advice that we give you might be different than somebody else. Other thoughts on that?
I'd be interested to hear Mike's perspective, but I think graduation year is not a deal breaker, but all those things he said, kind of accounting for the time, but also like recency matters. So if you can get a rotation this year and you perform well, then kind of all of those concerns about, well, it's been too long since she graduated, go away. And so I think, again, I'd be super interested to hear what Mike says, but I think that if you can show success as close as kind of approximately to your application, I think that will be of good value.
Yeah, for our students, we don't do anything like Nick was talking about, because our students are on the calendar year rather than the traditional academic year. So they graduate in November, so they don't match until the following March. So they're long graduated by the time match rolls around. But
I agree, though. I would just second, I mentioned that we had some students not match this year, and one of the students, because of COVID, didn't really have an opportunity to improve their application over the last year. There were no away rotations, everything's closed, and I think that was their reason for not matching, is there just wasn't anything new, and so I would just second the idea of making sure, if you're already graduated, that you get something new to add to your application over the next year, be it rotation, research, presentations, because that what have you done lately, I think is probably a little bit important.
Actually, sorry, next go.
Oh,
I
go ahead.
I haven't. So you.
So just out of curiosity, when it comes to the ERAS and the whole residency process, how much is too much advocacy for our behalf? Because we've been taught as IMGs to, knock on those doors, do the footwork. But what is too much in your eyes? Just wanted to hear your thoughts.
So I think it's hard to nail down what is too much. What I can comment on very passionately is the content of the reaching out. So I've been what is very clearly form emailed multiple times by people who are just spamming anyone they can find a email address for. While you do have to hit a certain volume of people, I would recommend you do the legwork up front to find out who's more likely or going to be able to respond to you, number one. And then also, if you're reaching out to me because you are interested in my program, my immediate question is why? Why are you interested in my program? What is it about my program that's interesting to you? Do you have a connection to my program? If you can give me one of those things, I am far more likely to engage with you than if I get a form email that says, I like emergency medicine. I hear you do that too. Can we chat? And the answer is, but I just got like 25 of those, like you're in the pile, but I'll get to you when I get to you, kind of a thing. So I recognize that's hard to hear as well when you're just trying to get enough people to talk to. but sharing information between yourselves, especially, you know, if you're all looking through these programs trying to figure out who takes IMGs, who's going to consider IMGs, is a good way to kind of start, learn, you know, take the information that other people have already done, work from that, and then make the communication as individualized as possible. That is far more likely to get your response than something that's very generic to just as many people as you can send it out to.
Thank you.
So I actually had two questions. The first one is kind of specific just to e-slows in that, so I think some of us have been lucky enough to secure rotations, but the rotations that are generally, it seems like, you know, more flexible, or where the registrars are allowing IMGs, are generally a lot of these newer programs. So like I was actually able to get a rotation with one of the hospitals in the Mercy system. However, you know, it's a brand new hospital and it's got a lower volume overall. Is there, you know, any weighting to differences in e-slows? I mean, in the idea that the e-slow is hopefully standardized and that, you know, being evaluated by one person in a separate place is equivalent to being evaluated elsewhere? Or is there, you know, some stratification to, you know, ideally getting a, you know, academic residency with a very high volume or something like that?
They are stratified by who's filling them out, in the sense that something that's coming from a residency is worth more than something that isn't coming from a residency. Mostly because, so the question we're trying to answer is, are you going to be a good EM resident, yes or no? And the person who's most capable of answering that question is someone who trains residents. So the closest you can get to someone who knows something about that, that's the person that you want to write the letter if there's a choice. Most places that do training on a regular basis are probably going to do some type of group letter. I know we do. I think most residency programs do. But if you don't have access to that, which is totally understandable, you should still get one. As long as it's got clinical experience, it's still valuable. But who you choose to fill it out should be the person who is the closest in some way, shape, or form to residency in some way, has maybe taught for a while, knows someone. Any of that sense is who I would go for, basically.
About the letters, are you interested to see any letter from like my medical school, or do you prefer all the letters to be from people who are in the US? I mean, like SLOs are definitely from people who are in the US, but other than that.
I think the same advice that was given during the session, like if you have a significant experience and someone who knows you well, who can write a letter, that's going to be your best letter, regardless of where those people are. I think from an IMG as a letter reader, I would want additional contextualization. So, you know, letters that say this person is great are of little value to me, right? Letters who say, I work with 200 students a year. I've been doing that for 10 years. And of the 2,000 students I've worked with, this student is in the top 7. Well, all of a sudden, I don't care if you're a pediatric oncologist, that now proves to me the context of this person's ability to evaluate you. So I think to the extent that you're able to coach your letter writers, it doesn't bother me at all the location of the letter writer if they are able to provide that context about how they know you, how they can compare you to anyone else. And if they can even say, I've had mentees who have succeeded in, you know, in residency programs in the United States, and this applicant meets all those criteria, and I have no doubts in their ability to do that, right? That gives me the things that I need to feel comfortable with you as an applicant.
When I used to read SLOs, I would look and see the questions I would ask. Do I know this person, the letter writer? Does this person have a title? Does this person have a national reputation? So if someone's, not that they would necessarily be program director, but 2 years out of residency, but if someone's getting a person to write a SLO, that's not far out of residency, even though they've had good shifts with them, that that's not as powerful letter, in my opinion, as if you're getting it from someone that meets the above. And there's criticisms about the SLO that go beyond that, or they're probably a rant for another day. But
Yeah. I do think it's useful if you're having them fill out just a standardized letter of recommendation, which is just all written, that you could give them a blank copy of a regular SLO, because especially the section with the radio buttons, like above peers, at the level of peers, below peers, like those sections, you know, ability to work with a team, you know, ability to differential, having them comment on some of the things that we care about is always very useful. Because sometimes if they're not from our specialty, they tend to stray into the weeds of what their specialty cares about. I'm like, well, that's great, but someone who spends 3 hours in the room with a patient, while it's great on internal medicine, that's not going to work for us, kind of a thing. So having them comment on what they know about those things may be useful as well.
I actually had one more question, and that's my last one. If you don't mind. Sorry, Tim. Last question I had was just from our point of view, when we all match this year into the programs of our choice and we're at the next level, how do we advocate as IMGs for the next generation? How do we get, what can we do as residents and further on in our careers to make sure that we're making the system as equitable as possible? Because it sounds like there's just roadblocks that come down from a high, which I think is every corporate or otherwise system that we have. What can we do moving forward?
Take an academic position after you finish residency and advocate for the students.
Yeah, and I would just say show up and kick butt. I mean, if you outshine your classmates or your co-residents from that year, I mean, I think that's what changes how we think about these things. For example, the last couple of osteopathic residents we've had at our institution have been phenomenal, and I think it changed how the program director thinks about the acceptance of anyone who's not an allopathic applicant. So I agree. I think those are some of the things you can do for sure.
Yeah, I think advocating at your department, program, school of medicine that you end up at is great. It's hard. As a DO, I'm at the University of Colorado. We have one of the most strict policies about osteopathic students rotating with us. I've had multiple meetings with multiple deans and met complete resistance. But I think you can go the other way too, right? Which is you are all sitting here wishing you had someone to show you the way. And so reach back out to your home medical schools and offer yourself as a mentor and an advisor to students who are trying to make these same transitions, because this is a competitive field, but you all have the additional layer of having to fight through all this nonsense. And if you can open some of those doors for the people who are behind you, that will be helpful.
Yeah. I mean, you guys are going to have to do a huge amount of legwork for the application process. Like, save that information, put it somewhere someone else can benefit from it, and update it instead of having to recreate it every year, and just pass that along. That's huge. I know, for example, so I advise students at University of Nebraska, but also Creighton Medical School, which is also in Omaha. And they do not have an EM advisor or an EM residency program at their medical school. So they have had this, like, it was originally paper and now it's online, like years worth of alumni network that they use every single year to get away rotations, places to stay, people to talk to. What is this, is this program good? Yes, no. And they just built that over time, and they just keep passing it on every year and adding more information to it. So if there isn't already something out there like that, then start there.
Perfect, thank you.
I want to ask about kind of some of the other aspects of our ERAS applications. Dr. Kamen kind of mentioned EM is still very competitive for the IMG student. Even though we're kind of told at the beginning of the session that it's like not really as competitive per some other specialties. So in the interest of making ourselves look as good as humanly possible, like we've already talked about the slow, which is kind of tied to, killing your away rotation if you get it. But what other things that are kind of in our control still can we kind of hammer out to kind of make sure that that kind of shines and puts us in a position to like look really competitive amongst our US counterparts?
I think there's a couple of things that you could throw in there. Diversity of experience are things that you can cite. Just within your control before the application process hits is getting involved in emergency medicine, whether it's through an interest group at your medical school, whether it's something at more regional or national level. Those are things you can add to your application. Anything you guys are already interested in doing, just figure out whatever that is that you love to do and then just one up it, whatever it is. Like for example, I have a lot of students here who like volunteering with a student run clinic. Like, great, get on the board of the clinic and make it better. Don't just show up and do shifts, kind of thing. So whatever you can do to one up yourself, do that. Because you don't have a huge amount of time. Like, you're not going to dive in and probably generate a giant research project the amount of time that you have running after applications, but you can get involved with things. You can, polish up your CV to make it look as good as possible. You can join EM organizations so you understand what's happening within our specialty. You can answer questions intelligently about what's going on, what we care about when interviews come around. That's what you can realistically fit into this time frame that's coming up. I don't know, Mike, if you have more suggestions.
So there's we mentioned, the biases of program directors and the residency committees, but really they're held accountable to their bosses. So they may have, if they've got a class of 6 or 8, they may have these biases, where they can only select so many IMGs, if at all, or so many DOs at all. It really depends. We'll get like 200 plus opinions on what they look for. The thing with board scores, so the step 1 scores can be predictive of whether or not you're going to first pass the ABEM exam. So yes, a program director, and we've all seen students that are, barely pass the board and end up being exceptional residents, but they've got to take that risk as a percentage of maybe 6 or 8 people. So if they take, the diamonds in the rough and, 3 of their 8 member class doesn't pass the ABEM exam when they graduate, that program director is going to be held accountable for that. So I mean, when I interviewed residents or residency applicants, the biggest thing I looked for was an integrity and reliability. So in my opinion, like if you have some academic difficulties, I can overcome those with you if you put in the work, but I can't train you to be honest and be reliable and show up for your shifts and stuff like that. If that stuff's in you, that you're sort of long gone. So those are the things that I look for. The things that I advocate for my students, 2 program directors, they move to a different continent and live there for 2 years and function. So when they get to your program, they're probably not going to be in your office crying or complaining that their schedules got changed. So they're pretty resilient and adaptable. So I think that's their strength.
We saw a movement last year, and I don't know how many residency programs picked this up. I know mine did, and I found it very helpful. With the sudden kind of advent of virtual interviews, a lot of residency programs were encouraged to kind of have a little more of a holistic approach to applications and develop kind of a rubric, so to speak, of scoring applicants based off of the application outside of the process that we've used before to try and kind of cover all the domains of everything. The AMC put out this big grid of kind of all these elements. And so I know a lot of places actually ended up developing something like that. Ours did, and it makes it very clear kind of what our residency is about. So if you see that kind of people listing like these are the things that we care about, that is always something to be useful to pay attention to, because certain programs are going to lend themselves to IMG applicants and certain programs probably will not. And using that to your advantage to figure out who to talk to is probably a smart idea. I think it's going to save you some time in the long run and help you pick out the programs that you're going to get the most out of from an educational perspective as well. So.
Well, it looks like kind of questions are wrapping up. Do you have another one that
Yes,
we can tackle? Yeah, I didn't hear any for a minute, but yeah, we're here to help.
So different speakers throughout this session said that when you're applying for programs in different locations, it's really important to show that you have a tie with that location, like family living there or like kind of support system. So for an IMG coming to US, that does not exist for most of the cases. How can you turn that weak point into an advantage actually? I mean, like Dr. Smith said, that it is really good to show that you're adaptable, you have moved to a new country, you're able to function and adapt to the new situation, but how can you emphasize on that?
Well, and I may have been the person that mentioned that. I think what I was trying to get at is a personal reason why you want to go to a program. And by personal, it doesn't have to be that you have family in that town or your fiance, got a job there or something like that. It might be a personal interest that you have in the program. So, sex and gender might be, an interest of theirs, or there may be a faculty member there who's doing research on sexual violence or, international health or global health, and they may serve a population that resonates with you. So, I think what I meant by that is find a place that is doing something or sparked an interest that you can convey to that program, not just, I'm interested in your program. Well, it's in Denver and it's in a great city and everybody wants to go to Denver. Why are you interested in, Gannon's program? I would try to find a place that has, something that resonates with you. I have a couple of, advisees that are, they're medical students at our school, but they were maybe Nigerian or from another Somalian, another background, and are interested in a global health fellowship. And so to find residency programs that have people there that are working in that space, those are the people that are gonna want to meet with and mentor those folks. So that's maybe more, I think, what I was getting at. It doesn't always have to be just, my parents are in Cleveland, so I want to do residency there. It might be, I want to go to this place because there's somebody doing this international medicine that I find compelling.
I totally agree with.
Yeah, sorry, go ahead.
Oh, I was just going to say I totally agree with Nick in terms of highlighting the program. I also think some programs say that because it creates a support structure that will offload the residency leadership to know that you'll be taken care of. And so if I know that you have family in Denver, I know that you're going to have people to help you get through a really challenging experience, which is residency. And so that may make me feel more comfortable bringing you here. If that's not the case, I think it's probably worth being explicit about that in your personal statement and saying, listen, I went to another continent for medical school. Like I have conquered these things. I feel comfortable in a new environment. And, I'm confident that I will succeed because I have shown my ability to adapt and be resilient. And maybe that checks that same box for the program directors that, you know, your mom being down the street checks. I think that is probably one of the things. There are numerous biases that probably contribute to the kind of the issue that some programs may have with IMG applicants, but that's probably one of them, which is like, well, how are they going to plug in? How are they going to get in and for lack of a better term, like assimilate? And so being explicit about that and answering that question for people is probably worthwhile. I don't know, Mike, is that something you guys counsel?
Yeah, I have mixed feelings on it. So I think it's useful to have an icebreaker, so I can go to Nick and say, hey, Nick, you're a Cleveland Browns fan too. That must be tough, right? So that starts something. But I also think program directors and committees take it a little overboard because, you know, they say, why do you want to come here? It's because I want to train emergency medicine. You've got one of the spots. I mean, that should be sort of obvious. I mean, I think we're looking for a little bit too much validation. You know, if we're a profession that participates in something like the match, you know, like I mean, it's sort of we're losing control through that sort of anyways. But yeah, I think it's at best you can. When I advise the students, I say, you know, give me something that I can take to them, like you have family in the area, like some connection that I can open when I contact program directors and stuff for you.
A couple of things you could throw out there too that I've heard. So we've had a couple of IMGs that have been at our program. Just so like one of the benefits that one of them had a personal connection, one did not. Was like, oh, well, you know, it's like I don't have any family or particular friends in the area, but you know what? The cost of living where you are at is low, and I can get on a plane and get to an international airport in 2 hours in any direction. And so this is an easy place for me to live. The cost of living is low. And then when I have time to go visit family on vacations, that's what I'll do. Kind of a thing. We're like, okay, cool. That sounds fair. Kind of a thing. So it doesn't have to only be curriculum or like knowing, having friends or family. It could be that your hobby that you love is easy to do in this area. It could be that's just location of the country you're super interested in living in the future. And so you want to get to know the region, the type of patients you would take care of. Any of those things would be specific reasons to go to a place. But it shows me that you sat down and thought about it for at least a hot second, as opposed to, I like emergency medicine and I heard you like emergency medicine too. That's the worst emails to get because they're just so generic. So did you invest any time whatsoever in thinking about this process? What I like to see is the end site, because that tells me that you've thought about it, you've done some work, you've looked. Someone who's done that amount, I'm much happier to talk to, as I know I'm going to be able to have an interaction with them that's more valuable.
Those are really great advice. Thank you so much for all these tips. I have one more question, if you don't mind, and that's about like the MSPE letter. Unfortunately, my medical school provides a very generic letter, which is like max 2-page, and I have been trying a lot to make this letter like more personalized, but that's not something that they do, and I'm not sure how to overcome that weakness in my application.
Well, I think you can overcome it by things that residency training programs find more important. So Gannon, you had kind of a list of what's important to residency program directors, and that is your performance on your away rotation, your performance on your clerkship, your step 2 scores. I mean, those things come typically in the literature I've read and the people I've talked to over the MSPE. In fact, there's a lot of discussion in academic circles about the value or lack thereof of the MSPE. A lot of educators say it's written in code by deans who want to match their students. And I think your ranking within your medical school, we call it cluster. Program directors look at that, and if you're in the lowest cluster, that's probably a red flag. But at the same time, I don't know how important that is, and I think, you know, in contrast to what you said, I think you can overcome it by a lot of other things, like, you know, standardized test scores, your performance on your clerkship, your slows, your extracurriculars, you know, research, things like that. So if it's something you can't control, then it's probably not worth trying to control it. That would be my thought.
I think particularly that personalized part of your dean's letter. So a number of schools are similar in the US, and there's huge variability in terms of how much people write. It is a place that I look for distinguishing characteristics. And it's another place that somebody can say, this applicant is great because of X, Y, or Z. So if your school's not going to do that, just make sure that those distinguishing characteristics are present in your personal statement, and that you kind of call yourself out for those things. It's not a huge loss, to be honest.
Yeah. You would potentially have the option of someone who's writing a letter of recommendation from you for your time in medical school could potentially, you know, talking to them about trying to include anything that's objective as far as if you have a ranking within your medical school, any type of standardized testing that compares you to peers, that's always helpful. The biggest issue a lot of residencies run in with IMGs is it was like, I've got US medical students here. I'm very familiar with them. I know what all their data means. I know roughly what this would probably look like when they come to train to me. And then when I look at an IMG student, I got none of that data. I'm like, I don't know. Like I got Apple and I don't know what this is. And so anything that you can give them that's kind of objective, they can use in some way, shape, or form to compare across the board is helpful. You will never get all the data points because that's probably not how it works. But if you can get a couple, they'll be able to use that. I just don't know. It would depend on each of your individual kind of what you have access to as to what kind of data points and or comparisons you could get that you could provide to people. So, if you wanted an easy medical knowledge one, try and take the emergency department shelf exam. If you can get an EM rotation, either the SAEM one or the NBME one that has some national data that you could compare across the board with peers who are going either through the osteopathic or allopathic track in the United States. But it also depends on if you're able to get a rotation set up, yes or no. So.
Thank you very much. These are advices that there was no other way that I could get, and I really, really appreciate them.
Well, we really appreciate, I think we're at time, and but we really appreciate your participation. And, you know, I'm sure there's an evaluation you could fill out. If you could do that, that would be great. We look at those to try to improve kind of the content. And actually, this is the first time I think we've done these little targeted breakouts. And so hopefully, you know, when we're back in person next year, you know, we can all sit around a table and discuss these things. So thanks, Amy, for joining us. I think
no problem.
I always learn new things when I do this from other people. So I picked up some advising tidbits throughout the day for sure. But thanks a lot, guys. And, you know, you can reach us through social media or through the SAEM website, or, you know, our email address is Gannon put his on there. I'll put mine real quick. But we're happy to kind of be available to you. So I guess we'll adjourn then.